try to get TV on here. Yes. Welcome back, ladies and gentlemen. Sorry for the delay which happened right now, and we are back just one day away from the exam, and we are ready for the Maha chanting Dhammaka live on YouTube. Oh my God, so many people are waiting from so long, so we are finally ready for that. Oh my God, क्या बात है. Namaskar. All the people from Kashmir to Kanyakumari, from Northeast to Gujarat, everyone is welcome. आज पढ़ाई दिल से करेंगे मेरे यार. वो कहते हैं दिल धड़कता है मेरा आपके आ जाने से, आपके आ जाने से. क्या बात है. 8:54 आर लाइव धमाका. ये ओ ये ओ ये ओ ये. So what is about the today's plan? Let me discuss with you guys. Plan is like this. I have a paper about the plan. Today we will starting with the paper 2, where we'll be completing the surgery, OBG, ophthalmology, ENT, pediatrics, anesthesia, psychiatry, derma, ortho, radio. These subjects we will be completing, and then we will be switching to paper 1. If it is completed today, well and good. Otherwise, we'll be taking it tomorrow. Plan is clear. Love you all. Keep on saying, I will pass, I will pass, I will pass. Yes. जोश ठंडा नहीं होना चाहिए दोस्तों. बिल्कुल गरम जोशी के साथ. Love you all. Chalo, let's start something known as surgery. Very quick, Maha chanting. Are you ready? 3, 2, 1, start. Vascular surgery. Sir, most common cause of blockage in the artery A for atherosclerosis. Most common cause of blockage in the arteries. 1000 alive. क्या बात है. Most common cause of blockage in the arteries, sir, it would be atherosclerosis. And intermittent claudication. Pain is felt is काफ मसल ऑन वॉकिंग. चलने पे दर्द होगी तो क्या है. इंटरमिटेंट क्लॉडिकेशन. मोस्ट डिफिकल्ट पल्स टू फीड वुड बी योर popliteal pulse. Sir, catheter used in the vascular surgery. If someone asks you which catheter is used in the vascular surgery, sir, your great answer would be Fogarty catheter. It would be Fogarty catheter. Now, sir, this is an image-based question of 2019 exam, ankle brachial pressure index. Guys, remember, this is an image-based question of ABPI. It is a systolic pressure upon ankle upon systolic pressure on arm. Systolic pressure on ankle, systolic pressure on arm. This is your ABP. Then coming to 100% exam question on 4th of June. Even you can take screenshot of this. This is your none other than Burgess disease. That is happening because of what? Excess smoking. And who are the excess smokers? Male or female? Yes, sir. Your correct answer is male are the excess smokers. Burgess disease, also known as thromboangiitis obliterans. Thromboangiitis obliterans. And treatment is quit the smoking. Sir, if you not quit the smoking, there will be a gangrene, and gangrene you have to do an amputation. This is a treatment of Burgess disease, thromboangiitis obliterans. Thromboangiitis obliterans. Done. 95% male and smoker. Thrombosis, thrombophlebitis, small to medium vessels are always involved in this. It never involved the lymphatic. The Burgess disease never involved the lymphatic. Burgess disease never involved the lymphatic. Sir, remember, two places in a surgery where you will see a constitutive appearance. Number one is your angiography of the Burgess disease, and number two we have seen in the esophagus, that is diffuse esophageal spasm. There it is seen on the barium swallow, but here on the angiography it is seen on the corkscrew appearance. Done. 1200 people are live. Love you all. आज धमाका करेंगे. आज देखते हैं हमें कौन रोक सकता पास होने से. We all are together in this fight. सर, रेनॉल्ड डिजीज क्या होता है? स्पैज्म ऑफ आर्ट्रियोल्स ऑन कोल्ड एक्सपोजर. कलर सीक्वेंस याद कर लो. white, blue, red. The color sequence is white, blue, red. The color sequence is white, blue, red. Done. Sir, remember 5 P's of embolism. You have to remember 5 P's of pain, pallor, pulselessness, paresthesia, pie, kilotherm. Pain, pallor, pulselessness, paresthesia, and pykilothermia, which is a standard thrombolytic agent, sir. Which is a standard thrombolytic agent, sir. Now your answer is tissue, plasminogen, and activator. Now coming to the 100% exam question, that is your varicose vein. That is your varicose vein. Abnormal dilatation and tortuosity of the superficial vein. What is happening? Our blood is going from superficial vein to deep veins. Guys, remember there are perforators present over there, and there are the valve present over there. If there is a valvular incompetence, it can lead to pooling of blood in the superficial vein, and that might lead to the varicose vein. That might lead to a varicose vein. And guys, remember 1300 people are alive. Most important is your valvular incompetence. So varicose vein. Remember, most important is valvular incompetence. If someone asks you most common valve involved in the varicose vein, sir, so your direct answer is sphenofemoral valve. Your direct answer is sphenofemoral valve. Now, clinical feature, if someone asks you aching discomfort in the core, is a clinical feature of varicose vein. Sir, about the clinical examination, guys, remember, it is your Brody-Stendelberg test, which is done to check the valvular incompetence. Brody-Stendelberg test is done to check the valvular incompetence, or you can put a tourniquet and you will see all the veins are now prominent. Sir, coming to next test, that is your tourniquet test. Investigation of choice is always duplex imaging. Now, treatment, if someone asks you what is the treatment of varicose vein, so directly you will go for the Trendelenburg operation. And also stripping of the great saphenous vein. In the perforator incompetence, valvular incompetence, Trendelenburg operation. But if there is a perforator incompetence, sir, you will go for the no voice. Who said no voice? Voice is there, yaar. Don't ऐसे मुझे तड़पाओ मत, please. Voice आ रही है. Voice is there ना. Ladies, gentlemen, friends and best friends. Voice is there. दिल से सुनो आज, दिल से. ठीक है? Sepsis, subfacial endoscopic perforator surgery. Then coming, sir, deep vein thrombosis. Then coming, sir, Lata Mangeshkar ऐसी आवाज है भाई अपनी. Deep vein thrombosis. There is a very famous triad in the deep vein thrombosis, which is very important for you. Endothelial damage, stasis, hypercoagulability. Sir, most common site is calf vein, deep vein thrombosis, or most common cause पता क्या है? Prolonged immobilization. If you not move from your bed, if you not move your limbs, it can lead to a disease known as deep vein thrombosis. Sir, there is a very important sign over here. Please listen to me very, very carefully. It is Homan sign. It is your Homan, resistant on dorsiflexion. Sir, this is plantar flexion. This is dorsiflexion. When you are not able to do the dorsiflexion, there is a resistance. This is known as Homan sign, and this is seen in deep vein thrombosis. Done. Now, Moses sign. On squeezing the calf muscle, you will feel a intense pain. That is known as Moses sign. Sir, एक Homan है, one is Hammond's crunch. That is seen in Boer-Harvey syndrome. Never ever confuse between the Homan and the Hammond. Sir, investigation of choice, always for the vascular investigation, always go for the duplex imaging. That is your Doppler, color Doppler. Treatment. Now, cause is also immobilization, and the treatment is also immobilization. Why immobilization? Because now thrombus can lodge into your inferior vena cava, and it can come into your heart, which can make you die. To stop that, you have to again ask patient, please don't move, and also simultaneously you have to start a low molecular weight heparin. साथ में heparin देना, ताकि क्या हो सके, क्लॉट को तोड़ सके. बाय चांस तुम्हें बिल्कुल सेफ्टी इंश्योर करनी है, तुम रास्ते में एक फिल्टर लगा दोगे, so that if the clot is lodged also na, it is stuck in between. That is why inferior vena cava filter. Done. This is not that important, you know. Disaster management, just remember who start the disaster management. Sir, remember your paramedical staff is the first one to start the simple triage. Now, emergency severity index is assessed by the doctors in the hospital. Glasgow Coma scale, already video is there on the YouTube. Okay, you can watch that. Head injury is very important. Anterior cranial fossa will lead to raccoon eyes or panda eyes. Ni hao fangyo. All the graduates from China, they all have watched the panda. So this is raccoon eye or panda and eye. It is seen in anterior cranial fossa fracture. उसके बाद क्या है? Middle cranial fossa. It is a battle sign. Middle cranial fossa में क्या देखने मिलेगा? Battle sign. क्या देखने मिलेगा? Battle sign. Dun. Hematomas, sir. Very important hematomas. Just remember. सबड्यूरल सबसे पहले क्या है? सबड्यूरल में सिकल शेप हेमाटोमा एंड देयर इज अ इंजरी टू द ब्रिजिंग वेन. कैसे याद करोगे? सबड्यूरल को सबको जाना है नदी के पार और किसके थ्रू जाना है? ब्रिज के थ्रू. दैट इज व्हाई सबड्यूरल इट इज ब्रिजिंग वेन. सबड्यूरल इट इज ब्रिजिंग वेन. नाउ आया एक्स्ट्राड्यूरल इज ई फॉर इडली. 100% एमसीक्यू ऑन 4th of June. जवान ले लो मेरी. 4th of June there is a 100% MCQ EDH या SDH में आएगा. ठीक है? EDH guys remember idli shape and there is an injury of middle meningeal artery and there is a lucid interval seen, and in forensic medicine it is your M'Naughton's rule IPC 84. Dun. Now sir, investigation of choice guys, remember management of head injury. To reduce the intracranial pressure you will always use a mannitol and diuretic. For example, a patient of head injury is coming to you. To reduce the intracranial pressure, that is the first priority. You will go for the mannitol and the diuretics. Mannitols and the diuretics. Done. So now chest and abdominal trauma. One question has been asked from this. Remember, investigation of choice for facial trauma. क्या है हमारी investigation of choice? Orthopentomogram. It is your orthopentomogram. So now neck trauma, most dangerous zone. Also exam question. Zone 2 is the most dangerous zone. Sir, investigation of choice for neck trauma would be CT angiography. Now investigation of choice for head trauma का investigation of choice NCCT. Now investigation choice for neck trauma would be your CT angiography. Now sir, chest trauma, most common part injured would be left side rib number 4 to 9 because this is more prominent place, and investigation of choice again CT angiography. So what I want to tell you, head injury NCCT, face is orthopentomogram, neck is CT angiography, and chest also CT angiography. Done. Sir, tension pneumothorax. What is happening in tension pneumothorax? Your air is going inside and that is getting trapped over there. In such condition, you have to do a immediate intervention, that is tube thoracotomy or needle thoracotomy. In that cases, remember, in children, you will go from the second midclavicular line, and in adult, you will go from the fifth axillary line. Fifth mid axillary line. Done. Sir, flail chest has been asking you exam. That is why it's very important. 2 or more than 2 consecutive rib fracture at more than 2 sites. It is your flail chest. Now abdominal trauma. Many time question has been asked and many of you are confused. From now you will never confuse. सबसे पहले ब्लंट ट्रॉमा में क्या फटा? सबसे पहले स्प्लीन. ब्लंट ट्रॉमा में क्या इंजरी हुई? स्प्लीन. नाउ पेनिट्रेटिंग ट्रॉमा सर, रिमेंबर इट इज नन अदर देन योर लीवर. सर, सीट बेल्ट इंजरी इट इज योर मीजेंट्री. सीट बेल्ट इंजरी इट इज योर मीजेंट्री. एंड ब्लास्ट में सबसे पहले क्या फटता है? आई नो, ब्लास्ट में सबसे पहले क्या फटता है? टेम्पैनिक मेम्ब्रेन. पर रियल लाइफ में कुछ और फटता है कि नहीं? टेम्पैनिक मेम्ब्रेन. सर गाइस रिमेंबर, फास्ट एंड ई फास्ट. फास्ट और ई फास्ट में व्हाट इज द मेन डिफरेंस प्रेजेंट ओवर हियर? गाइस रिमेंबर, ई फास्ट आल्सो टेल्स अबाउट द thoracic cavity. Rest everything is same. E-fast is slight modification of the fast. In fast, you will see what? Right hypochondrial, liver, spleen, kidney, pericardium, everything, peritoneum, but you will not see a thoracic cavity. But your E-fast will show you what? Thoracic cavity also. Done. Sir, remember, ब्लड लॉस की बात करेंगे. ब्लड लॉस में प्राइमरी क्लास 1 लेस देन 15, क्लास 2 15 to 30, क्लास 3 30 to 40, क्लास 4 मोर देन 40. क्लास 1 लेस देन 15, क्लास 2 15 to 30, क्लास 3 is 30 to 40 एंड क्लास 4 इज मोर देन 40. सर रिमेंबर, बेस्ट मेथड ब्लीडिंग रोकने का बेस्ट मेथड क्या होता है? जस्ट रिमेंबर, ब्लीडिंग रोकने का क्या होता है? प्रेशर. यू हैव टू पुट अ प्रेशर लाइक दिस एंड द ब्लीडिंग विल स्टॉप. स्टोरेज टेम्परेचर ऑफ द ब्लड, मेनली आई एम टॉकिंग अबाउट द PRBC. सर इज 4 + -2. नाउ fresh frozen plasma storage temperature, it is -18 degrees Celsius. Done. Then coming to the wound. Sir, cold burn is frostbite. And most common day-to-day life, it is scald because of hot liquid. And most common burn in the hospital, it is thermal burn. It is your thermal burn. Most common in the hospital would be your thermal burn. Sir, investigation compartment syndrome. Sir, compartment syndrome, what is happening? Under the skin, there is a negative negative pressure. Because of this negative pressure, there is an intense pain. There is a intense pain, and this is a surgical emergency. And in this, you will see a ischemia known as Waxman ischemia. And in such cases, you have to do a urgent fasciotomy because you have to release the negative pressure under the skin. Negative pressure under the skin. Under the skin. Guys, remember, now this is not that very important. Treatment of choice for keloid. First of all, I want to ask you about the keloid. Keloid is more. Ke से क्या काला? तो क्या बोला? हम काले हैं तो क्या हुआ दिल वाले हैं, हम तेरे 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 चाहने वाले हैं, हम काले तो क्या हुआ दिल वाले हैं. दोस्तों ध्यान रखना, कीलॉइड काला है, स्किन से ज्यादा कीला कौन है? कीलॉइड. इसकी 3 फेवरेट साइड है, पिन्ना, शोल्डर एंड स्टर्नम. दन 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 दन. एंड व्हाट इज द ट्रीटमेंट ऑफ कीलॉइड सर? इंट्राकीलॉइड इंजेक्शन ऑफ ट्रांसएम्सिनोलोन. इंट्राकीलॉइड इंजेक्शन ट्रांसएम्सिनोलोन. डन 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 डन. नाउ सर, मोस्ट कॉमन कॉज ऑफ immediate death. Remember my words. Most common cause of immediate death in the burn patient would be because of suffocation. It is because of suffocation. Most common cause of early death in the burn patient is because of early hypovolemia. Immediately suffocation होती है, early तुम्हारा क्या था? Hypovolemia. And late cause of death would be sir sepsis. It would be a sepsis. Sir, most common infection in the burn patient. Sir, most common infection in the burn patient would be your pseudomonas. Would be your pseudomonas. And percentage of burn in the adult, it is calculated by adult रखते हैं जेब में wallet, तो rule का नाम है Wallace rule. And also PAM rule. Always remember, adult it is Wallace rule and PAM rule. और बच्चे कैसे होते हैं? लाडले लड्डू जैसे गोल गोल, क्यूटी पाई, पू 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 पू. Lund and Browder chart. Lund and Browder chart. Lund and Browder chart. Now, degree of burn, sir, and the structure involved, which is very, very important. You have learned over here. Primary burn, it is only epidermis gone. Secondary burn, dermis gone. Third degree burn, epidermis, dermis, subcutaneous fat. And fourth degree, sir, epidermis, dermis, subcutaneous fat plus muscle and bone. Muscle and bone. Muscle and bone. Dun 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 dun. दोस्तों देखो, with folded hand, if I'll decrease my speed, this is a big list of subject and time is less. Please. ठीक है, आराम से भी कराया मैंने पहले, बिकॉज वी वर हैविंग टाइम. नाउ टाइम इज नॉट देयर, दैट इज व्हाई आई हैव टू स्पीड अप, बिकॉज यू नो दीज थिंग्स ऑलरेडी. परसों तुम्हारा एग्जाम है, यू ऑलरेडी नो दीज थिंग्स. जस्ट द क्विक लिसनिंग प्रोसेस वी आर गोइंग थ्रू. दिस इज अ महा चैंटिंग, नॉट अ नॉर्मल चैंटिंग. प्लीज आई रिक्वेस्ट विद द फोल्डेड हैंड, प्लीज डोंट इंटरवीन इन दिस, बिकॉज यू ऑलरेडी नो. परसों एग्जाम में तुम्हें ये पता है चीजें कि क्या क्या इन्वॉल्व होता है. दिस इज नॉट अ नॉर्मल क्लास, अदरवाइज मैं सुबह 4 बजे तक भी लगा रहूंगा. आई विल नॉट बी एबल टू कंप्लीट एनीथिंग. ठीक है, ठीक है. मिनिमम टाइम, मैक्सिमम डिलीवरी, व्हाट आई हैव टू डू टुडे, otherwise I can take 10 hours also. Total chanting in NLC, I take one batch of more than 100 hours. More than 100 hours I teach there. But YouTube, there is limitation of time now. That is why it is happening. I'm very sorry for that. Okay, so I'm taking class from 7 a.m. in the morning, and in NLC 7 a.m. in the morning we stopped at 1:30. We completed 7 subjects. Okay guys, so please be with me. Stay strong. Okay, blister formation. Now sir, okay, I'll repeat for you guys. Degree of burn and the structure involved. Primary burn, it is only epidermis. Secondary, it is epidermis and dermis. Third degree, epidermis, dermis, subcutaneous fat. Now, fourth degree, sir, there is involvement of muscle and bone. Fourth degree, there is involvement of muscle and bone. Now, one question, please remember. Blister formation is seen in secondary burn. Capillary filling is seen in primary burn. And pain is absent in third and fourth degree burn. Sir, remember, pain is always absent in third and fourth degree. ठीक है, थर्ड एंड फोर्थ डिग्री बर्न में दर्द नहीं होती, क्योंकि यहाँ पे nerves endings are not present. Nerve ending was present also epidermis and dermis. That is why third degree and fourth degree are painless burn. It is a painless burn. तो क्या बोला? दर्द दिलों के कम हो जाते, मैं और तुम घर हम हो जाते, कितने हंसी मौसम हो जाते, मैं और तुम घर हम हो जाते. बट एग्जाम से पहले वो पॉसिबल नहीं है. चलो पढ़ाई करें, एग्जाम का पास करें. Guys, next coming to the Parkland formula. That's coming to the Parkland formula. Calculation of fluid. Guys, remember, 4 into percentage of burn into weight in kg. Nowadays it is not used, but still it is written. I'm telling you, 4 into percentage of burn and percentage of burns in the adult, it is Wallace rule or rule of Palm rule, and in children it is Lund and Browder's. Done. Sir, how you will monitor the fluid resuscitation? If you are giving someone a fluid, how you will remember, how you will come to know that I'm giving fluid, that is right or not, it is more required or less required? Sir, the only indicator and the exam question is your urine output. It is your urine output. Now, indication of giving IV fluid. Children, if body surface area involvement is more than 10, then you will give IV fluid, and in adult, if it is more than 15, then we will give the IV fluid. Done. So next topic is hernia. Yes, are you guys enjoying? Just give me a thumbs up, and we are done. Guys, remember, abnormal protrusion through the weak wall. What is hernia? Hernia क्या होता है? Abnormal protrusion through the weak wall. Abnormal protrusion through the weak wall, and most common is your inguinal hernia. I'll make you hernia that simple for you. कभी जिंदगी में नहीं भूलोगे और एकदम love you वाला hernia याद करेंगे दोस्तों. Most common it is your inguinal hernia. Sir, most common it is your inguinal hernia. And female, F for female, F for femoral. Dun. Female में most commonly femoral. Young males are very indirect people. They don't say things directly. अच्छी लगती है, अच्छी बातें करती है, पर कह नहीं पाते, indirectly है. तो young males are indirect inguinal hernia, और elderly are very direct. अरे बेटा क्या करते हो, पढ़ते बढ़ते नहीं हो क्या? Elderly males are very much direct. So direct inguinal hernia, that is your direct inguinal hernia. Sir, landmark is very important. घर का भी होता है ना, स्विगी पे ऑर्डर करते हैं landmark. इसी तरीके से दोस्तों hernia का भी landmark बहुत इंपॉर्टेंट है. Landmark to distinguish between the inguinal and the femoral. Inguinal and the femoral. Male and the female hernia, it is inguinal, and the femoral hernia, it is a pubic tubercle. Pubic tubercle. Public में male और female अलग अलग. Public में male और female अलग अलग, और जहां public नहीं वहां फिर don't. Guys, landmark to distinguish indirect from the direct means youngs and elderly. It is inferior epigastric vessel. It is inferior. Youngs are always inferior to the elderly. They have to do like this. Namaste, Jai Ho, Assalamu Alaikum, Sat Sri Akal, dun. Most common hernia to strangulate. Most common hernia to strangulate. मोस्ट कॉमन हर्निया टू स्ट्रैंगुलेट. फीमेल बड़ी एक प्यारा जेंडर है, वो अपनी सारे गमों को ना अपने अंदर छुपा के रखती है, कभी भी सामने नहीं आने देती, और जब सामने आती है तो सामने वालों को फिर टका खत्ता. तो मोस्ट कॉमन हर्निया टू स्ट्रैंगुलेट, इट इज योर femoral hernia. Most common hernia to strangulate, sir, it is a femoral hernia. Now, sir, indirect inguinal hernia, indirect young male wala, it protrudes through the deep inguinal ring. It protrudes through the deep inguinal ring. And remember, direct inguinal hernia protrudes through the transversalis fascia. Sir, transversalis fascia is present where? It is present in the Hasselbalch triangle. It is present in the Hasselbalch triangle. Guys, remember, nice classification. कौन सी classification? Nice classification. It is very important. नाइस क्लासिफिकेशन क्या कहती है? क्लास 1 एंड क्लास 2 इट इज इनडायरेक्ट इंग्वाइनल हर्निया. क्लास 1 एंड क्लास 2 इट इज इनडायरेक्ट इंग्वाइनल हर्निया. क्लास 3A, 3B, 3C. हाउ यू टू रिमेंबर? क्लास 3A इट इज डायरेक्ट इंग्वाइनल हर्निया. क्लास 3B, B for both, it is both direct and indirect hernia. And direct and indirect hernia is known as pantaloon hernia. It is known as pantaloon hernia. And C for cuteness, और cute कौन होता है? Female. Femoral hernia. And fourth for recurrent. For चौरसी आती है किसी की मरने के बाद तो क्या है? Recurrent. क्या है? Recurrent. Done. Sir, content is very important. ठीक है? Omentocele के अंदर what is a content? That is your omentum. That is your omentum. And who is a policeman of abdomen? Anatomy question. It is your greater omentum. It is your greater omentum. Sir, coming to the litter hernia. The content is Meckel's divertible. Litter, Meckel, litter, dun. Enterocele, intestine, enterocele, intestine. Amendis, appendix. Done. Richter circumference of intestine. Rich लोगों के आसपास circumference होती है, तो circumference और intestine would be your Richter hernia. फिर है मैडिल, मैडिल को उल्टा कर दो, एम को उल्टा कर दो, क्या बन जाएगा डब्ल्यू, एम को उल्टा कर दो, क्या बन जाएगा डब्ल्यू, डब्ल्यू लूप ऑफ इंटेस्टाइन, क्या है डब्ल्यू लूप ऑफ इंटेस्टाइन, डब्ल्यू लूप ऑफ इंटेस्टाइन. नाउ सर स्लाइडिंग हर्निया, most common sliding S, it is your sigmoid colon. Sliding hernia most common would be the sigmoid colon. Sir pantaloon, pantaloon is your indirect and direct, अभी पढ़ा था. Pantaloon it is your direct and it is your nice classification 3B. Pantaloon direct indirect, dun dun dun. Cooper's, Cooper's is inguinal plus femoral, Cooper is inguinal plus femoral, dun 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 dun. Gibbons, 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 hernia plus hydrocele, hernia plus Gibbon, hernia plus hydrocele, dun dun dun. Sir, remember one thing. First examine in the standing position, you will see cuff impulse is positive. Whenever person is coughing, the hernia is out. Cough karte hernia bahar, kyunki intra-abdominal pressure is increased. Now, how will it will reduce? When you ask that person to lie down, you will see that hernia is now reducing. That hernia is now reducing. Sir, there is a test known as 3-finger test or Simon test. 3-finger test or Simon. 3-finger or Simon. देखो 1, 2, 3. देखो Z भी कैसे बना, 3 डंडियों से बना, तो इसीलिए याद रखना 3-finger test और Simon test. Now sir, remember barrier you have to do, and barrier you have to use to compress that, to put it inside. That is your Prolene mesh. That is your Prolene mesh. Open surgery is Lichtenstein operation, and femoral hernia McAbdy and Lockwood. McAbdy and Lockwood. Now sir, treatment of choice for congenital. This is somewhere you have to very careful with it. Treatment of choice for congenital hernia and congenital hydrocele would be your herniotomy after the 3 years. Guys, remember congenital hernia or congenital hydrocele treatment is same. Congenital is the word you have to pay attention on. Congenital hernia, congenital hydrocele. Sir, your answer is herniotomy after 3 years. Now hernia is done, 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 done. Next topic is thyroid. थायराइड का वेट कितना है 25 ग्राम. कितना है थायराइड का वेट 25 ग्राम. दो तरीके के थायराइड होते हैं. आई विल मेक यू वेरी परफेक्ट विद दिस. लिंगुअल एंड थायरोग्लॉसल सिस्ट. Lingual thyroid and sir thyroglossal cyst. Thyroglossal cyst. Lingual, lingual देखो लिंग, लिंग किसका है मैन, लिंगुअल मोस्ट कॉमन है फोराम मैन. क्या है फोराम, लिंग मोर मैन, लिंग मैन, लिंग मैन, लिंग मैन. A link can interfere with the swelling. A link can interfere with the, चल तो याद, lingual thyroid can interfere with the swelling, also breathing, also speech. Again, yeah. You understanding? Naughty boys and girls, friends and best friends all over there. है सबसे खतरनाक कौन है? Who is most dangerous? Friend or best friend? Lingual thyroid. क्या है? Lingual thyroid. Lingual thyroid. Guys, remember, lingual thyroid can interfere with the swelling, breathing, speech. Now, thyroglossal cyst. Most common side is subhyoid. Thyroglossal cyst. Most common side is midline swelling, which actually move with the deglutination and also with the protrusion of tongue. Now this cyst is removing, it can also create a fistula, sir. So complication of thyroglossal cyst would be thyroglossal fistula and papillary thyroid cancer. Papillary thyroid cancer, you know, Samoma body, orphan eye nuclei. Yes, you are very much right. We will discussing about that. Dun 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 dun. Guys, now lingual. अब lingual, it is interfering with the swelling, it is interfering with the breathing, it is interfering with the speech. What you will do? You will destroy that lingual. You will destroy that lingual. Guys, destroy the lingual thyroid by medicine, thyroxine, radioisotope, iodine 131, and इनसे भी काम नहीं चले तो directly you will do, sir, what? Surgery. Now, drunk, sir. Then here is your thyroglossal cyst, subhyoid, and treatment is cyst trunk operation. Thyroglossal cyst treatment is cyst trunk operation, and lingual thyroid you have to remove this by medicine, by radiological ablation, or by the surgery. Dun 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 dun. Now sir, goiter. Goiter is enlargement of the thyroid gland. Goiter is something which is very important, because in exam mostly those questions are asked which are very, very commonly seen in the society. So sir, remember about the goiter: enlargement of the thyroid gland, enlargement of the thyroid gland, and most common causes iodine deficiency. Most common causes iodine deficiency. And stage, guys, remember, diffuse it is reversible, and nodular it is irreversible. Just give me a moment, just give me a moment. And diffuse is reversible, nodular is no, irreversible. Let's talk about that nodular goiter, which is irreversible, sir. So number 1 point over here is irreversible, and there is a cosmetic disfigurement. What is there, sir? There is a cosmetic disfigurement, and pressure symptoms are present. Means neck is enlarged, and it will be constricting your vessels, your esophagus. Whenever you are eating something, there will be flushing on the face. This is known as pressure symptom. Now treatment is something which has been asked in your exam, and there is a chances that it can be present on your 4th of June. So guys, remember, hemithyroidectomy, agar आधा काट दिया, half of it is cutted, this is known as hemi. If only 2 hills are left, subtotal. 2 hills are left, subtotal. If 1 hill is left, it is near total. If all the hills are gone, nothing left, it is known as total thyroidectomy. It is known as total thyroidectomy. Done, done. Sir, Pemberton test क्या होता है? बार बार हाथ उठाने पे मुंह अगर लाल हो जाए, this is known as Pemberton test. Guys, remember, this is a MCQ. FNAC never distinguish between the follicular adenoma and carcinoma. Now, something which is asked in the exam, and we are going to study in the pathology also, sir. Parafollicular C cell or medullary thyroid cancer. This is a question you have to take care. Medullary thyroid cancer, the tumor marker is serum calcitonin, and the treatment is surgery only. Now coming to the papillary and the follicular. Papillary and the follicular. Sir, remember, papillary and the follicular, very simple. A cause of papillary doesn't matter now what you have studied. Just remember something which is question, that is your pathology. Orphan eye nuclei and psammoma body. Orphan eye nuclei and psammoma bodies are seen in papillary thyroid cancer. And remember, papillary thyroid cancer is a complication of thyroglossal cyst. Thyroglossal cyst. Now sir, follicular. Follicular mein you will see Hurthal cell tumor, and the tumor marker for both papillary and the follicular would be your serum thyroglobulin. And the treatment is total thyroidectomy with the central lymph node dissection. Total thyroidectomy with the central lymph node dissection. Done. Sir, now coming to all of your favorite, breast. Done. Yeah. All of the people, breast ki hi khushi mein, I want to say you something. If you want any doubt, or if you want to share anything with me, I'm available on Instagram as a pjamwal7. Yes, abhi dekhte hain sabko. I'll be doing a follow back on Instagram, and let me see how many people are sending. Oh my god, many of them are sending requests right now. So guys, we'll be following each other on Instagram, so that further updates about the classes, batches, any motivational thing we can share with each other. Done. Oh my god, done. Many I'm getting. And now guys, isi khushi mein, let's start with the breast. Breast is a modified sweat gland. Oh no, modified sweat gland, breast. Yeah, but it is like that only. Sir, remember, oh my god, sir, remember, upper outer quadrant, most common site of breast cancer. So which is the most common site of breast cancer? It is the upper outer quadrant. It is the upper outer quadrant. Now sir, something known as Montgomery tubercle. Montgomery tubercle, you have to remember guys, a large sebaceous gland during the pregnancy and lactation. Pregnancy and lactation mein there is an enlargement of the sebaceous gland, and those are known as Montgomery tubercle. ये देखो, ऐसा लग रहा है निप्पल के आसपास में छोटे छोटे और भी निप्पल प्रेजेंट है, but these are not nipples. These are your Montgomery tubercle. Yes, guys, remember now. Me and my friend went somewhere and my friend has opened. मेरे दोस्त ने क्या करा, पर्दा हटाया, मेरे दोस्त ने पर्दा हटाया और वहां पे कोई ब्रेस्ट ही नहीं प्रेजेंट है। मेरा दोस्त बोलता अमेजिंग डॉक्टर पारस, इट इज अमेजिंग, नो ब्रेस्ट, इट इज अमेजिंग, it is amazing. Now I said don't worry, go to another room, and then he went to another room and he saw multiple breasts over there and he shouted polymesia. He shouted what? Polymesia. First of all, he was amazed. No breast, Dr. Paras, no breast. Amesia. Now, multiple breast is present. That is polymesia. Now he went to third room where there was no nipple present. It is an athelia. Dr. Paras, it's athelia. Breast is there, but no nipple is present over there. This is athelia. I said, very bad. Go for that fourth one. When he went to fourth one, there are the multiple nipples present over there. Multiple nipple is coming, and that is not polythelia. It is known as polythelia. Dun, 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 dun. So which one you like the most? Polythelia or polyamesia? Yeah, answer should be in the chat box right now. Might be a question in your exam. Now, sir, Poland syndrome. What is Poland syndrome? If your breast and the pectoralis major muscle is going to Poland for the honeymoon, this is known as Poland syndrome. गायब हो गए तुम्हारी breast और तुम्हारा pectoralis major. Pectoralis major. Dun 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 dun. Sir, next is Mondus disease. What is Mondus disease? Thrombophlebitis of the superficial vein of the breast and the chest wall. Mondus disease. Next क्या है? Mastitis and breast abscess. Mastitis. मस्ती की पाठशाला, मस्ती की पाठशाला, मस्ती की पाठशाला, ला ला ला. मस्ती की पाठशाला. Yes, yes, yes. Mastitis, sir, most common cause is lactation and pregnancy. And this is your previous year MCQ. How this abscess is happening on the breast? Because baby's mouth is having staph aureus, and staph aureus is the most common cause of mastitis and breast abscess. Dun 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 dun. Now, sir, discharge from the nipple. The most common discharge would be milk. Most common discharge would be milk. Pathological, it is serous. Green is something duct ectasia. You need to know about the green discharge. This is very important. Bloody discharge, most common cause would be duct papilloma. Most common cause of the bloody discharge would be duct papilloma. Second most common cause of bloody discharge would be duct carcinoma. Papilloma is first. Papilloma is first, then carcinoma. Sir, done, done, and done. Now, sir, amazing. That is your duct ectasia. Something we have to study. That is your duct ectasia. And remember, green color discharge was coming from the duct ectasia. Remember, most common it is smoker, alcoholic. And smoking and alcoholic. If a female is pregnant, she should not smoke. She should not have alcohol. If she is doing so, there will be dehydration. And because of dehydration, there will be green discharge coming from a breast. And the female would be jumping to you. डॉक्टर साहब ये देखो हरा हरा निकल रहा है। मैंने कहा टेंशन मत लो, बैठो यहाँ पे, मैं रिलीज कराऊंगा, मैं इससे तुम्हें इजाजत दिलाऊंगा, मैं तुम्हारा इलाज करूंगा, बिकॉज मेरा नाम है डॉक्टर चुनमुनगुन. Guys, remember, most common area would be multiple lactiferous duct. No problem. How I will treat? पहले तो फीमेल को पहले पानी पिलाओगे, plenty of fluid. उसके बाद क्या करोगे? ब्रेस्ट मसाज. उसके बाद क्या करोगे? ब्रेस्ट मसाज. उसके बाद भी अगर ठीक नहीं होता, आई विल गो फॉर द माइक्रोडॉटमी. अगर माइक्रोडॉटमी से भी सीख नहीं होता, आई विल गो फॉर द हैड फील्ड ऑपरेशन. आई विल गो फॉर द हैड फील्ड ऑपरेशन. हैड फील्ड ऑपरेशन. डन डन डन. नाउ सर, फॉर द ब्रेस्ट कार्सिनोमा वी आर हैविंग अ ट्रिपल असेसमेंट व्हिच इज वेरी वेरी इंपॉर्टेंट एमसीक्यू, एंड द निमोनिक इज CRP. सर, निमोनिक इज CRP. ट्रिपल असेसमेंट इज फॉर द ब्रेस्ट, क्लिनिकल, रेडियोलॉजिकल, पैथोलॉजिकल. क्लिनिकल, रेडियोलॉजिकल, पैथोलॉजिकल. नाउ सर, lump. Remember, most important thing is fibroadenoma. Most common benign tumor of the breast would be fibroadenoma. Sir, breast में एक mouse is present there, and mouse love to go from this place to there. That means freely mobile lump. That is freely mobile lump, and mouse loves to eat popcorn in the breast. That is why on mammogram you will see what, sir? Popcorn calcification. You will see, sir, what? Popcorn calcification. Guys, remember, if a female is less than 30, you will go for the conservative management, and if it's more than 30, you will go for the excision. This is a most common benign tumor of the breast, and the name is fibroadenoma. The name is fibroadenoma. डंडना 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 ड. ठीक है, चलो. उसके बाद है सिस्टोसार्कोमा फॉइलिडिस. दैट इज नोन एज फॉइलिडिस ट्यूमर. आप ब्रेस्ट के ऊपर ऐसे लगता है जैसे कद्दू उग गया, इतना बड़ा कद्दू लग गया हो. दैट इज नोन एज फॉइलिडिस ट्यूमर. Stromal hyperplasia, and you have to do the wide excision. तो क्या बोला? कद्दू कटेगा तो सब में बटेगा. डाडा 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 डाडा. Now coming to the breast cancer, sir. Breast cancer में जीन होता है BRCA1, BRCA2. BRCA1, BRCA2 both are present in female, but in male only one is present, that is your BRCA2. Now sir, what you have to remember is nothing but you have to remember this clinical feature. Breast lump is present in the breast carcinoma, then there is a dimpling of skin and pudy orange appearance. This is something which is very important, and the name is pudy orange appearance. This is due to blockage of subdermal lymphatic. This word you should never forget. It is due to blockage of subdermal lymphatic. Subdermal lymphatic, pudy orange. देखो संतरे लग गए, ऐसे कैसे संतरे उग गए ब्रेस्ट के ऊपर, ये किस में होता है? ब्रेस्ट कार्सिनोमा. किस में होता है? ब्रेस्ट कार्सिनोमा. सर रिमेंबर नाउ, most common blood spread would be lumbar vertebra through the Batson's plexus. Most common spread would be lumbar vertebra through the Batson plexus, and remember most common lymph node involved would be axillary lymph node. Sir, investigation of choice for the breast carcinoma, it is true cut biopsy. Investigation choice for the local staging would be MRI, metastasis, PET CT, and bone metastasis, bone stent. Simple. About the tumor size, T1, sir, T1 it is less than 2 centimeter, T2 2 to 5 centimeter, T3 more than 5. Less than 2 T1, 2 to 5 T2, more than 5 it is T3. T4 is further divided to A, B, C, D. A for chest wall involvement, B for skin involvement, C for both chest wall and skin involvement, and D for inflammatory. So treatment part is very important. Please pay attention to it. Okay, guys, remember. Yes, Richard, prostate cancer also spread through the Batson plexus to the lumbar vertebra, and there is osteoblastic activity seen. Now come back to here. Surgery, it is best conservative management, and to remove the tumor, you have to take an incision from 1 mm. Done. Then if there is a axillary lymph node involvement, in that case, sir, you will go for the modified radical mastectomy. Means you have to also remove the lymph node because lymph nodes are positive. Done. Then, sir, chemotherapy, the drugs are erythromycin and cyclophosphamide. For the breast carcinoma, chemotherapy drug would be your okay? Drug would be erythromycin and cyclophosphamide. Hormonal therapy, premenopausal, you have to give tamoxifen. Premenopausal, you will give tamoxifen, and sir, postmenopausal is anastazole. Postmenopausal would be anastazole. Target therapy, when you have to give, only you have to give once your HER2 gene is positive. HER2 gene is positive, and that is your trastuzumab. You have to give trastuzumab. And remember, if sentinel lymph node biopsy is positive, what you will do? If sentinel lymph node biopsy is positive, sir, you will remove the lymph node. Now, immunohistochemistry distribution, this is slightly highly important. Sir, estrogen, progesterone and HER2 estrogen, progesterone and HER2 estrogen, progesterone and HER2 estrogen, progesterone and HER2 estrogen, progesterone, HER2. Sir, guys, remember, luminal A is having the best prognosis, that is ER/PR positive, HER2 negative. ER/PR positive, HER2 negative. Luminal B for भरा हुआ मतलब सारे के सारे positive. ER/PR HER2. Now, sir, HER2 enriched NAM itself is telling you only HER2 is positive, rest everything is negative. Basal triple negative. Basal क्या है? Triple negative with the worst prognosis. So this completes our breast. Done. Have a nice water, and let's start with the testy. एक एनर्जी ड्रिंक लगा, ठीक है. टेस्टिकुलर टॉर्शन, गाइस रिमेंबर, रोटेशन ऑफ टेस्टिस. क्या है? रोटेशन ऑफ टेस्टिस, एंड मोस्ट कॉमन एजेस 12 to 20 ईयर. मोस्ट कॉमन एजेस देयर, दैट डजंट मीन आपके अंदर नहीं होगा रोटेशन ऑफ टेस्टिस. गाइस, मोस्ट कॉमन कॉज ऑफ रोटेशन ऑफ टेस्टिस इज हाई इन्वेस्टमेंट ऑफ ट्यूनिका वैजिनालिस. High investment tunica, and there is a bell clapper. Bell clappers deformity. There is a bell clappers deformity, sir. So remember something, clinical features: sudden severe pain in scrotum, and there is a low grade fever. If there is a twisting of testis, rotation of testis, it is male knows better. उससे ज़्यादा दर्द, ब्रेकअप पे भी इतना दर्द नहीं होता जितना टेस्टिस के घूमने से दर्द होता है. So guys, remember, clinical test means Fern test is negative. Fern test is negative in torsion. Elevation of torsion relieve the pain. That means Fern test is positive, and this is seen in epidermoorchitis, and Fern test is negative in testicular torsion. It is negative in testicular torsion, and epidermoorchitis Fern test is positive. Then mean elevating the testis will relieve the pain. Epidermoorchitis हो गया, तुमने अपने दोस्त को बुलाया, बेस्ट फ्रेंड को बुलाना है, भाई इधर आना, जरा दर्द हो रहा है, उठा के रखो. Guys, always remember the confirmatory test would be your color Doppler. अगर तो 12 से 24 घंटे के अंदर अंदर आ जाते हो तो टेस्टिस जिंदा है, उसको बचा लेना है रिमूव करके, इट इज फाइन. If 12 to 24 hour has happened and testicular is torsion, it will die. Now your testis will rest in peace. Testis मर गया. क्या बोले? टेस्टिस मर गया, बेचारा टेस्टिस मर गया. डन डन डन. Next guys is varicocele. Guys, varicocele, just remember, vag of worm appearance. कैसी है? Vag of worm. Just this word is a clinical. This just remember this thing. Just remember this thing. Testis, guys, remember, most common left sided. Why left sided? It is because of anatomy. Testicular vein, left testicular vein is draining into left renal vein, and if there is a renal cancer, it will lead to varicocele. There is a bag of worm appearance. Guys, remember, treatment would be sclerotherapy. Which sclerotherapy agent you will use here? It is ascarol. You will use what? Ascarol. Now the surgical management, varicocelectomy. The surgical management is varicocelectomy. Thank you. Varicocelectomy. Now sir, hydrocele, as you already know, congenital hydrocele, the treatment is herniatomy. The treatment is after 3 years. Now hydrocele. Sir, what is happening? There is an excess collection of fluid here, and trans-illumination test is positive. ट्रांस एलिमिनेशन टेस्ट इज पॉजिटिव, मतलब टॉर्च लगाई और आर पार क्या दिखने लग गया तुम्हें? आर पार क्या दिखने लग गया? वो लाल लाल हो गया पूरा का पूरा. दिस इज नोन एज व्हाट? This is known as what? This is known as hydrocele, and most common cause of hydrocele would be filariasis. Yes. Now sir, what is the treatment? Treatment of choice would be eversion of sac by Jobulus operation, and investigation of choice USG scrotum. Investigation of choice is USG scrotum. Done. Now sir, treatment of choice, as already told you, congenital hydrocele, you have to do a herniatomy after 3 years. Testicular tumor you can remove. Now next topic, what I'm going to discuss, it's your kidney. Guys, flower vase. Question number 1. All of my friends on board right now with me. Flower vase appearance on IVP is seen in horseshoe kidney. Flower vase appearance on IVP is seen in horseshoe kidney. Spider leg appearance on IVP seen in radiology. Chanting, whoever has attended, they know this thing on their tips. Polycystic kidney disease. Now sir, drooping lily sign. क्या है? Drooping lily sign is seen in duplication of pelvic calyceal system, or you can say renal pelvis and ureter. This is drooping lily sign. Sir, adder head or cobra head. This is exam question and image is in the radiology section, and we'll be discussing it shortly. Ureterocele क्या है? एडर से कोबरा कहाँ रहता है? पेल्विस में. यूरेटेरोसील क्या है? यूरेटेरोसील. Now sir, investigation of choice for vesico-ureteric reflex and posterior urethral valve would be your micturating cysto urethrogram. While micturating, you will assess what? Cysto urethrogram. And remember, in this case on USG you will see what? Keyhole appearance. In the radio I have talked only. Keyhole appearance is seen in vesico VUR or PUV reflex. There is a posterior urethral valve. Done. Sir, most common urinary stone. Something you have to pay attention on this. Most common urinary stone, calcium oxalate dihydrate. Most common urinary stone to cause hematuria, Again, sir, answer is calcium oxalate. Why it is causing hematuria? Because spikes are present on this stone. Spiky, it is spiky whenever it is touching your uterine lining or your like bladder lining. Sorry, bladder lining. It will cause what? Hematuria. Dun 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 dun. Sir, common stone formed in the normal urinary pH. Again, your answer is calcium oxalate. Now, a boys loves to do tripling. A boys loves to do tripling and हिरन बन जाते हैं ऐसे हिरन stag horn calculi stag horn calculi. And remember, in alkaline urine it is formed, and it is most commonly seen in the young male patient. That is made by triple phosphate stone. Previous year MCQ. Common stone in the acidic urinary pH. Acidic urinary pH, sir, it is your uric acid. Simple as simple as water. Most common stone in the boys is triple phosphate, because boys love tripling on bike also. And you getting me na? Naughty boys and girls, friends and best friends. Adult uric acid. Adult, it is your uric acid. Now sir, hardest. चट्टान जैसा हार्ड है. कैसा हार्ड है? चट्टान जैसा. तो सी से चट्टान, सी से सिस्टीन. Hardest stone would be your cystine. Hardest stone would be your cystine. Hardest stone would be your cystine. Hardest cystine. Now sir, investigation of choice for urinary stone. Yes. It is NCCT. Treatment of choice for urinary stone. More than 2.5 centimeter ESWL. Sorry, less than 2.5 it is ESWL, and more than 2.5 it is PCNL. PCNL. Dun 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 da la 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 la. Now sir, this is important thing you need to take care of. Bladder. Most common type of bladder injury would be your extraperitoneal bladder rupture. Now, extraperitoneal bladder rupture, which urethra part will be ruptured at first go? Sir, it is your narrowest part and the thinnest part, none other than membranous urethra. Always remember, in a road traffic accident or any mishappening, which urethra is ruptured at first go? Sir, it is your membranous urethra. And how you will come to know? High-lying prostate. Whenever you are putting your beautiful finger inside the anal canal and you will see high-lying prostate, you will see what? High-lying prostate. Okay? Now, sir, bladder tumor, most common benign, it is a kiss cancer, and most common malignant would be a TCC. Bladder tumor, guys, remember, transitional cell carcinoma. Most common benign would be kiss disease, and most common malignant would be transitional cell carcinoma. Now sir, risk factor most common for the bladder tumor, it is none other than your smoking. It is your smoking. Then investigation of choices, biopsy. And the treatment is very simple. Transurethric resection of bladder tumor. Sir, while doing this procedure, never use water. It can lead to water intoxication syndrome. And despite of water, what we do? Irrigation fluid of choice would be your glycerin. Sir, coming to the prostate. BPH, benign prostate hyperplasia. The most common site for BPH would be TM. The mnemonic is TM. Transitional zone, median, low. First is zone, then it is low. Most common site of BPH would be TM. Transitional zone, median, low. Now, most common site of cancer prostate, it is PP. Cancer prostate is PP. Peripheral zone, posterior lobe. Done, TM, TP. Done. Now, sir, LUTS. BPH patient, you are going to see, sir, what? LUTS, lower urinary tract symptom. That means now the flow is not good. The urine, you are seeing a patient is complaining, sir, your urine is falling down his urine is falling down in his chappal only. The flow is not better. जैसे नहीं बचपन में शर्त लगाते थे हम, धार किसकी लंबी जाएगी, आजा शर्त लगाते, आजा सुसु करके देखते हैं. पर old age में what is happening? There is a retention of urine present over there because of benign prostate hyperplasia. And sir, there is a dribbling of urine, there is a retention, there is a urgency and urge incontinence. मन करता है पर आता नहीं. मन करता है पर अभी मजे कर लो सारे। तो कहता है जीने के है 4 दिन ओ, बाकी है बेकार दिन ओ, जाए जाने आए 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 आए, एक बार जो आए जवानी फिर ना जाए, ओहो जवानी फिर ना जाए। उल्टा बोल दिया, मुझे पता है पर क्या करें, जो है बोल दिया। तो इसी खुशी में हमें स्पॉन्सर आई है हमारे एनएलसी की तरफ से एनर्जी ड्रिंक, ये क्योंकि मैं सुबह 7 AM से आई एम टेकिंग क्लास, सो इट इज हाई टाइम फॉर मी, आई एम वेरी एग्जॉस्टेड बट स्टिल करेंगे, बंदे में है दम, बंदे मातरम टडरा 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 टडरा। So guys, remember what BPH, LUTS, BPS में what we were studying, sir? LUTS, LUTS, LUTS. Dun, 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 dun. Okay. So, ladies and gentlemen, friends and best friends, please listen to me. Investigation of choices, USG abdomen. That is transrectal ultrasound. Transrectal ultrasound you have to perform, and there is a direct rectal examination, and also serum PSA level, which plays a very important role in the diagnosis of BPH, sir. If serum PSA level are more than 4 to 4.5, there is 4 to 4.5 nanogram, then there is a diagnosis of BPH, sir. So now the medical management and the surgical management, two managements we are seeing in the surgery. So medical management, sir, alpha-1 blocker, this is your tamsulosin, and your drug of choice, sir, 5-alpha reductase inhibitor, it is a finasteride. This is your finasteride, sir. 5-alpha reductase inhibitor finasteride. And sir, surgical, it is TURP, transurethral resection of the prostate. Now sir, most common complication, as I already discussed in the TURBT, that most common complication of prostate surgery is water intoxication syndrome, because maybe you are using a water there, that is why water intoxication. That is why irrigation fluid of choice in TURP is your glycerin 1%. Glycerin 1%. Now sir, cancer prostate. What is happening, sir? More than 65 years, adenocarcinoma will happen over there, and most common zone of cancer prostate is PP. It is your PP, peripheral zone, posterior lobe, and sir, clinical feature, it is lower back ache, pain, lower back ache. A patient, a बुड्ढा बुजुर्ग पेशेंट, हमारे प्यारे बुजुर्ग हमारे पास आएंगे, डॉक्टर साहब, मैं क्या, हाँ बाबा बोलो, बाबा कहे, there is a lower back pain beta, and there is a constipation. Straight away my mind will run to the cancer prostate, sir, and first investigation of choice, what I will be doing, sir, TRUS, transrectal ultrasound guided biopsy is a thing I have to do over here, sir. And pathological grading, what I have to do is a Gleason's grading. That is a Gleason's grading. Now coming to the investigation of choice for the staging, is someone asked me, sir, it is your TRUS guided MRI, transrectal ultrasound guided MRI. What I have to do, sir? Now, sir, treatment part, surgery for the early prostate cancer. The best treatment for the early prostate cancer would be surgery. And chemotherapy, which drug you will give, sir? It is your suramin, and radiotherapy is your strontium 89. Hormonal therapy, someone will ask you, sir, it is your leuprolide and calcitamide. Done. Now, I have already told you something. Prostate cancer metastasis, it will metastasize to the lumbar vertebra through MCQ plexus, and the name of plexus would be, sir, lumbar vertebra. Prostate cancer metastasis to the lumbar vertebra through the Batson's plexus, or the vertebral plexus. Sir, prostate bone, all the bone metastasis, you will see something known as osteoclastic activity, but only one cancer which will lead to osteoblastic activity, that is none other than prostate cancer. Male urethra is slightly longer, no need to tell you, you already know this thing. Male urethra is 16 to 20 centimeter, and female urethra is slightly low, that is 4 centimeters, sir. Widest part of the urethra, sir, it is your prostatic urethra, sir. The narrowest part would be the membranous urethra. That is why extraperitoneal injuries, the most common part injured, it is your membranous urethra, and you have checked by putting the finger, and there was high lying prostate, and also teardrop bladder. Okay. Now, sir, weight of prostate, just remember 20 grams. Most common sign, it is transitional zone or medial, TM. TMO, हम तुमसे तुम हमसे। तो याद रखना क्या, ट्रांजिशनल जोन मीडियल लोब, एंड कैंसर की क्या साइड थी सर, पीपी, पैरिफेरल जोन पोस्टीरियर लोब। डन डन। प्रोस्टेट इज ओवर। अलाउ मी टू स्टार्ट सर योर फेवरेट टॉपिक, पेनिस। ओ माय गॉड, आर यू गाइस रियली pumped up today to do this Maha chanting? Oh my god. Pennies, yes, pennies. Different languages, different words are used for this beautiful organ of a human anatomy, and you can actually use those words in the chat box to tell other people what our language exchange. This is not a language exchange. So guys, remember what phimosis, inability to retract a prepuce onto glands. अगर आगे आ गया मामला, आगे आ गया, पीछे नहीं जा रहा भाई, इसको कहते हैं phimosis. Now sir, up to 3 years in the early childhood, you remember it took so much of energy to bring it back, and now you daily practice bringing back, sending parcel agency, you have started bringing back and sending abroad, bringing back, sending abroad. So phimosis, inability to retract prepuce onto glands sir, and remember physiological up to 3 years. If up to 3 years it is happening, means no need to आज बोला ना किसी ने इंग्लिश में, ऐसे कैमरे से निकल जाऊंगा आज, मैं पूरी इंग्लिश पढ़ा रहा हूं भाई, ऐसे मत करना। phimosis, inability to retract or prepuce onto glands, and physiological up to 3 years, and treatment is circumcision. पैराफाइमोसिस, पीछे खींच दिया, जोर से खींच दिया, जोर लगा के, कोई वो ना कैसे बहुत जोर लगाया, कोई था नहीं आसपास तो बहुत ज्यादा खींच दिया, अब आगे नहीं जा रहा भाई, सूजन होगी, सूज गया पूरे गंदे तरीके से। फिर उसने बोला डॉक्टर साहब यहाँ देखना, सबसे पहले क्या करना, रिड्यूस द ग्लैंडुलर स्वेलिंग, एंड दैट लाइक टू डू विद द कॉन्डम ना, स्लाइटली यू विल पुट इट बैक, स्लाइटली you will put it back. Now sir, fracture penis, what will happen in a fracture penis sir? You remember I have told you not to use your muthi while preparing for the exam. Now after examination you will be going ना, घोड़ी चढ़ जाएंगे, क्या करें, you will be marrying and you are deprived of sex from so long, and after you get married there will be over enthusiastic sexual intercourse. नाउ सर आप मतलब क्या ही जवाब है आपका, आप याद रखना, रप्चर ऑफ ट्यूनिका कार्पोरा कैवर्नोसा, रप्चर ऑफ ट्यूनिका कार्पोरा, पिनाइल शाफ्ट ड्यू टू ओवर एंथुसियास्टिक सेक्सुअल कोर्स, घपाघप बहुत जोर से। तो कहते हैं शीशे का डैश था मेरा, शीशे का डैश था मेरा, पत्थर का जमाना था, और टकराते ही टूट गया, और टूट गया, अब चोट लगी ऐसी, इसे उठाने को भी तरस गया, दुख 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 दुख। चल सर, Peyronie's disease, what is Peyronie's disease? Formation of hard fibrous plaque within the one or the both corpora cavernosa. अब क्या होता है, जैसे ही देयर इज अ पिनाइल इरेक्शन, वो क्या होता है, टेढ़ा, जैसे ही खड़ा हुआ वो टेढ़ा हो गया तुमने बोला टेढ़ा है पर मेरा है कुरकुरे। तो गाइस रिमेंबर इन दिस व्हाट यू हैव टू डू, यू हैव टू रीअश्योर द पेशेंट, कोई बात नहीं भैया टेढ़ा फिर क्या हो गया, ऐसे नहीं, टेंशन नहीं लेनी। उसके बाद एक ऑपरेशन होता है नेस्बिट्स ऑपरेशन। नेस्बिट क्या कहता है, इफ देयर इज अ प्लाक ऑन वन साइड देन यू हैव टू क्रिएट अनदर प्लाक ऑन द अदर साइड। तो जैसे ही खड़ा पहले टेढ़ा होता, दूसरी साइड भी बोझ डाल दिया, सारा बिल्कुल एकदम बीचों बीच, सारी दुनिया का बोझ मैं उठाता हूं। कौन बोला ऐसा, नेस्बिट्स ऑपरेशन। कौन बोला, नेस्बिट्स ऑपरेशन। प्रियापिज्म, व्हाट इज प्रियापिज्म? पिया आए, 1 घंटा इंतजार करा, 2 घंटा करा, 3 घंटा, 4 घंटे इंतजार कर लिया, उसके बाद भी क्या नहीं हो रहा, बैठने को तैयार नहीं, और क्या बोला, ओ पियाए ना, पियाए ना, पियाए ना, पिया ही नहीं आए, ओ पिया की याद में खड़े खड़े वो दर्द के मौसम में चले गए। दोस्तों दिस इज नोन एज प्रियापिज्म। सो व्हाट इज द ट्रीटमेंट ऑफ प्रियापिज्म सर? एस्पिरेशन ऑफ ब्लड फ्रॉम द कार्पोरा कैवर्नोसा एंड नेस्बिट, सॉरी कार्पोरा, एंड देयर इज अ शंट ऑपरेशन, यू हैव टू डाइवर्ट द ब्लड फ्रॉम द पेनिस टू द अदर प्लेस। एंड गाइस रिमेंबर, what? Here you can use one spray to make it down. That is your papaverine. क्या है papaverine? उसको क्या बोले? अरे बैठ जा पापा, papaverine क्या लगा दी? papaverine लगा दी। Sir, then coming something known as penile cancer. That is the penile cancer, sir. Most common is squamous cell carcinoma, and that is because of poor hygiene. अगर सब सामान करने धुलने वुलने काम नहीं है तो भैया हो सकता है क्या तुमको penile cancer? क्या हो सकता है? Penile cancer, and most common is because of पुअर हाइजीन. डेटॉल से रगड़ रगड़ के खुद नहाओ या ना नहाओ, उसको जरूर नहलाओ, वरना क्या हो जाएगा? पिनाइल कैंसर. क्या हो जाएगा दोस्तों? पिनाइल कैंसर. नाउ सर, क्लिनिकल फीचर इज फाउल स्मेलिंग ग्रोथ, बदबूदार ग्रोथ और enlarging inguinal lymph node, और डेथ हो सकती है इस वजह से. कैसे? लेट्स स्टडी दैट. Sir, there is a death due to erosion of femoral or the inguinal vessel because of enlarged lymph nodes in the penile cancer. तो penile cancer से death हो सकती है. सोचा कभी कैसे? ऐसे होती है. There is an enlargement of the lymph node, and these enlarged lymph nodes, sir, they can actually erode your femoral or iliac vessel, and then you can die. So please clean my folded hand. Request to all of you, please clean it thoroughly. Investigation of choices, biopsy. Now, so treatment is partial penectomy and total penectomy. Air service is gone. Ladies and gentlemen, friends and best friends, air service is gone. फिर से कनेक्ट करूं. I think it is connected from my side. And I think no, I'm sure it is connected from my side. देखिए क्या कर, दोबारा से स्टॉप कर दूं मेरे नहीं, ऐसा ना कनेक्ट ना हो भाई. ऐसे कैसे प्रियापिज्म हो गया मित्रों? डॉक्टर पारस बैठे, ठंडे से भी बिठा देंगे उसको, टेंशन मत लेना तुम इस बात की, है कि नहीं? आगे 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 भाई, आगे 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 आगे. Nice guys. Then next is hepatobiliary system. Hepatobiliary system, what you have to remember, I will show you. Number one thing is Charcot striatum. Sir, Charcot striatum is pain, fever, jaundice. What is Charcot striatum, sir? It is a pain, fever, and jaundice. And Raynaud's pentode is something which is a upper part of Charcot striatum. Pain, fever, jaundice is present already there. What you have to add, sir? Septicemia and hypotension. Septicemia and hypotension. Now, sir, remember this. What is this? This posterior acoustic shadow is present. Now, what is this? Gallstone. It is your gallstone. Definitive diagnosis is your gallstone. This is known as cholelithiasis. This is known as cholelithiasis. Cholelithiasis. Now, sir, cholesterol, pale yellow color, and there is a 4F phenomena over here. Fat fertile female of 40. 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 Then, sir, guys, remember, if asymptomatic, no treatment. If gallstone is asymptomatic, no treatment is required. But sir, if it is symptomatic, you will do laparoscopic cholecystectomy. Laparoscopic cholecystectomy. Now, gas used in the laparoscopy would be your carbon dioxide. And can you tell me a cylinder color of carbon dioxide? I need your answer in the right now in the chat box. Done, done, done. Now, sir, symptomatic emergency, which is something has been asking you exam. Symptomatic emergency means acute cholecystitis. Symptomatic emergency, perfect, it is gray color cylinder is the answer. Love you all for the lovely answer, all my dear ladies and gentlemen and friends and best friends. Symptomatic emergency in the gallstone, acute cholecystitis. Guys, remember, complete obstruction is at the mouth of gallbladder. Now, sir, this is something where you have to worry. A patient clinical feature would be sudden severe right hypochondric pain, sir, which is radiating to the inferior angle of the right scapula. Pain is radiating from the right hypochondric region and it is going to the right scapula. You will definitely make a diagnosis of acute cholecystitis. That means now your gallstone has actually obstructed a mouth of your gallbladder. This is very bad thing. And you will see what, sir, red hot red hot gall bladder, garam lal lat pat, because there is excessive inflammation, and on palpation what you will see, whenever you are pressing there is no pain, and whenever you are releasing the hand there is an intense pain. That means Murphy sign positive. There will be Murphy sign positive. Investigation of choice for the gallbladder stone would be USD. Sir, there is a red hot gallbladder, means there is an inflammation, intense inflammation. In such condition, first you have to make sure that there is no inflammation. For that you have to do a conservative management. In the symptomatic emergency acute cholecystitis, initial management is conservative with the IV fluid and the IV antibiotics. Then you have to discharge the patient so that this red hot gallbladder should be calm down, and then you will cut a gallbladder after how many days? Sir, 3 weeks, and this is known as interval cholecystectomy. Dum. Then sir, treatment of sorry, this is gallbladder. Okay, treatment is ERCP and Dormia basket. Okay, so remember Mirzi syndrome. Okay, gallbladder, remember ERCP is an investigation also, and ERCP is treatment also. And also you have to put a Dormia basket to get the stone out. Sir, remember Mirzi syndrome is something you have to remember. Jaundice is happening in this disease. Why? Because there is a gallbladder stone, and this gallbladder stone is now compressing your common hepatic duct. And sir, now Saint's triangle is something which is important. Gallstone, hiatus hernia, and diverticulosis of the colon. Sir, acalculous cholecystopathy. What is this acalculous? Means there is no stone detected in the gallbladder, still gallbladder having all the symptom of the stone. How is this possible? Sir, this is possible because of motor dyskinesia. Means now gallbladder is like a firm ball. It is acting like a stone. It is not contracting at all. This is known as motor dyskinesia of the gallbladder. Guys, remember, in such cases investigation of choice is HIDA scan. So investigation of choice for acalculous cholecystopathy would be your HIDA scan. Sir, HIDA scan actually tells you a difference between the calculus and the acalculous cystopathy. And the treatment is laparoscopic cholecystectomy. Done. Next, sir, fistula. This stone which is in the gallbladder, it can actually come out through the duodenum first part. So most common fistula, this is an abnormal communication. Fistula, you all know, first part of duodenum, and gallstone can obstruct the terminal ileum. And sir, in terminal ileum, which vitamin is absorbed? It is your vitamin B12. Which vitamin is involved? Vitamin B12. And vitamin B12 deficiency will lead to Magelloblastic Anemia. Yes, the fistula of gallbladder can laterally cause what? Magelloblastic Anemia. And sir, there is one famous word known as Wriggler's triad. So fistula of gallbladder के अंदर कौन सा triad है? Wriggler's triad. Multiple air fluid level, air in the gallbladder, and sir, stone in the intestine. Now, what is the treatment? Just you have to remove the stone from the terminal ileus. Done. Now, sir, choledocholithiasis, bile duct stone disease. See, two types of things are here. One, a patient is coming in the OPD, another patient is coming in the emergency. In the OPD, you will see a patient would be comprising with the intermittent jaundice, and treatment investigation is ERCP, and treatment is also ERCP. Doesn't matter what, done. Now, emergency cholangitis, a patient would be presenting with, there is an inflammation, and you will perform an emergency में USG abdomen you will perform, and treatment is endobiliary stenting. In emergency, the treatment of bile duct stone disease is endobiliary stenting, and the OPD, the treatment is ERCP, sphincterectomy plus Dormia basket. Done. Sir, GIT, the last topic of the surgery. Guys, remember, whatever you have to learn, please learn it here itself. Narrowest part where the foreign body is most commonly obstructed, that is cricopharyngeal sphincter, which is present in C6, Normal pH of the esophagus is 5 to 7. If it is less than 4, that means it is pathological. And there is a disease known as GERD's disease, in which there is a pH less than 4 for more than 4 times in the 24 hours. Done. Chalo ji. Esophageal atresia I'm talking about. There is an absence of some part and most commonly type C. Guys, esophageal, there is an absence of some part, and whenever you are putting a nasogastric tube, you will see a coiling of tube. Bedside test is nasogastric tube and it do not go 10 centimeter beyond because there is an absence of some part. Sir, in this you will perform an X-ray and you will see a coiling of tube. Number one, investigation of choice is CECT, and the treatment is esophageal anastomosis. You will attach the esophageal part with the esophageal part. Done. Now, sir, dysphagia lusoria, difficulty in swelling due to compression by the aberrant right subclavian artery. Dysphagia lusoria is difficulty in swelling because now this aberrant right subclavian artery is compressing your esophagus. That is the case over here. Trauma, if you remember, foreign body. See, esophageal trauma is very famous MCQ side. Foreign body, child में coin है, adult में food है, elderly it's denture or roots. If a patient of obstruction of foreign body is coming to you as a doctor, what you have to do, sir? If asymptomatic, you will give a meshy food, and that is your banana. I went to Kerala. Hi, the people from Kerala, Sugamanu. There were different type of bananas. Small banana, large banana, tilted banana, straight banana, black banana, orange banana, pink banana, blue banana, all type of banana. Fully shop is full of banana. Meshy food, and symptomatic is endoscopic removal. If patient is symptomatic, you will go for, sir, endoscopic removal. Next coming to the iatrogenic. Iatrogenic means faulty intubation, or you are doing an upper GI endoscopy and you ruptured that part. That is faulty. Spontaneous is Bohr-Havi. Bohr-Havi, how it is happening? Because of eating excess food, there will be excess pressure in the abdomen, and that pressure will actually open your glottis against the pressure, and that can actually make a hole in the esophagus. That is known as Bohr-Havi syndrome. And content can leak out from here. Air can also come from here. That air is mediastinal crunch. That is known as Hamann sign. Hamann sign. ठीक है, Hamann sign. Done. ठीक है जी. उसके बाद क्या होता है? Macular stride, vomiting, chest pain, and subcutaneous emphysema is seen in Bohr-Havi syndrome. Most common site of rupture would be posterior lateral wall of the lower esophagus. Sir, then coming to investigation of choice, Hamann sign I have told you. ठीक है, mediastinal crunch is seen because of rupture. Sir, CT chest with oral contrast, and in the rupture part, the oral contrast which we are using, sir, it is your gastrographic. If there is a rupture, you will not use what? Barium swallow. You will now use gastrographin gap. Done. Now, sir, eclasia cardia, bird beak appearance. Because of lower esophageal sphincter relaxation failure, there is a bird beak sign, and in this there is a normally initially there is a dysphagia for the liquids followed by solid. Dysphagia for liquid followed by solid. Done. Now, sir, treatment is medical management is CCB and nitrate, and surgical management is Heller's and myotomy. तो हेला को क्या सुनानी है? पोइम सुनानी है. हेला को क्या सुनानी है? पोइम सुनानी है. तो किसको पोइम सुनानी है? हेला को पोइम सुनानी है. तो क्या बोला? जॉनी यस पापा, ईटिंग शुगर नो पापा, telling lie no papa, open your mouth. So guys, this is हेला को पोइम सुना दी. किसके अंदर? एक्लेशिया कार्डिया. किसके अंदर? एक्लेशिया कार्डिया. यस, बोटॉक्स टॉक्सिन also you can give. Done. गर्ड के अंदर क्या होता है? oily, spicy food can actually lead to a change in the pH. And remember guys, if pH is less than 4 for more than 4 times in 24 hours, this is a pathology that is directly indicating you of a GERD, gastroesophageal reflux disease, and there is a GERD ka triad: heartburn, epigastric pain and regurgitation. Now sir, investigation gold standard, it is 24-hour ambulatory pH monitoring. And what you have to monitor over here, it is Johnson's D master score. It is Johnson's score. Johnson's kya kehta hai? pH less than 4 for more than 4 times in 24 hour, it is your GERD. It is your GERD. Now sir, treatment is floppy Nissen fundoplication. तो GERD का क्या टाइप है? GERD क्या होता है? किसी ऑब्जेक्ट को गुस्सा आता है, जी में डाल ले अपने, तो GERD, जी में क्या डाल ले? फ्लॉपी डिस्क, फ्लॉपी डाल ले, क्या डाले? जी में फ्लॉपी डाले, फ्लॉपी निसन फंडोप्लाइकेशन, फ्लॉपी निसन फंडोप्लाइकेशन, फ्लॉपी फंडो क्या? फ्लॉपी डाल ले, फ्लॉपी GERD में फ्लॉपी डाल, फ्लॉपी निसन फंडोप्लाइकेशन. सर कॉम्प्लिकेशन ऑफ GERD इज वेरी सिंपल: Barrett's esophagus and sliding hiatus hernia. Barrett's esophagus, the columnar metaplasia and hallmark cell are goblet cell. Done. No need to do these things. Okay. Now sir, esophageal cancer, just remember in esophageal cancer what you will see: bird beak appearance. What you will see sir? Bird beak appearance. Done. Now double bubble sign is seen in duodenal aprasia, and also double bubble sign is seen in annular pancreas. The double bubble sign is seen in annular pancreas. This is an image based question, has been asked in the exam. Now sir, IHPS, we have already studied IHPS. What is happening? It is presenting during the 3rd week of life: olive lump in epigastric, projectile, non-bilious vomiting. Why? Because now pyloric stenosis is there and the bile juice is coming in the duodenum. Now it cannot cross the pylorus. That is why the vomiting is non-bilious vomiting, and there will be metabolic alkalosis. Sir, in vomiting what is happening? Alkalosis. And in diarrhea what is happening? Acidosis. Investigation of choice is USG, and the treatment is pneumatic balloon dilation. There will be constriction there, you'll put a balloon and there will be a pneumatic balloon dilation. And treatment of choices: Ramstead seromyotomy. Sir, most common cause of bleeding, guys, remember, per rectum it is hemorrhoids, infant into susception, child juvenile polyps, adult pile, elderly colorectal cancer. Kya hai? Colorectal. Again, per rectum hemorrhoids, infant into susception, child juvenile polyp, adult it is pile, elderly it is colorectal cancer. Now sir, important topic next, you have to study what? Peptic ulcer disease. Peptic ulcer disease is happening because of H. pylori. The treatment is your PPIs. What you will give? PPIs. And sir, remember, peptic ulcer is of 2 types: duodenal ulcer and gastric ulcer. Duodenal matlab dollar rich लोगों को पता है, rich young patient like you guys. Gastric ulcer will happen in गरीब person like me, a poor person like me. G से गरीब, G से poor person, G से poor, P से पारस, P से poor elderly patient में gastric ulcer, and rich young patient में क्या होगा? Duodenal ulcer. क्या होगा? Duodenal ulcer. Sir, treatment H. pylori positive, you will go for the eradication therapy. And if duodenal ulcer is there, you will go for a high selective vagotomy. If recurrent duodenal ulcer is there, truncal vagotomy plus enterectomy. Okay? If gastric ulcer is there, you will go for the RAW X and Y. Okay? Chalo. Complication of peptic ulcer: early dumping and late dumping. 2 type of dumping is there, sir: early dumping and late dumping. Early dumping, it is happening 5 to 10 minutes after the meal. Heaviness you will feel in the abdomen. And late dumping is something happening after the 2 hours. It is happening after the 2 hours. So duration of attack would be 30 to 40 minutes. And clinical feature, it is epigastric pain, nausea, faintness and tumor. Because in the late dumping, it is happening after the 2 hours, there will be a hypoglycemia. And because of hypoglycemia, patient can be fainted. ठीक है, What is the treatment of dumping syndrome? Whether it is early, whether it is late dumping. Guys, remember, please, small frequent meal. This is your small frequent meal. Yes, triple therapy is a conservative management it given in the peptic ulcer. Now sir, bezoars, which is important. अगर बालों को खींच के मुंह में डाल के गुच्छा बना लिया, this is known as trichobezoar. It is made up of hair. Now coming sir, phytobezoar. Phytobezoar is made up of vegetable. Lactobezoar, it is made up of milk and milk product. Done, 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 done. Next thing you have to remember over here, sir, gastric cancer. What we are going to study next is gastric cancer. Sir, gastric cancer, the most common would be your adenoma. The most common gastric cancer would be your adenoma, and the most common site is pre-pyloric. Most common it is adenoma, pre-pyloric. Risk factors all H. pylori, salt, spices, smoked food. You go to barbecue to eat the food, na sir, that is smoked food, that is actually not good for your health. You should not eat that food, but still you go, you cook, you eat, because अगर बात ही मान लोगे तो इंसान किस मतलब के रह गए. Appearance, this is a typical key punch word to solve a MCQ of gastric cancer, sir. That is your Linitis plastica. What a sexy name. What a sexy name. Linitis plastica, leather bottle stomach. This is known as leather bottle stomach. Sir, remember, spread of gastric cancer, you have to remember over here. Guys, remember, local spread, it is in spleen or pancreas. The local spread is in spleen or pancreas. Local spread is in spleen or pancreas. Spleen or pancreas. And guys, remember, there is a virtuous node. There is a virtuous node. Local, it is in spleen and pancreas, and there is virtuous node, supraclavicular lymph node, and that will show you a Trozier sign. That is Trozier sign. Trozier sign, and another is Trozius. Trozius means carpopadal spasm. That means carpopadal spasm. Trozier, it is carpopadal spasm. Trozier, it is carpopadal spasm. Carpopadal spasm. Okay, sorry, I'm tired of sitting, so I'll be standing right now. So Irish nodule, it is axillary lymph node. Irish nodule, it is axillary lymph node. And direct peritoneal spread, sir. Direct peritoneal spread. See, peri-umbilical, you are going to see Sister Mary Joseph nodule. भाई ये screen चलेगी. लड़ा लड़ा तुझे जीना है मेरे बिना. Virtuous node, supraclavicular lymph node. Irish node is axillary lymph node. Direct peritoneal spread is peri-umbilical or Sister Mary Joseph nodules. Now sir, ovarian, which has been asking exam, it is your Kuchenberg tumor. It is your Kuchenberg tumor. Anterior rectal wall would be Bloomer shelf. It is known as Bloomer shelf. Bloomer shelf. Treatment of cancer abdomen would be your chemotherapy, 5-fluorouracil and cisplatin. Now sir, surgical treatment, total gastrectomy plus sphincterectomy you have to do. Now tumors of intestine, number one is your benign tumor, that is your polyps, and number one tumor would be your juvenile polyp. Juvenile polyp is also known as cherry tumor. Most commonly CCC, cherry children conservative, cherry children conservative. And villus adenoma, it is present in rectum. Rectum के अंदर क्या है? घर है. उस घर में क्या स्टोर होती है? Then cauliflower like growth is seen in the villus. और विला में क्या उगता है? गोभी उगता है. गोभी उगता है और गोभी को क्या करना है? काट देना है. Resection. What is the treatment, sir? It is your resection. Now, Peutz-Jeghers syndrome. Guys, remember Peutz-Jeghers syndrome, there is a gene STK11 on chromosome number 19, and there are perioral antigen. Now, sir, familial adenomatous polyps, autosomal dominant condition, mutation in antigen presenting cell, and multiple adenomatous polyp more than 100. familial बड़ी family है, familial adenomatous polyp. Familial adenomatous polyp, sir, remember there is a multiple polyps, more than 100, and there is a mutation in the APCs. Investigation of choice, colonoscopy. You will go through the colonoscopy and never leave these kind of polyps. It can be a major cause of bleeding, and you can bleed, you can die. Treatment, it is resection and anastomosis. The treatment is resection and anastomosis. You have to cut that part where is 100 polyp present. You cannot remove the 100 polyps. You just have to cut the part and you have to anastomose. And sir, this is known as resection anastomosis. Turcot's one, it was off. It is familial adenomatous polyp प्लस ब्रेन ट्यूमर. देखो तारे कहां होते हैं? सर के ऊपर. तारे कहां होते हैं? सर के ऊपर होते हैं. तो याद रखना ब्रेन ट्यूमर. Brain tumor with the familial adenomatous polyp. It is known as Turcot syndrome. It is known as Turcot syndrome. Sir, now colorectal cancer, died because of animal fat, less fiber, it can happen. It is a colorectal cancer. And remember, right-sided colorectal cancer and left-sided colorectal cancer, which is very important. Right-sided colorectal cancer, cauliflower-like growth. Left-sided, it is annular type. Cauliflower can lead to bleeding, which will lead to anemia. Left-sided, which is annular, it will lead to obstruction. Now, sir, rectal cancer, it is a colorectal cancer. Remember, biopsy you have to do, and right-sided colon cancer treatment is right hemicolectomy. Left-sided colon cancer, it is your left hemicolectomy. Right-sided colon cancer, it is your right hemicolectomy. Left-sided colon cancer, left hemicolectomy. Now, sir, remember, anal canal ka cancer, chemo radiation you have to do with the help of Negro regime. Negro loves something that is known as, I don't want to say, cancer anal canal, which is your squamous cell carcinoma, and the treatment is chemoradiation. That is why the Negro regime. And the surgical treatment is abdominal perineal resection. Abdominal perineal resection. Done. Now, sir, rectal prolapse. Rectal prolapse, and rectum is out. What you have to do? You have to put the rectum inside. In children, you have to do the digital repositioning. Digital repositioning means with the finger you have to put it back. If it is coming again and again, then you can use 3-ish wiring. But adult, you have to do what? Dolerams operation. If the adult rectum is coming out, you have to do what? Dolerams operation, ताकि डोला वापस नहीं आए. और क्या गाना गाओगे? ओ मेरा ढोला नहीं आया ढोला, मेरा ढोला नहीं आया ढोला, दुनिया खेले है खेले, रोज लगावे मेले, कहंदा कुछ नहीं बदला, झूठ बोले हर वेले, चुप माही चुप है रांझा, देखे बोले कैसे वे ना जा elderly dolerams. क्या है? Dolerams and 3-ish operation. Done. Next coming the 100% exam question on 4th of June, that is none other than hemorrhoids. Guys, remember why hemorrhoid is happening. अगर तुम ज्यादा जोर लगाते हो, सुबह बहुत ज्यादा जोर लगाया, इससे क्या हो सकता है दोस्तों? Hemorrhoid. What can happen, sir? Hemorrhoid can happen. And guys, remember, weakness of pelvic flora, and there's an increase in intra-abdominal pressure. Now, sir, internal and external. Hemorrhoids are of 2 types. That is internal hemorrhoid and external hemorrhoid. Internal, it is 3 o'clock, 7 o'clock, 11 o'clock. 3, 7, 11. 3, 7, 11. 11, 11, 3, 7, 11. Guys, remember, internal hemorrhage, it is above the dentate line, and internal hemorrhoids are painless. External hemorrhoids, which are below the dentate line, and they are painful because below side there are many nerves ending. That is why anal sex is painful, because there is lots of nerve ending. Sir, then coming to the grading part, which is very, very important. Grading part is something you have to focus on. Primary grading, see how you have to remember. Grading part. Primary, mass do not protrude outside the anal opening. Mass is inside permanent, that is primary grading. Now, sir, you have called your friends. अब किसने अपने दोस्त को बुला के लाया, जैसे बोला भाई क्या कहते हैं, डॉक्टर जीतू ने जो है अपने दोस्तों को बुलाया और बोला इधर आओ, देखो भाई मैजिक दिखाता हूं. डॉक्टर जीतू ने जैसे ही जोर लगाया, हेमोरॉइड बाहर. और जैसे ही जोर हटाया हेमोराइड अंदर अंदर बाहर। दोस्त इनके बड़े इंप्रेस हुए, इन्होंने बोला वाह 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 वाह, क्या मैजिक दिखाते हो, क्या कमाल करते हो बरखुरदा। फिर इन्होंने क्या करा, पूरे के पूरे एफएमजीज को बुला लिया कि मैं तुम्हें एक जादू दिखाता हूं। बोलो कैसा जादू दिखाता हूं। उसके बाद इन्होंने क्या करा, जोर लगाया, ऐसा जोर लगाया वो बाहर आया, अंदर जाने का नाम नहीं ले रहा, उंगली से डालना पड़ गया। दैट इज ए grade 3 mass protrude out on straining, does not go back, remain outside only, dun 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 dun. And fourth degrees, mass is permanently out, it is permanently out. Now sir, ब्लीडिंग पर रेक्टम इज लाइक ए स्प्लैश, एकदम से जैसे टमाटो केचप होता है ना, ऐसे खच कर दिया, बहुत सारा टमाटो केचप आता था, इसी तरीके से ब्लीडिंग होती है तुम्हारे किसके अंदर, हेमोराइड्स के अंदर। किसके अंदर, हेमोराइड्स के अंदर। एंड गाइस रिमेंबर, इन्वेस्टिगेशन इज प्रोक्टोस्कोपी। प्रोक्टोस्कोपी तुम ऐसे करोगे, अंदर सिमन्स पोजीशन में डालोगे उसको, ऐसे डाल के ऐसे देखोगे 3 o'clock, 7 o'clock, 11 o'clock. That means that now primary, sir remember primary treatment of choice is sclerotherapy, and which agent you can use here as allosterone, ठीक है, क्या जिसका एलेस्क्रोल यूज कर सकते हो, ठीक है, एस्केरोल, it is escarole. Banding secondary, the moment you were coming, it was coming outside, you can put a band, that is banding. Third and fourth degree sir, it is hemorrhoidectomy, it is your hemorrhoidectomy, hemorrhoidectomy. Done. Let's start something sir, new topic, and that is none other than your final pyloneedle sinus. Sir, pyloneedle sinus is Jeep driver bottoms disease. Jeep driver bottoms disease. What is happening? Most of you are deciding to buy a Jeep and going on to Leh Ladakh trip after passing this exam. And you remember what? These hairy gluteal regions, because of prolonged Jeep driving, it can actually create a sinus, multiple discharging sinus over there. Investigation of choice is what? Sinogram, and treatment is plastic reconstruction. That doesn't mean you will put a plastic over the gluteal region. No. It is taking a skin graft and putting over the gluteal region, sir. So remember, the treatment is plastic reconstruction and simple excision with the secondary healing. Either you can do what plastic reconstruction, either you can put small clot on all the gluteus maximum medius so that it can heal with the secondary healing. So surgery is over. Now sir, the next thing we have to study is something known as bigger subject, that is obs and gynae. Obs and gynae, let me find obs and gynae for all of you. Where is our obs and gynae? So this is our obs and gynae, sir. The gynae, I'm going to start with the first thing. Now, Joshish, hi. Oh my God. OBG, guys, remember, let's start it with a full Josh, full dhamaka. 2 hours has been passed. I think 10 o'clock tak to aaj jani do mukadma. ठीक है? Thank you, Ji. Thank you so much. Thank you, Ji. Guys, love you all. Now your menstrual cycle is starting from the hypothalamus. It is starting from the hypothalamus. It's a secrete GnRH, and sir, GnRH act on anterior pituitary. Sir, GnRH act on anterior pituitary, and anterior pituitary secrete FSH. FSH very important. Sir, FSH act on ovarian granulosa cell. FSH acts on ovarian granulosa cell. अब ovarian granulosa cell से क्या निकला? Estrogen. क्या निकला? Estrogen. And what is the function of estrogen, sir? Function of estrogen is your proliferation. It is your proliferation. Then coming, sir, estrogen, if level is more than 150 to 200, because you have to start the proliferation also, na? Otherwise it will lead to cancer. You have to stop, and for stopping this estrogen production, whenever the levels are exceeding more than 150 to 200, you will see it will give you a positive feedback. It will give you a positive feedback. And remember, because of positive feedback, LH and FSH coming from the pituitary gland. Now LH will come because of positive feedback of the estrogen. Who will come, sir? LH will come. LH aja raja aja. ठीक है? Then you remember, LH will increase on the day 14, or LH के increase होने से what will happen, sir? There is a ovulation. There is a formation of two things. One is a corpus luteum, which is known as yellow body. Another thing is a ovum. Now sir, after ovulation, this corpus luteum is forming something that is known as progesterone, which is actually making your uterus juicy and vascular. ठीक है. Now sir, there is a limit of progesterone. After that limit he has to stop, it has to be stopped. So remember, progesterone level if increasing more than 3 nanogram per ml, it gives a negative feedback, it gives a negative feedback to the LH. Now LH will be less, there will be a corpus luteum degeneration, there will be decrease in progesterone, and congratulations, periods are here in front of you. Periods are here in front of you. So this diagram is a question on 4th of June. Mark my word, this is a question on 4th of June in your exam. Now sir, FSH is giving what, which feedback? Positive feedback. Which give a positive. Because of FSH, what is coming sir? Estrogen. And because of estrogen, positive feedback. Remember, LH is coming. LH is helping in the ovulation. Because of ovulation, there is coming a progesterone, and progesterone is giving negative feedback, and there will be degeneration, and there will be a shedding of endometrium. Done, 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 done. No screen stuck बता रहे हैं यार. Now okay, it's fine, it's fine, it's fine, it's fine. Now sir, you have to study something known as duration of bleeding. Sir, what is the normal duration of bleeding? If I ask you, normal duration of bleeding is 2 to 8 days. 2 to 8 days. Now, amount of blood loss in the single episode is 2 to 8 days. 2 to 8 days. 2 to 8 days. 20 to 80 ml. 20 to 80 ml. 20 to 80 ml. Done, done, done. Now, sir, remember something that is known as natural estrogens are of 4 types. Natural estrogens are of 4 types. 4 types. E1, E2, E3, E4. E1 is estra1, E2 is estradiol, E3 is estratriol, and E4 is estratetrol. Sir, E3 and E4 is coming from the placenta. Lag aa raha hai kya? Let me also check in my device if it is there. So I'll solve it within a second. Just excuse me for a minute. Everything is okay? Okay, everything is perfectly fine. Okay, so guys, remember natural estrogen E1, E2, E3, E4. In case you are having a lag, just exit the class and then re-enter the class. It will give you a perfect result. ठीक है, चलो. Now sir, aromatization से E1 आता है and ovarian granulosa cell से E2 आता है. E3 and E4 is coming from the placenta. It is coming from the placenta. It is coming from the placenta. Now, sir, disorders of menstruation. मोटा मोटा सुन लेना. Delayed menses means a menses coming more than 35. It is taking more than 35 days to come. That is known as oligomenorrhea. That is known as oligomenorrhia. If it is coming before 21 days. और आज के हैं हमारे गुरुदेव जो है, ठीक है.
कैसे आप लोग? How is everything going?
चलो जी.
Busy in exam day preparation. Very soon, yes, I will also join and I'll take topics. Don't worry, ठीक है. दोनों भाई मिलके करेंगे बारी बारी. अभी क्या है, मैं ऑफलाइन देख रहा हूँ, पारस ऑनलाइन देख रहा है. कुछ देर बाद शिफ्ट करेंगे because we are having lots of thing going on. Transportation hai, plus other work going on, exam day preparation. Clear? So we are, plus some people have issue with the admit card, तो थोड़ा उसका भी we'll trying, calling NB etc. So I wish they all get the admit card. Okay, कुछ को मिल भी गए, ठीक है, but we are trying कि सबको मिल जाए कल तक, even provisional basis मिल जाए कि they can have the result with help, but at least exam तो देने दें and give a time window. So we are trying for that also. That's why right now Paras is taking. I'll also come and sit because I know you all want the best possible and we are doing our level best to get you everything done. Okay, and speed थोड़ा fast ही रहेगा भाई. This is not the time to slow down. Okay, ठीक है, तो फटाफट खींचना है because exam में the brain should go fast. Okay, plus the exam day trick techniques we'll discuss tomorrow. ठीक है, and my mother will also come. So everything is planned for you people. Just be patient and keep attending. Okay, so that is very 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 important for all of us. Okay, ठीक है, कंटिन्यू कर पारस.
डन. तो ब्रेक कब लेगा? बस अभी 2 मिनट में. इनको भी थक गए होंगे, सो आई विल बी, ठीक है, ओके, सो आई विल बी कमिंग. ठीक है, so guys, don't worry at all. Let's start something that is oligomenorrhea, delayed menses. That is known as delayed menses. Oligomenorrhea is known as delayed menses. It is known as delayed menses. Guys, remember, poly means something early. Poly means something early. That is polymenorrhea, frequent menses. And P for poly, P for PID. The most common cause of polymenorrhea would be PID, and most common cause of PCOD, PCOD. Done, done, done. Sir, menorrhagia. Menorrhagia मतलब मन भर के, क्या है? मन भर के. और मैं तो तेरा मन परया, मन परया बदल गया सारा कि तू मैनू छड़ जाना पतलिए नारे डन 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 मैनोरेजिया मन भर के एक्सेसिव मेंसेस amount more than 80 days more than 8 and most common cause it is uterine fibroid sir metro कैसे irregular somewhere it is going up somewhere it is going down metrorrhagia irregular bleeding most common causes dysfunctional uterine bleeding मैनोमेट्रोरेजिया मन भर के इरेगुलर साइकिल आए मन भर के इरेगुलर साइकिल आ रहे हैं कैसे मन भर के इरेगुलर साइकिल मोस्ट कॉमन कॉजेस डिसफंक्शनल मोस्ट कॉमन अल्सरेटेड फाइब्रॉइड पॉलिस मन भर के आ रहे अलग अलग प्राइमरी डिस्मेनोरिया पेन ड्यूरिंग द मेंसेस व्हिच इज वेरी नॉर्मल एंड मोस्ट कॉमन कॉजेस योर मोस्ट कॉमन कॉज वुड बी योर जेनेटिक एंड ड्रग ऑफ चॉइस विद मेफेनामिक एसिड ड्रग ऑफ चॉइस वुड बी योर मेफेनामिक एसिड सेकेंडरी डिस्मेनोरिया विद द ऑर्गेनिक pelvic pathology the most common cause would be endometriosis. Endometriosis means the presence of endometrium away from the uterus. Now sir, can you please allow me 10-15 minute break? 15 minute 10 minutes please. Can you tell me? I need some break. Are you allowing me to take a break please if possible? Let's chat is stuck I think. Okay, 15 minutes fine for you or 10 minutes? So let's take for 4:15. I'll see you all at 4:15. Love you all. See you with the obs and gynae. Speedily we will go all through this and we will be doing it very very quickly. Okay, chalo done. I'll see you guys in a while. Thank you so much. Just take a break and come back please. Okay, please. Platform on Telegram with interaction with all the faculties. Free access to the NLC app with more than 10,000 questions. Chanting session by Dr. Paras and previous year questions by Dr. Sara. So we offer clinical case discussion, TNDs and rapid revision classes, 24/7 mentorship by Team NLC and Dr. Ashish Kumar. A study center will be available 24/7. We offer cafe, mess inside the campus only. We are also having a welcome to the next learning center. So here is the introduction to our mentor, Dr. Ashish Kumar. So online and offline face-to-face courses offered for FMG and next exam, our super special regular batch, vacation batch, special batch for next 2023 exam, rapid revision and chanting batch, test series, Q bank and hybrid batch. So we are soon going to start for the batches for December FMG exam. So our hybrid batch is starting on 1st and 10th April. Our regular offline batch in Delhi, Hyderabad and Calicut is starting on 20th, 30th June. Then coming to the live interactive batch, it is starting on the 5th of June. So salient features of the NLC. All 19 subjects would be covered by renowned faculties. Systemic, subject-wise tests, topic-wise tests, monthly tests and weekly tests. A doubt clearing platform on Telegram with interaction with all the faculties. Free access to the NLC app with more than 10,000 questions. Chanting session by Dr. Paras and previous year questions by Dr. Sara. So we offer clinical case discussion, TNDs and rapid revision classes, 24/7 mentorship by Team NLC and Dr. Ashish Kumar. A study center will be available 24/7. We offer cafe, mess inside the campus only. We are also having a hostel facility for the girls. So here we are throwing light on the NLC results. So for the offline classes, we offer 19 subjects by best faculties, 900 plus hours teaching, rapid revision sessions, chanting sessions, previous year question sessions, image based question sessions, clinical sessions, then your weekly and monthly tests along with your Q bank on NLC app. Also, for the live interactive online classes, we offer 900 plus teaching, regular course, rapid revision course, chanting, image-based questions, previous year questions, clinical based questions, and also videos will be available after watching the class. So here we are having view on the campus, our hostel, our classrooms. So we are having centers in the different cities. Now we are available for offline classes in Delhi, Hyderabad and Calicut. So this is all about our social media platform. Here we are having integrated learning YouTube channel, integrated learning Telegram group where we are providing free content for our doctors. Happy moment. So our super special faculty team along with the Team NLC, the best faculty team available in the market with the best experience. So our MCA result for year 2021 are achievers. For admissions, contact on the given number, choose the best. Keep on saying, I will pass. So welcome to the next learning center. So here is the introduction to our mentor, Dr. Ashish Kumar. So online and offline face-to-face courses offered for FMG and next exam, our super special regular batch, vacation batch, special batch for next 2023 exam, rapid revision and chanting batch, test series, Q bank and hybrid batch. So we are soon going to start for the batches for December FMG exam. So our hybrid batch is starting on 1st and 10th April. Our regular offline batch in Delhi, Hyderabad and Calicut is starting on 20th, 30th June. Then coming to the live interactive batch, it is starting on the 5th of June. So salient features of the NLC. All 19 subjects would be covered by renowned faculties. Systemic, subject-wise tests, topic-wise tests, monthly tests and weekly tests. a doubt clearing platform on Telegram with interaction with all the faculties. Free access to the NLC app with more than 10,000 questions. Chanting session by Dr. Paras and previous year question set by Dr. Sara. So we offer clinical case discussion, TNDs and rapid revision classes, 24/7 mentorship by Team NLC and Dr. Ashish Kumar. A study center will be available 24/7. We offer cafe, mess inside the campus only. We are also having a hostel facility for the girls. So here we are throwing light on the NLC results. So for the offline classes, we offer 19 subjects by best faculties, 900 plus hours teaching, rapid revision sessions, chanting sessions, previous year question sessions, image based question sessions, clinical sessions, then your weekly and monthly tests along with your Q bank on NLC app. Also, for the live interactive online classes, we offer 900 plus teaching, regular course, rapid revision course, chanting, image-based questions, previous year questions, clinical based questions, and also videos will be available after watching the class. So here we are having view on the campus, our hostel, our classrooms. So we are having centers in the different cities. Now we are available for offline classes in Delhi, Hyderabad and Calicut. So this is all about our social media platform. Here we are having integrated learning YouTube channel, integrated learning Telegram group where we are providing free content for our doctors. Happy moment. So our super special faculty team along with the team NLC, the best faculty team available in the market with the best experience. So our MCA result for year 2021 are achievers. For admissions, contact on the given number, choose the best, keep on saying I will pass. So welcome to the next learning center. So here is the introduction to our mentor Dr. Ashish Kumar. So online and offline face-to-face courses offered for FMG and next exam, our super special regular batch, vacation batch, special batch for next 2023 exam, rapid revision and chanting batch, test series, Q bank and hybrid batch. So we are soon going to start for the batches for December FMG exam. So our hybrid batch is starting on 1st and 10th April. Our regular offline batch in Delhi, Hyderabad and Calicut is starting on 20th, 30th June. Then coming to the live interactive batch, it is starting on the 5th of June. So salient features of the NLC. All 19 subjects would be covered by renowned faculties. Systemic, subject-wise tests, topic-wise tests, monthly tests and weekly tests. A doubt clearing platform on Telegram with interaction with all the faculties. Free access to the NLC app with more than 10,000 questions. Chanting session by Dr. Paras and previous year question set by Dr. Sara. So we offer clinical case discussion, TNDs and rapid revision classes, 24/7 mentorship by Team NLC and Dr. Ashish Kumar. A study center will be available 24/7. We offer cafe, mess inside the campus only. We are also having a hostel facility for the girls. So here we are throwing light on the NLC results. So for the offline classes, we offer 19 subjects by best faculties, 900 plus hours teaching, rapid revision sessions, chanting sessions, previous year question sessions, image based question sessions, clinical sessions, then your weekly and monthly tests along with your Q bank on NLC app. Also, for the live interactive online classes, we offer 900 plus teaching, regular course, rapid revision course, chanting, image-based questions, previous year questions, clinical based questions, and also videos will be available after watching the class. So here we are having view on the campus, our hostel, our classrooms. So we are having centers in the different cities. Now we are available for offline classes in Delhi, Hyderabad and Calicut. So this is all about our social media platform. Here we are having integrated learning YouTube channel, integrated learning Telegram group, where we are providing free content for our doctors. Happy moment. So our super special faculty team along with the team NLC, the best faculty team available in the market with the best experience. So our MCA result for year 2021 are achievers. For admissions, contact on the given number, choose the best. Keep on saying I will pass. So welcome to the next learning center. So here is the introduction to our mentor Dr. Ashish Kumar. So online and offline face-to-face courses offered for Fmge and next exam, our super special regular batch, vacation batch, special batch for next 2023 exam, rapid revision and chanting batch, test series, Q bank and hybrid batch. So we are soon going to start for the batches for December Fmge exam. So our hybrid batch is starting on 1st and आपने ला रा 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 रे, ला 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 रा 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 रा, ला ला ला. No guys. Yeah. Oh yeah. Ladies and gentlemen, friends and best friends, all are back with us. Congenital malformation of the uterus, sir. Uterine didelphys. It is your uterine didelphys, or it is also known as double uterus. Sir, why it is happening? How it is happening? If Mullerian duct do not fuse at all, there will be what? There will be uterine didelphys or double uterus. Uterine didelphys or double uterus. Uterine didelphys or double uterus. Sir, remember, bicornuate uterus or heart-shaped uterus. Bicornuate uterus or heart-shaped uterus. How you have to remember? A Mullerian duct. A Mullerian duct fuse partially. A Mullerian duct fuse partially, and remember there might be chances of single surface to uterus and there might be chances of two cervix to uterus. This is a heart-shaped uterus. This is heart-shaped uterus. Now, sir, I think Atulya, there is a lag. There is a lag here also. Can you please come here? This screen also there is a lag, and please look into the issue. Now it is fine. People over there, it is fine now. iPad screen is stuck. Oh shit. I think it is stuck. No, it's going. sir. All the ladies and gentlemen, friends and हो गया, जादू हो गया भाई. जादू है, नशा है, मदहोशियां है, ला रा 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 रा. Come back. Bicornuate uterus or heart-shaped uterus. Sir, then coming to the septate uterus. It is the most common type of uterus. Again, it is stuck there. It is fine now or not? Please confirm me, guys. It is the फंस गया आज. कितना फंस रहा है यार, गलत बात है, इतना नहीं फंसना चाहिए यार आज. It is fine. Why they are saying this? Guys, septate uterus most common. Septate uterus most common type, pathological septum, and remember the treatment is hysteroscopy resection of the septum. Now, unicornuate uterus or banana shaped or penis shaped uterus, only one Mullerian duct is diffuse. Arcuate uterus, there is a flat topped uterus. So diagnosis of congenital malformation of uterus is best done by your laparoscopy and hysteroscopy. The best diagnosis would be laparoscopy and hysteroscopy is better answer than MRI. So now most common use is TVS. But most commonly we use a transvaginal sonogram. Next thing you have to remember is PCOD. Confirm MCQ on 4th of June is coming from the PCOD, sir. Remember what is PCOD? Is a polycystic ovarian disease, also known as Stein-Leventhal syndrome. There is an insulin resistance. Because of insulin resistance, there is an increase in insulin and there is increase in free androgen. Sir, symptom is tendency toward the obesity. Number one thing is tendency toward obesity, acne, hirsutism, androgenic alopecia, oligomenorrhea. PCOD most commonly presenting with the oligomenorrhea, matlab less menses or delayed menses. Delay menses, menses coming after 35 days, and also amenorrhea. Infertility can also be there. Long-term complication, which is recent NEET PG exam question, metabolic syndrome. Sir, what is happening in the metabolic syndrome? Remember, PCOD plus diabetes plus obesity plus hypertension. And what is the diagnostic criteria we're using here? It is a Rotterdam criteria. Sir, Rotterdam criteria is used for the diagnosis of PCOD. Rotterdam criteria, USG features are very important. Number of follicles more than 12, number of follicles more than 10, sir. Size of follicle 2 to 9. Size of follicles 2 to 9, and ovarian volume is more than 10 cc, and necklace or string or pearl sign on USG. Necklace or string or pearl. Necklace or string or pearl sign on USG. Necklace or string or pearl sign on USG. Sir, normal E2 E1 ratio is 2:1, but in PCOD it will become just opposite, that is 1:2. Normal FSH LH ratio is 2:1, and PCOD FSH it will 1:2. Done. So normal androgen levels are 70. It is up to 70 only, but in PCOD, guys, remember it is 70 to 150 nanogram per ml. Now, sir, management. First of all, you have to decrease the obesity. If no response is coming, you will go for the drug of choice for the diabetes. Diabetes, that is your metformin. Management of androgenic feature is by the OCPs. Androgenic features is managed with the help of OCPs, oral combined pills, which is a drug of choice for recently married couple. The contraceptive of choice in the recently married couple would be your OCPs. Sir, management of oligo or amenorrhea. Oligo, where oligomenorrhea is there, mean less menses is coming, then you will use a progesterone withdrawal bleeding. You all know in the menstrual cycle, because of less progesterone, there was bleeding. Now you can give a progesterone and suddenly you can withdraw the progesterone and it will lead to bleeding. Now, management of infertility, very important. Previous year MCQ, drug of choice for infertility would be latrozole. Sir, puberty, you remember precocious puberty and precocious menarche, then it is delayed puberty. How you will manage this condition? If your secondary sexual characteristic or your puberty, your features are coming before the age, that is something known as precocious puberty and menarche. Now, sir, you have to suppress your hypothalamus. For suppressing hypothalamus, we will give continuous GnRH, and for activating hypothalamus, which is required in the delayed puberty, means after 14 years also, now your secondary sexual characteristics are not coming. They are not coming. In such conditions, sir, you have to do what? You have to give a continuous GnRH. In such conditions, sorry, you have to give what? You have to give pulsatile GnRH to start the hypothalamus, pulsatile to suppress the hypothalamus. It is continuous GnRH, continuous GnRH. Sir, coming to the vaginitis, 200% exam question from all these 4 topics on the 4th of June. Ek screenshot le lo bhai. Sec paper number 2, question number 299 is coming on 4th of June in front of you. Are you all ready to get the 1 marks? Be with me for another 5 minutes and you are good with this. Sir, trichomonas vaginitis mean by it is caused by trichomonas vaginitis. There is a greenish yellow discharge, and remember there is a strawberry vagina. Or agar bina puche, without permission, you will take strawberry from the vagina. A vagina will be angry. It is known as angry looking vagina. And remember, your management is metronidazole. Management is metronidazole, and the male who has taken this strawberry, that need to be catched. That need to be catched back and treatment, because this is a STD. Because this is a STD. Now, sir, candidal vaginitis. ऊपर भी सफेद, नीचे भी सफेद, because of Candida albicans. ऊपर भी mouth is also white color, and vagina is also white, curdy white cheese like vagina, curdy white cheese like vagina. And remember, management is fluconazole. Male partner is treated. Male partner is treated. Why male partner is treated, sir? Because if male partner is treated when it is symptomatic. मतलब अगर दूध दही यहाँ पे लगा हुआ तो क्या बोलेगा? मैया मोरी मैं नहीं माखन खायो, ओ मैया मोरी मैंने, वो कह नहीं बेटा नहीं, ये देखिए लगा हुआ मुंह पे, मतलब खा के आया, सिम्टोमेटिक है, तेरा ट्रीटमेंट हो रहा है, फ्लूकोनाजोल। क्या दोगे? फ्लूकोनाजोल। डंडना। सर, क्लेमाइडियल वेजिनाइटिस चल दिया, तेरे आगे पीछे चल दिया। क्लेमाइडियल वेजिनाइटिस, क्लेमाइडिया ट्रैकोमाइटिस मोस्ट डेडली, और इसके लिए गोल्ड स्टैंडर्ड इन्वेस्टिगेशन इज मैकॉय और हेला सेल कल्चर। मैकॉय और हेला सेल कल्चर। सर, मैनेजमेंट इज एजिथ्रोमाइसिस और कॉन्ट्रैक्ट ट्रेसिंग। बैक्टीरियल वेजिनोसिस, नो डॉर्डरलाइन बेसिलाई, guys. Remember, pH of vagina will increase. pH of vagina is increasing now because now vagina is becoming what? Basic. Vagina is becoming basic. In basic vagina, who can come? Gardnerella vaginilla. Remember, vagina में garden करने कौन आएगा? Gardnerella vagina. And Amsel's criteria. Sir, Rotterdam criteria is for PCOD. Amsel's criteria is for the bacterial vaginosis. What Amsel's criteria actually want to say us? It want to say now pH is more than 4.5. That is very dangerous. Whiff test, Amis test positive. That means whenever you are putting this vaginal discharge with a 10% QH mount, there will be fishy odor. There will be मछली जैसी बदबू आएगी। सर, मछली जल की रानी है, जीवन उसका पानी है, हाथ निकालो डर जाएगी, बाहर निकालो मर जाएगी। डन 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 डन। Now, sir, gold standard. Also, clue cells are seen. Amsel's criteria, important thing is clue cell, more than 20% if it's present. This is a case of bacterial vaginosis. Sir, gold standard investigation would be your Nugent scale. Nugent score would be more than 7. More than 7. Management is metronidazole. If a male partner is affected, it is not need to be treatment because this is not a STD. This is not a STD. Next 100% MCQ would be your PID, pelvic inflammatory disease. Acute PID, I'm talking about. Sir, remember, organism responsible for a PID would be your chlamydia and Neisseria. Chlamydia and Neisseria, they climb on the sperm, and during the intercourse they enter the vagina. They enter the vagina and they will lead to inflammation. That inflammation will lead to a lower abdominal pain, and this disease is known as pelvic inflammatory disease. Sir, remember, this is an ascending infection. That means it is starting from the uterus, then going to fallopian tube, then going to the ovaries, then going to the peritoneum, then going to the peritoneum. Dun. Ascending infection है दोस्तों. Acute PID I'm talking about. In acute PID you are going to see pyosulfing. Acute PID you are going to see the pyosulfings, and most common causes intercurrent, and most common symptom lower abdominal pressure. Sir, can you tell me which kit you will give in this patient? Which STD kit you will give in this patient? And the investigation of choice is laparoscope. Investigation choice is laparoscope. There are criteria, minimum, additional and definitive criteria. Minimum, additional and definitive criteria. Done. Sir, management of PID, how your acute PID I'm talking about. Culture. If culture sensitivity OPD patient is coming, then you have to give injections, ceftriaxone, tab doxy and tab metronidazole. Doxymetra is a tab you are giving to the OPD patient, and injection is ceftriaxone. A very much correct answer is yellow kit. Very good. IPD patient, septicemia. Septicemia is present, then you will get IV Clindagenta for the IPD in patient demand, emergency में आता क्लिंडाजेंटा देना है, डंडना 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 डन. Then sir, coming to the chronic PID. Chronic PID, pain in the abdomen on the moment of stretching, because of chronic inflammation there is a fibrous band present over there. Because of this fibrous band, whenever they are moving, there is intense pain, and this syndrome is known as Fitz-Hugh-Curtis syndrome. So question number 1 to all of you, Fitz-Hugh-Curtis syndrome is seen in acute PID or chronic PID? Fitz-Hugh-Curtis syndrome is seen in acute PID or chronic PID? Sir, your very much correct answer is it is seen in chronic PID. Also, you will see in chronic PID cogwheel sign, hydrosulfing. Sir, pyosulfing is a typical feature of acute PID, and hydrosulfing is a typical feature of chronic PID. Investigation choice will be laparoscopy, and there will be Voiling string operation. There will be Voiling string sign. Voiling string sign is an image-based question which has been asked in the exam. If any of you want to help your classmates, please click the photo and post in the integrated learning channel group. Done. Now sir, complication of PID. See, if there is a partial blockage, it can lead to ectopic pregnancy. If there is a complete blockage, it will lead to infertility. Done. Now sir, coming to the next thing, that is endometriosis. Endometriosis, as I already told you, endometriosis means presence of active endometrial tissue away from the uterus sir. ठीक है, उसके बाद क्या है, इसके बाद इसके अंदर है genetic condition. Most commonly genetic condition is responsible for this, and that is known as KRAS mutation. This is known as KRAS mutation, and most accepted theory for the endometriosis would be your Sampson theory of retrograde menstruation. Sampson theory of retrograde menstruation. And remember, symptom most commonly dysmenorrhea, then dyspareunia. Pain during the intercourse can happen in the endometriotic patient, and first most common site where the endometrium can go to enjoy would be your ovary, and second most common site would be the pouch of Douglas. Now sir, per vaginal examination you will see cobblestone feel of uterosacral ligament. This uterosacral ligament is not a true support. Then who is a true support of uterus, sir? Answer is round ligament is a true support. Uterosacral ligament is not a true support. It is not a true support. And sir, your fixed retrovertebral uterus is seen. Now chocolate, your favorite chocolate, ovarian cyst. Guys, remember chocolate cyst is seen. Ovarian cyst, you will see what? Chocolate cyst is seen. Ovarian cyst, chocolate cyst is seen because now your endometrium is present on the ovaries, because it's the most famous site. Also, you will see what? Gunshot powder burn appearance. Gunshot or powder burn appearance. Done. Now sir, if ovarian cyst is less than 3 cm, you will do the aspiration. If ovarian cyst is more than 3 cm, you will do cystectomy. You have to cut the cyst. If there is an endometrial deposit, you will do the cauterization or fulguration. If there is adhesion, you have to cut those adhesion with the help of laparoscope. Sir, medical management is continuous GnRH, because you have to suppress this mensuration. HPO axis, hypothalamus pituitary ovarian axis, you have to suppress, and only you can suppress by giving the continuous G and RH, as I already told you guys. Done. Adenomyosis is present of the active endometrial tissue in the myometrium. ये कौन सी salt paper appearance. It is the most common deadly. ये कहते से ठीक है. And gold standard hysteroscopic management is total abdominal hysterectomy. Sir, coming to the fibroid. Fibroid is a smooth muscle tumor. That is originated in the myometrium. Guys, remember one thing, that is most common benign solid tumor in the female is fibroid. Fibroid can, just one thing you have to remember, nulliparity is a risk factor. Obesity is a risk factor. Early menarche, late menopause is also a risk factor, because more estrogen exposure is there. Genetic translocation between the chromosome number 12, क्या 12. उसका protective factor is a physical exercise. Fibroid का protective factor physical exercise, and your smoking. सुट्टे बार हुक्का। यो फीमेल स्मोक करते हैं, इनको कभी नहीं होंगे यूट्राइन फाइब्रॉइड, और ये अमीर लोगों में होते हैं। अमीर फीमेल्स के अंदर है यूट्राइन फाइब्रॉइड, और अमीर फीमेल अगर पिएंगी क्या, सुट्टा पिएंगे, तो कभी नहीं होंगे क्या, फाइब्रॉइड। गाइस रिमेंबर, मोस्ट कॉमन फाइब्रॉइड वुड बी इंट्राम्यूरल फाइब्रॉइड, मोस्ट ऑफ द फाइब्रॉइड्स आर एसिम्प्टोमेटिक. इफ दे आर प्रेजेंटिंग सिम्पटम, दे विल बी प्रेजेंटिंग विद द एक्सेस ब्लीडिंग, extra bleeding. ठीक है guys, remember intrauterine fibroid, most common menorrhagia, we can see pinkish white rubbery consistency. Most common presentation of fibroid would be asymptomatic. A symptom is present, that is menorrhagia. मन भर के bleeding आई, menorrhagia. More than 80 ml bleeding आई, menorrhagia. Now extrauterine fibroids are also there. ठीक है, ध्यान रखना एक्स्ट्रा यूट्राइन एंड मोस्ट कॉमन इट इज सर्विकल फाइब्रॉइड्स. एक्स्ट्रा यूट्राइन मोस्ट कॉमन वुड बी सर्विकल फाइब्रॉइड. दिस इज एग्जाम क्वेश्चन. Two walls are there of cervix, anterior wall and the posterior. अगर आगे anterior wall पे there is a cervical fibroid, there will increase in the frequency of the micturition, and if there is on a posterior wall, there is a retention of urine and constipation. Then coming to the fistula, not that important. Another important thing you need to know, sir, it is your infertility. Cheers to all my FMG friends over here. ये देखो शरबत आई है, पी लो. दोस्तों, ovarian factor, most common cause is anovulation, and most common cause of anovulation would be PCOD. Most common cause of anovulation would be PCOD, and best test to diagnose anovulation would be serum progesterone. Would be your serum progesterone. ठीक है, उसके बाद क्या है? Due to PCOD, the drug of choice would be letrozole. If infertility is due to PCOD, the drug of choice is letrozole, and if it's due to idiopathic dysfunction of HPO axis, the management is pulsatile GnRH, because you have to start the hypothalamus. You have to start the hypothalamus. Tubal factor, you can see tubal blockage is there. You can see here no dye is coming from this side, means there is a tubal blockage, and tubal blockage is open. Best diagnosis is done for the tubal blockage at 10th day, and the treatment is chromopertubation. The treatment is chromopertubation. Then coming to the next important thing I want to tell you, that is your menopause. Cessation of menses for more than 1 year in India. That is, in India the age is 47 years. In India the age is 47. Cessation of menses for more than 1 year in menopause age, and India it is 47 year. At menopause, cessation of HPO axis, there is decrease in estrogen, there is decrease in progesterone. Now, earliest symptom which has been asked in the exam, sir, this is your hot flushes, and the management is tibolone. Earliest most common is hot flushes, and the management is tibolone. Osteopetrosis, guys, remember the drug of choice is bisphosphonates. Osteopetrosis, the drug of choice is bisphosphonates. And for the vaginal dryness, you can treat it with the help of local estrogen cream. How you remember about the local estrogen cream, guys? Remember, female skin is very soft because of estrogen, and it can make your vagina also soft if you use a estrogen cream over there. If there is decrease in libido, that is treatment is androgen. Now, sir, obstetric, I'm talking about placenta is formed at decidua bacillus plus chorion frondosum. Most common site of placenta, upper posterior, fundo posterior. Sir, weight is 500, maternal volume and the fetal. Fetal volume is little greater, that is 350, and maternal it is 150. Eternal it is, and हाँ बिल्कुल ड्यूरेक्स के लुब्रिकेंट, बड़ी सारी बातें याद आ रही हैं, आए हाय, सारे लुब्रिकेंट आज ही लगा दोगे. नॉटी बॉयज एंड नॉटी गर्ल्स, शर्म तो नहीं आती तुमको? Sir, then is the umbilical cord. The length is 3200 centimeter. Umbilical cord का length कितना? 3200 centimeter. There is a fold of Hobocon present in the umbilical cord, and that is filled with the MCQ jelly. And the name of MCQ jelly is Sir Wharton's jelly. And remember, this is exam question. 2 umbilical arteries and 1 umbilical vein. 2 umbilical arteries and 1 umbilical vein is present over there. Now, sir, umbilical artery is providing the impure blood, deoxygenated blood, and your left umbilical vein, which is left, that supplies your pure blood. Dun, dun. Sir, normal placenta and internal os, the distance should be more than 2 centimeter or 2.5 centimeter. It should be more than that. This is known as normal placenta. See, you can distance between the internal os and the lateral margin of the placenta is more than 2 centimeter. Normal. If it is near, if it is less than 2 centimeter, then it is low lying placenta, and if it placenta is covering the full internal os, this is known as placenta previa. It is known as placenta previa. Dun. Now, sir, suction churiate placenta. See how you have to remember. One bigger lobe, one small lobe connected with the blood supply. This is known as suction churiate placenta. Now, sir, one big lobe, one small lobe without blood supply. This is known as placenta spuria. This is known as placenta spuria. Then battledore placenta. Sir, placenta bilobata. 2 equal size lobes are there, and they are connected with the blood supply. That is known as placenta bilobata. Sir, battledore placenta. If the umbilical cord is inserted at the placenta margin, this is known as battledore placenta. filamentous insertion of the umbilical cord. That means now the placenta should not be inserted in the center. It is inserted anywhere on the umbilical cord, anywhere on the umbilical cord. Dun 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 dun. Now sir, vasa previa, if vessels are covering, see this, vessels are covering the internal os, this is known as vasa previa, this is known as vasa previa, this is known as vasa previa, vasa previa. Sir, amniotic fluid, if I talk about source, up to 7 weeks should be ultrafiltrate of maternal plasma, ultrafiltrate of maternal plasma. Please Atulya, there is a video quality issue going on. Screen is getting stuck here. Screen lag is there. It's fine, na? I think the network issue is a problem. From my side, it is absolutely fine. What Guru Mantra I have told you, that you can just skip the class and then re-enter. It will be fine. It will be fine. Done, 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 done. So remember, up to 7 weeks, what is the source of amniotic fluid? It is your ultrafiltrate of maternal plasma. 7 to 20 week, it is diffusion from the fetal skin. More than 20 week, it is your fetal urine. Fetal urine. And what is the normal turnover time? It is your 3 hours. Turnover volume 500 cc. 500 cc. Sir, oligohydramnions and polyhydramnions. Just remember, single deepest polyp in the single deepest pocket in the oligohydramnions would be less than 2 centimeter, and amniotic fluid index, it is less than 5. It is less than 5, and amount is less than 200. Amount is less than 200. Polyhydramnions, remember the SDP is more than 8. SDP single deepest pocket is more than 8, and AFI is more than 25, and your amount is more than 2000. Just remember this thing for now. So now amniotic fluid color changes is also very important. Please remember, color is colorless. Amniotic fluid color is colorless. At term it is of straw color. RH incompatibility, it is a golden yellow color. Post term it is your greenish yellow. Intrauterine fetal demise pattern, it is blackish brown. Antepartum is dark brown. Antepartum it is dark brown. ठीक है. प्रेगनेंसी की बात करेंगे, फर्स्ट ट्राइमेस्टर इज अप टू 12 वीक्स, सेकंड ट्राइमेस्टर 13 to 28 वीक, थर्ड ट्राइमेस्टर मोर देन 29. इट इज मोर देन 29. You have notes now, please look on to that. Expected date of delivery is given by Nagler's formula, LMP plus 9 months and 7 days. Screen is again stuck. Oh my god, today is not a good day for all of us. नजर लग गई है काली, वो कदर उतार दे इसकी नजर कंप्यूटर की आज. चलो रिकनेक्ट करते हैं. आई थिंक इट इज कनेक्टिंग अगेन. लाई भी न गई ताने भाई भी न गई, मैंने छोड़ दे पतल दिया नारा, तेरी मेरी ओर टूट गई सोनिए, जी मैं टूटिया अंबर तो तारा. भाई हिला के दिखा रहा हूं. नींबू मिर्ची लाओ, इसकी आईपैड को ठीक करो एक बार. आईपैड अब तुम्हारी कृपा से नया ही लेंगे. इतनी क्लासें ले दी ना इस पे मैंने. अरे is fine or still stuck? Please tell me what is going on in my life. क्या हो रहा है? It's fine ना? Can you please, technical expert? It's fine. Stuck है. ये क्या हो रहा है भाई आज, प्लीज ऐसा नहीं चलेगा भाई। मिरर हो रहा है ऑलरेडी। स्टॉप मिररिंग, फिर ऑन मिररिंग। Okay, it's fine. It's fine now. It's fine now. Let's come back. Expected date of delivery is defined by the Nagr's formula and LMP plus 9 months plus 7 days. This is a formula. Now, true period of conception is known as 280 days minus 14. That is 266 days. That is 266 days. Yes, done, 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 done. मोनी कह रहा पैपा और की स्प्रे लेके आओ सर. ओवुलर पीरियड. Okay, I will take more class today. Don't worry. 12 बजे तक ले लेंगे. Ovular period is up to 2 weeks. Embryonal period 3 to 8 weeks. Fetal period 9 weeks onward. Done, 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 done. Sir, symptoms which are very modern in the pregnancy. Please, 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 please. First trimester earliest is amenorrhea. First trimester the earliest is amenorrhea. It is due to HCG. Morning sickness, increased frequency of maturation, lethargy, and breast discomfort. तो पहले trimester में a patient would be coming to you. A patient would be coming to you saying, Doctor Saab, there is a guys, others morning sickness, earliest in the first trimester symptom, a patient would be telling you, doctor periods nahi aa rahe. Then morning sickness, sir, can you tell me a drug of choice for morning sickness? All of doctors be with me. A drug of choice for morning sickness, whoever will give me, I will give him water. Yes, पानी के बदले आंसर के बदले पानी मिलेगा. Yes. Now sir, second trimester quickening movement will be there. Quickening mean perception of fetal movement. Now sir, multigravida it is 16 week, primigravida it is 18 week. Now sir, third trimester lightning or welcome sign. Welcome everybody, very 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 welcome. Daxila mine is the correct answer. जवाब देने वालों को ट्रक भर के प्यार. दोस्तों, lightning और welcome sign. Primigravida 38 week, multigravida at the time of labor. Signs की बात करेंगे. Earliest is Goodell sign. Goodell sign is a soft cervix. Goodell sign is a soft cervix. Bhai, today what is happening? I'm really disappointed. Earliest it is Goodell sign, more than 6 weeks. Soft cervix is seen. Remember, other sign if I talk about Jacquemies or Chadwick's. जख्मी कर दिया, नीला कर दिया, मार मार के. Bluish violet discoloration of cervix, vagina, vestibule due to venous congestion. That is known as Jacquemies. Oscillator sign, sir, pulsation of the uterine vessels on pervaginal examination. Pulsation of the uterine vessel on pervaginal examination is an oscillator. Pisaki sign, asymmetrical enlargement of the uterus. Palmer sign, when two fingers, one from the abdomen, one from the vagina, going and approximating each other, that is known as Palmer sign. That is known as Palmer sign. That is known as Palmer sign. Now, sir, no, this is not Palmer. Sorry. ध्यान दो यार, से थोड़ा भटक गया था मैं. Palmer is on her abdomen. Whenever you are putting your palm like this, there will be some tone due to uterine contraction, and those uterine contraction are the pseudo labor contraction less than 8 mm, and that contraction is known as Braxton Hicks contraction. That contraction is known as Braxton Hicks contraction, and that is Hager sign. You are putting one finger from the abdomen, other you are putting from the vagina. They both are approximating each other. Sir, this is known as Hager sign. This is known as Hager sign. Sir, remember second trimester sign, you will see a palpation of fetal part and auscultation of fetal heart sound. Palpation of fetal part, and there is a auscultation of fetal heart sound. Now it's a third trimester, there is a lightning or a welcome sign, best clinical sign of pregnancy. Now, sir, earliest investigation for the pregnancy is the uterine pregnancy test. ठीक है, UPT. ठीक है, earliest investigation, but it's not the best investigation. Best investigation is a blood investigation, that is FIA or RIA. In FIA, RIA, who is better? FIA is better than RIA, and you will check what, sir? Check what, sir? HCG level. It's not now stucking, yaar. भाई आई थिंक इट इज लैगिंग एंड सम इश्यूज आर गोइंग, दे आर नॉट एबल टू गेट इट यार। सही कह रहे हैं वो भी, ऐसे तो क्या ही मजा आएगा। आवाज बंद करना, एक मिनट, आवाज बंद करना पहले। fully ready. Mike. It's not coming. मेरे पे तो ब्लैक स्क्रीन आ रही है, लोड नहीं हो रहा आई थिंक सो मेरे आईपैड में. Now it should be fine from all the sides. I think problem is with the iPad today because overheated. Give him some rest. Now sir, if everything is fine, we can start. How will I get the signal? Let me just switch on my chat and I will come to know that you people are here or not here. Now sir, I think everything is fine. Sir, I think everything is fine. I think now, ladies and gentlemen, hi everyone. I think now is fine. We have changed the iPad, so by God's grace, now we should speed up the things. So sir, earliest investigation we were talking, that is a urine pregnancy test, and remember best time is early morning. When to check with the UPT? Early morning is the best time sir, and there is a blood test also which is a best test. Earliest investigation would be UPT and the best investigation is blood. What you have to check in the blood, so it is HCG level, beta HCG level. And guys, remember this was a question in your exam. HCG is secreted by syncytiotropoblast. It is secreted by syncytiotropoblast. HCG doubles every 48 hours. Number 1 MCQ. Peak is coming at 10 weeks, sir, and plateau at 16 weeks. Sir, HCG doubles every 48 hours. Peaks at 10 week and plateau at 16 week. Disappear from the circulation 2 weeks after the delivery. HCG is gone. After delivery 2 weeks the circulation is gone. Done. See, blur is from your side, it's not from my side. On my side it is perfectly clear right now. We have created some changes, changed the iPad. Now everything is fine. Give me a thumbs up if everything is fine. Let's speed up this process. Sir, gestational sac, yolk sac and embryonal sac, when they are visible on the transvaginal and the transabdominal ultrasound, it is very simple. Gestational, yolk and embryo. Gestational, yolk and embryo. Sir, remember 4, 5, 6. 4 weeks, 5 weeks, 6 weeks. Gestational sac, yolk sac, embryo sac. 4 weeks, 5 weeks, 6 weeks. Transabdominal, it is 5 weeks, 7 weeks, 8 weeks. 5 weeks, 7 weeks, 8 weeks. Best USG parameter is crowned rump length. Best USG parameter is crown rump length. And best sign of pregnancy is visualization of the activity by USG. Visualization of the activity by USG is the best sign of pregnancy. Done. Sir, changes in pregnancy. Remember, face pe brown mass is there, that is melasma. Breast mein there is an enlargement, discomfort, there is a Montgomery tubercle, hypertrophied sebaceous gland. We have seen those in the surgery. Then colostrum after 12 weeks. Whenever you're pressing the breast, there is a colostrum coming on here. So see, the sponsors are here. See, oh my God. Now, xiphisternum to pubic symphysis, there is a black color line. There's a black color line. It is known as linea nigra. It is known as linea nigra. And there is a curvy linear line of which color is a pinkish red line. It is pinkish red line. This is known as stria gravidum. After delivery, this stria gravidum is now converted into stria albicans because this curvy linear line turning into white color. Now turning into white color. Now, sir, vagina will become violet color and it is most acidic. So remember, pregnant vagina is acidic vagina. So you should stay away from the acidic vagina, वरना क्या हो जाएगा, आग लग जाएगी, जल जाओगे. Done. So assessment is not that important. Now what thing is important is your this Caldwell-Molly classification for the shape of inlet. Sir, number one is gynecoid pelvis and android pelvis. Gynecoid pelvis and android pelvis. Gynecoid and android pelvis. Guys, remember gynecoid is most common and it is round. कैसा है? Round. Android कैसा है? Heart shape. Android is heart shape. Anthropoid pelvis is anterior posterior diameter is greater than transverse diameter and it is ape-like. Sir, then coming plateploid. Plateploid is plate-like pelvis. It is your plate-like. ठीक है, plate like and flat pelvis, bowl shaped pelvis also. Contracted pelvis mean if any major diameter, which we just skipped it, if any major diameter is less than 0.5, the diagnosis is MRI and the management is cesarean section. That is known as contracted pelvis. Sir, congenital contracted section, remember, Naggles means one ella is absent. Naggle, one naggle. Both ella absent. Roberts में क्या है? Both ella is absent. Then coming, sir, CPD, cephalopelvic disproportion. Guys, remember, disproportion between the fetal head and the pelvis. Diagnosis is MRI and clinical diagnosis is trial of labor. If mild CPD is there, diagnosis treatment is trial of labor. If the severe CPD is there, treatment is cesarean section. The treatment is cesarean section. Oh my God, Habib Ahmed is watching this video from the airport. Do post this on Instagram. I would love to share on P Jamwal 7. ये वही ना memories. Daring काम है, airport पे भी देख रहा है भाई, ठीक है. Now station is a relationship between the presenting part and the ischial spine. Presenting part and the ischial spine. Guys, remember, if it is at the ischial spine, it is 0 station. If it is above ischial spine, it is minus. If it is below ischial spine, it is plus station. Done. Now, sir, transverse engaging diameter, which is important. Most common is pragmatic, that is 9.5, and the largest is your mento-vertical, that is 14 centimeter. First stage of labor is from true uterine contraction to the complete cervical dilatation. Second stage is complete cervical dilation to the delivery of baby. Third stage is expulsion of placenta, and the fourth is 1 hour observation after the placental expulsion. Done. So now first stage is up to 4 centimeter dilation. Second is 4 to 10 centimeter dilation. Then remember, Partogram is to check the progress of labor. If alert line is crossed, it is prolonged labor. If axial line is crossed, it is known as treatment is immediate cesarean section. And what is the time interval between the alert line and the axial line? Sir, your answer is 4 hours. Your answer is 4 hour. ठीक है. चलो उसके बाद कहते करेंगे प्लेसेंटल सेपरेशन के 2 मेथड होते हैं. मोस्ट कॉमन मेथड वुड बी योर most common method would be your Schultz method. It is your Schultz. Most common method is your Schultz method. And remember, Duncan method means placenta is separated from the margin. And Schultz means placenta separated from the center. Done. Then coming, sir, your uterine contraction in the first stage, it is 40 to 50 mmHg. Second and third stage is 100 to 120 mmHg. Now Montevideo unit is something you have to just remember. In the first stage, it is 120 to 150. Second and third stage, 300 to 360. Now, sir, what is happening here, important thing is premature rupture of the membrane. If the membrane rupture even before the onset of labor, this is known as PROM. Most common causes Gardnerella. Other causes would be polyhydramnion and multifetal pregnancy. Diagnosis, it is nitrazine or litmus paper test, red to blue. Take cervico-vaginal secretion, furning pattern is seen. What is seen? Furning pattern. Sir, less than 34 weeks, steroid, tocolytic, MgSO4 and antibiotics. If there is a preterm rupture of membrane before 34 weeks, you have to give the steroid for the lung maturity, tocolytics to stop the labor, magnesium sulfide for the avoiding of any neurological defect, and antibiotic because it is a causes infection. And more than 34 weeks, you just have to start the labor because already membrane is ruptured, and by 34 weeks, lung maturity is also achieved, and and also you have to add the antibiotics. So now prolonged labor, it is there. Remember, prolonged labor management is oxytocin or artificial rupture of membrane. It will actually release the prostacyclin, and prostaglandin, what they do the contraction. They do the contraction, and that is a management of prolonged labor, which is assessed by the protogram. It is assessed by the partogram. Now, sir, obstructed labor pathological ring is seen, that is your Bendel's ring. Pathological ring is seen, that is Bendel's ring, and Schroeder's ring, which is a physiological ring, which is also seen in obstructed labor. This is seen due to indigenous use of the oxygen. Undishunt use of the oxygen will show us Schroeder's ring, which is a physiological ring and which is a constriction. Bad ring, bad is pathological ring. It is seen in the obstructed labor. Obstructed labor, two rings are seen. One is bad ring, that is Bendel's ring, pathological. Another is physiological, that is your Schroeder's ring. That is your Schroeder's ring. And treatment of obstructed labor is cesarean section. Cesarean section. Done, 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 done. Now, sir, important thing we need to remember is augmentation of labor. Surgical method is artificial rupture of membrane. Already it will release prostaglandin. There will be some. Now, medical method, drug of choice for the augmentation of labor is something which has been asked in the exam. It is your oxytocin. It is your oxytocin. Sir, ectopic pregnancy means the implantation of fertilized ova outside the uterus, and the most common site of implantation would be ampulla. Why ampulla, sir? Because fertilization occurs in the ampulla itself. The earliest site of tubal rupture would be isthmus. Why isthmus? Because isthmus is the narrowest site. And most common site of tubal rupture, already done. Most common symptom would be lower abdominal pain. And sir, in lower abdominal pain, which kit you will give? Again, the PID wala answer is correct, all of you. Now, sir, investigation of choices, TVS and beta HCG. TVS and beta HCG. Gold standard, it is laparoscopy, and you will see a MCQ that is known as Buggale sign. Buggale sign on USG is seen in ectopic pregnancy, and color Doppler you will see what? Ring of fire. On color Doppler you will see what? Ring of fire. And sir, management, it is expected management. Wait for the spontaneous resolution, otherwise you have to give the medical management. Medical management actually depend on the beta HCG. If beta HCG is 1000 to 5000, then you will go for the drug of choice, that is methotrexate. Methotrexate. And guys, remember, medical management, if beta HCG is more than 5000, and also if there is no response of the medical management, then you will go for the surgical management. You will go for the surgical management. In this case, you have to do two assessment, that there is a hemodynamical stability or not. Sir, if it is dynamically stable, then you will go for the linear salpingostomy. Linear salpingostomy. And if hemodynamically unstable plus there is a ruptured ectopic pregnancy, then there is a laparotomy and salpingectomy. Laparotomy plus salpingectomy. Sir, Bishop score is used for the cervical scoring system, which is actually telling us whether to start the labor, whether to induce the labor or not. If the score is more than 9, then you have to initiate the induction of labor is possible. Done, done, done. Sir, antepartum hemorrhage is some hemorrhage bleeding after age of viability before the delivery of baby. What is the age of viability in the India, sir? It is 28 weeks and before the delivery of the baby. If any hemorrhage is occurring, that hemorrhage is known as antepartum hemorrhage, and most common causes Abruptio Placenta, and the other causes of Placenta Previa. Placenta Previa. Sir, Placenta Previa, you already know, if your placenta is covering the internal os completely, that is known as Placenta Previa. Placenta Previa. Now, Brownie's classification is for a Placenta Previa type 1, type 2, type 3, type 4. Type 1, type 2, type 3, type 4. Type 1, it is now away, but 2 centimeter, but little away from the internal os. Lower edge of placenta is within 2 centimeter. Within 2 centimeter means it is coming near stage 1. It is reaching very near stage 2. It is incompletely covering the cervix, that is type 3. If it is completely covering, that is your type 4. So type 1 and type 2 anterior, the treatment is vaginal delivery. Type 2 and type 3, type 2 posterior, and type 3 and type 4, the treatment management is cesarean section. The management is cesarean section. Now, sir, abruptio placenta, most common it is separation of placenta. Premature separation of placenta, and most common risk factor would be your history of previous abruption, trauma, hypertension, smoking, cocaine, promin, everything is there. And type of abruption, two type of abruption would be there: concealed and revealed concealed type. In concealed, you can see with the help of diagram that lower edge of placenta is still intact. Lower edge of placenta is still intact, and reveal is both the end of placenta is now removed. Both the end of placenta is now removed. Done. ठीक है, चलो. Where is the sign? File. Abortions we already covered. Done. Now, sir, PIH, pregnancy induced hypertension. If I tell you here, you have to study the preeclampsia. Sir, what is preeclampsia? Increase in BP plus proteinuria is known as preeclampsia. There are two type of preeclampsia, mild and severe. Two type of preeclampsia. It is your mild and severe. Mild, the systolic BP is between 140 to 160, diastolic 90 to 110, 140 to 160, 90 to 110, and severe it is more than 160, more than 110. Systolic BP in the severe more than 160 and diastolic BP more than 110. Guys, remember something, proteinuria. If proteinuria is less than 5 gram in 24 hours, it is mild preeclampsia. If proteinuria is more than 5 gram in 24 hours, this is known as what, severe preeclampsia. Now, dipstick test is for the proteins, which is generally the urine. When you're putting the dipstick, you will see +1 to +3, that means mild. If it is more than +3, that means severe preeclampsia. That means severe preeclampsia. Done. ठीक है यार. उसके बाद है hypertension is more than proteinuria. It can lead to end organ damage, headache, diminished vision, and this important thing you cannot forget, and sir, that is your HELP syndrome. Hemolysis, elevated liver enzyme, and low platelet. Guys, remember there is one criteria for the diagnosis. Recent NEET PG exam question was this: TENSIS criteria for the diagnosis. TENSIS criteria for the diagnosis of HELP syndrome. You have to pay attention along with me right now. SGPT, SGOT more than 70. SGPT, SGOT more than 70, LDH more than 600, LDH more than 600, and platelet less than 1 lakh, platelet less than 1 lakh. Sir, SGPT, SGOT more than 70, LDH more than 600, platelet less than 1 lakh. It is your TENSIS criteria. Preeclampsia, remember, mild, if preeclampsia is there, you will go for the monitoring of BP till 37 weeks. Done. If it is not like that, severe is there, you have to start with the steroid and you have to give a drug of choice, that is your labetalol. So preeclampsia, drug of choice would be labetalol. Sir, HELP syndrome is there, then you have to terminate the pregnancy irrespective of gestational age. Immediate termination of pregnancy irrespective of gestational age. Sir, drug of choice for pregnancy induced hypertension would be labetalol. क्या है? Labetalol, बेटा labetalol. क्या ला बेटा लोल. ए भाई, ये कहां से आते हैं यार, ये ध्यान भटकाने के लिए कैसी अश्लील बातें लिख रहे हैं. ड्रग ऑफ चॉइस फॉर क्रॉनिक हाइपरटेंशन इन प्रेगनेंसी, सर, लाबेटालोल. अगेन लाबेटालोल. एक्लेम्शिया, सीवियर प्रीएक्लेम्शिया प्लस कन्वल्शन. गाइस, रिमेंबर, सीवियर प्रीएक्लेम्शिया प्लस कन्वल्शन. ड्रग ऑफ चॉइस मैग्नीशियम सल्फेट. मैनेजमेंट प्रोटोकॉल फॉर एक्लेम्शिया. First step is maintain the airway. Then MgSO4, then labetalol. MgSO4 is a drug of choice for eclampsia. Labetalol is a drug of choice for preeclampsia. And then you have to do termination of pregnancy irrespective of gestational age. Done. Now, sir, this is frank breach. This is complete breach. And this is footling breach. The foot is coming outside. Complete breach में completely शर्मा गया, ऐसे करके शर्मा गया. फुटलिंग मतलब फ्रैंक लोग हैं, पूरी की पूरी टांगे ऊपर उठा दी, पूरी की पूरी टांगे ऊपर उठा दी. दोस्तों यहाँ देखो, यहाँ पे extended legs in the frank breach is treated with the help of Pinard's maneuver. If frank breach टांगे दोनों ऊपर उठी थी, टांगे नीचे लेके आनी है with the help of Pinard's maneuver. With the help of Pinard's maneuver. उसके बाद क्या है दोस्तों, अपर लिम्स, एक्सटेंडेड आर्म्स लाइक दिस, एक्सटेंडेड. अरे भाई क्यों, मतलब 4 बार नॉट स्टक यार. someone is guys, just give me a moment here. I'm not able to read the chat. Love for upper Arms like the Shah Rukh Khan. I will pass, I will pass, I will pass. कौन सा मैन्यूवर है? लव सेट मैन्यूवर. कौन सा मैन्यूवर है? लव सेट. एक्सला को प्रेस करना है, बाजू नीचे आनी है. लव सेट मैन्यूवर, लव सेट मैन्यूवर. डंडना 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 डन. Now, after coming head is trapped. After coming head is trapped, this is known as Bern-Marshall method. This is known as Bern-Marshall method. And guys, remember Bern-Marshall method के अंदर what you have to remember, ठीक है? Guys, remember stargazer breach, it is cesarean section you have to do. And if after coming head is entrapped, sir, after coming head is entrapped, if it is preterm, then you have to give a Duchenne incision at 10 o'clock, 2 o'clock position. If it is a term baby, you have to give a Java-Nelly maneuver. क्या दोगे? Java-Nelly maneuver. Push the fetus inside and do the cesarean section. And do the cesarean section. Dun, 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 dun. So now if transverse breach is there like this, in this, at the 38 weeks onward, 37 weeks onward, you can do external cephalic version. External cephalic version. But remember, if at the time of labor, you have to manage it, you will immediately go for the cesarean section. You can immediately go for the cesarean section. Dun, 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 dun. Now, sir, we have to start a multifetal pregnancy, monozygotic and dizygotic. Monozygotic, remember, one sperm, one ova, one zygote divided into two makes two zygotes. Then, remember something, dizygotic, two sperm, two ova, two zygote. Now, monozygotic twin would be the identical twins with the same gender. Would be with the same gender. Dizygotic can be same gender or cannot be same gender. Now, sir, type of monozygotic twin, the mnemonic is Didi, Modi, Momo. Didi, Modi, Momo. Guys, remember, if division is occurring within first 3 days, the baby would be dichorionic diamniotic. Dichorionic diamniotic. If division is occurring day 4 to day 8, it will be Modi, monochorionic diamniotic. Now, if the division is between the day 9 and day 12, it is monochorionic monoamniotic. Monochorionic monoamniotic. If the division is occurring after day 12, there will be partial splitting and there will be conjoined twin. Mean जुड़े हुए बच्चे पैदा होंगे. दोस्तों, most common is thoracophagus. Thoracophagus is most common than paraphagus. Now, sir, lambda sign or twin peak sign is seen in. Lambda sign or twin peak sign is seen in dichorionic. It is seen in dichorionic. Then, T or inverted T sign is seen in monochorionic. It is seen in monochorionic. Sir, most common neonatal complication of twin pregnancy is prematurity. And most common complication of monochorionic diamniotic, MODI. Monochorionic diamniotic would be your twin transfusion syndrome. And sir, most common complication of it is cord entanglement. It is your cord entanglement. It is your cord entanglement. Monochorionic and monoamniotic, it is your cord entanglement. Then coming, sir, postpartum hemorrhage, PPH, excessive bleeding per vagina after the delivery. See what is happening here. Normal parameter you should know before diagnosis of postpartum hemorrhage. Guys, remember postpartum hemorrhage. After vaginal delivery, 500 ml blood loss is very much normal. After cesarean section, up to 1000 ml blood loss is very much normal. Twins के अंदर what is normal up to 1000. It is, if any of the parameter is exceeding this value, sir, this would be your postpartum hemorrhage. This will be your postpartum hemorrhage. Now, remember, primary PPH is within the 24 hours and most common cause is uterine atony. And the most common cause is uterine atony. And secondary PPH after 24 hours and before 12 weeks of delivery. Now, sir, most common cause of secondary PPH would be retained placenta. PPH is something management you have to pay attention on, guys, because this is very, very highly mandatory. So guys, remember, management of PPH, injection of tranexamic acid 1 gram, simultaneously start the resuscitation. Number 1, injection tranexamic acid 1 gram plus simultaneously start the resuscitation. Drug of choice would be oxytocin, that is 40 international unit. Oxytocin, if no response is coming, oxytocin plus massage. If still no response is coming, the best drug you can use is your carbaprost. If still no response is coming, bimanual uterine compression followed by external aorta compression followed by military anti-shock garment, sir. If no response is coming, sir, Bakri balloon catheter or condom catheter, you will put. Still no response is coming, sir, multipara and primipara. Multipara, you just go straight for total abdominal hysterectomy. If it is primipara, you have to make some effort, sir. You have to do a compression with the help of B Lynch suture. Uterine artery ligation, ovarian artery ligation, and still bleeding is not stopped. Then in the last, you will go for hysterectomy. And sir, once the uterus is out, you have to put something inside, that is umbrella pack or parachute pack. Done, done. Sir, management of shoulder dystocia is something important. Clinical suspicion is by the turtle sign. Once you put a suprapubic pressure, you will see a head is coming out. The head is coming out. Now remember, first best management should be Mack-Roberts maneuver. Mack-Roberts maneuver. There is a sudden flexion and abduction of the lower limb. This is Roberts maneuver. And guys, remember, if Roberts maneuver fails, then you will go for the Wood corkscrew method. Roberts maneuver, Wood's corkscrew maneuver, and if it still fails, sir, you will go for Java Nelly. Java Nelly mein what you are doing, you are putting it back again and you are doing the cesarean section. For example, head is entrapped, you again push this head inside and then you will go for the cesarean section. Done. So now something you have to remember is this. Molar pregnancy. You have to remember what, sir? Molar pregnancy. What you have to remember? The molar pregnancy, there is an abnormal proliferation and degeneration of the chorionic tissue. Number one is your complete mole or hydatiform mole or vesicular mole. The empty ova is fertilized by sperm. That is 46XX. That is your 46XS, and there is a grape-like vesicles. क्या देखने में मिलता है? Grape-like vesicles. And remember, HCG is more than 10⁵, and there is a snowstorm appearance. Guys, remember, partial mole, 1 ova plus 2 sperms are fertilized. And zygote form is 69XXY. Remember, partial mole diagnosis, HCG less than 10⁵. Investigation of choice is USG, and follow-up beta HCG is for the fall, and gold standard is histopath examination. Sir, if it is multipara, you will go for the hysterectomy. If primary, you will do the suction and evacuation. Choriocarcinoma, just remember, it metastasizes to the lung, and in lung you will see a cannonball appearance. Sir, hydrops fetalis. Guys, remember, swollen yellow fetus, there will be pleural effusion, pericardial effusion, ascites, scalp edema. Any of the 2 or more than 2 features present out of these 4, this is known as hydrops fetalis. An earlier sign of hydrops fetalis on USG, you will see a Buddha sign. You will see what sign, sir? Buddha sign. Now, diagnosis, indirect Coombs test. Estimate antibodies. You all know direct and indirect. Indirect is for the maternal antigen, and a direct Coombs test is for the fetal antigen. Now, sir, Purpurium is something, a time period after delivery, that is 6 weeks, that normal, all the organs, they will become what? Normal. All the organs will become, sir, what? Normal. Now, remember about something that is known as 1 to 4 days, sir, red color discharge will come. This is lochia. Lochia is a postpartum discharge up to 2 weeks. 1 to 4 days, RBCs are coming. What is coming, sir? RBCs are coming, and it is lochia rubra. 5 to 9 days, WBC is coming. It is yellow color. That is lochia cirrhosa. 10 to 15 days, decidua is coming outside. That is of white color. That is known as lochia alba. Obs-gynae is clear. Done. Now, to watch the lectures of cancer, please follow my YouTube channel. That is Paras. You can easily search it on YouTube and you will come to know about all the cancers, sir. Allow me to start a next subject, and that subject is ophthalmology. Next subject what we're going to start now is, sir, that is your ophthalmology. Quickly we are going to the ophthalmology. Dun 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 dun. Orbit volume is orbit is 30, eye wall is 6 ml only, and most common fracture wall is an inferior wall. This you don't have to remember, just remember blow off fracture endophthalmitis EID. क्या है? EID. Mnemonic is EID. Blow off fracture mnemonic is EID, endophthalmitis, diplopia and infraorbital anesthesia. Sir, this is pachymetry to know the thickness of the cornea, and standard thickness of the cornea would be your 540 micrometers. Keratometry is to know the curvature of the cornea, to for the curvature of the cornea. Sir, refractive index air का कितना है? Air का 1. Refractive index of air is 1. Lens it is 1.38 to 1.40. Out of this, if someone asks you which is the highest refractive index of lens, it is present in the center and it is 1.40. It is 1.40. Dun 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 dun. Then remember, sir. Then thinnest part of sclera is under the insertion of rectus muscle. Ciliary body is very important. You have to pay attention. Ciliary body is having two parts: pars plicata and pars plana. Sir, pars plicata and pars plana. Guys, remember pars plicata, it produces aqueous humor and also provide accommodation. Also provides, sir, what? Accommodation. Choroid, chusila, rasila. क्या बोला? होठ रसीले तेरे होठ रसीले, जी चाहता है मेरा ये रस पीले, होठ रसीले तेरे होठ रसीले. तो choroid is most vascular part. Choroid is most vascular part, and sir, vortex vein drains the entire choroid. Vortex vein entire choroid. Then retina, टीना की जवानी, ला 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 ला. Macula phobia optic disc. टीना के पास क्या? Macula phobia optic disc. Most sensitive to light is phobia, and the first cell to receive the light is rods and cones. Sir, vitreous humor. Out of 6 ml volume in the eyeball, remember 4 ml is vitreous humor. That is why vitreous humor is the largest structure in the eye. Vitreous humor is largest structure in the eye, sir. And sir, what you have to remember here, lens divide the anterior and posterior segment, pupil divide the anterior and posterior chamber. Aqueous humor produced by pars plicata of the ciliary body. Production rate is 2.5, outflow is 0.2. Early morning everything is up, and your aqueous intraocular pressure is also up. Early morning everything is up. सारी चीजें क्या हो जाती है? बढ़ जाती है. अर्ली मॉर्निंग सुबह तो और उठने से पहले बढ़ जाती हैं. तो यहाँ पे एक्वस ह्यूमर की प्रोडक्शन भी सुबह बढ़ जाती है. डन डन डन. नाउ सर, कमिंग टू द नेक्स्ट इंपॉर्टेंट थिंग, व्हाट इज द एक्सियल लेंथ? नॉर्मल एक्सियल लेंथ वी आर हैविंग, सर. द नॉर्मल एक्सियल लेंथ वी आर हैविंग 24 millimeter. It is your 24 millimeter. 24 millimeter. Now at birth it is 16 mm. That means hypermetropic. The बच्चे पैदा होते हैं वो hypermetropic होते हैं. That means they cannot see the near object, they can see the far object. Vision physiology, normal is 6/6, max possible 6/3. Sir, this chart is known as Snellen's chart. Is the most common chart used for the vision. This is a landlord chart. This is landlord chart. This is Allen's chart. Less than 3 years. Now optokinetic drum less than 2, and then coming to the best, that is logMAR chart. Normal intraocular pressure is 10 to 21 mmHg. If more than 21 mmHg, it will lead to what? Your glaucoma. And in intraocular pressure is measured by tonometer and tonometer. Which is the best tonometer, sir? Goldman tonometer. तो क्या बोला? ए दुनिया पित्तल दी, ओ मैं बेबी बॉय सोने दा, ओ बेबी बॉय. मैन कैसा अच्छा? सोने का. मैन कैसा अच्छा है? सोने का. तो याद रखना, गोल्ड मैन टोनोमीटर. इट इज फॉर द इंट्राओकुलर. ठीक है, चलो उसके बाद बात करेंगे इसकी. ये हम्फ्रीज पैरामीटर. दिस इज हम्फ्रीज पैरामीटर टू नो द विजुअल फील्ड. कलर ब्लाइंडनेस के लिए मोस्ट कॉमन इट इज इशिहारा टेस्ट. देन FM100 हुई. द बेस्ट इज नेगल्स एनामेलोस्कोप. सर, दिस इज द टिटमस फ्लाइट टेस्ट टू चेक द स्टीरियोप्सिस. Then coming the cataract. Remember cataract, this is a snow sorry, this is a sunflower cataract where it is seen in the Wilson's disease, where Kasher-Fleischer ring you will see. Now coming oil drought cataract, it is seen in galactosemia. The enzyme deficiency in galactosemia would be the galput, would be your galput. उसके बाद क्या है तुम्हारा Christmas tree, dystrophica myotonica. Then guys, remember something that is known as examination. Slit lamp examination is done for the cataract. Slit lamp examination is done for the cataract. And treatment, better glasses in the young patient and surgery in the old patient. And 3 type surgeries are there: intracapsular cataract extraction, extracapsular cataract extraction, phacoemulsification. Which is the best? Phacoemulsification is best because a vision gain back is 6/6 and the stitch is incision is less than 3 mm, and indication is soft cataract. Now sir, post-op complication, secondary cataract, Elshing pulse and sommering, and treatment is anti-echolage. To calculate the intraocular power, who is powerful? I will pass. Shahrukh Khan. SRK formula. क्या है? SRK formula. To calculate refractive error, it is retinoscope. Axial length is measured by A scan, and I can ask you what is the axial length we are having, sir? 24 millimeter. Uveitis having 3 structure: iris, ciliary body, and choroid. Interior uveitis, intermediate uveitis, and posterior uveitis. Sir, remember, most common cause of interior and intermediate uveitis is idiopathic. Second most common cause of interior uveitis would be HLA-B27, and second most common cause of your intermediate uveitis would be sarcoidosis. Now sir, ocular HIV, commonest manifestation would be your cotton wool spot or soft exudate. The commonest infection would be CMV retinitis. Sir, couple क्या करते हैं? couple क्या करते हैं? पिज्जा ऑर्डर करते हैं, ठीक है? couple सबसे पहले क्या ऑर्डर करते हैं? couple used to order the pizza, they used to put the cheese, they used to put the tomato ketchup, and couple पिज्जा खाने के बाद झाड़ के पीछे जाते आग लगा देते हैं, गपा ब्रुश फायर. क्या है? brush fire. So commonest infection CMV retinitis, couple cheese and tomato ketchup pizza pie, brush fire. Commonest tumor is a Kaposi sarcoma. It is a Kaposi sarcoma. And ये देखो couple ने क्या खाया? पिज्जा खाया, चीज डाली, झाड़ के पीछे आग लगा दी. This is known as what? Your CMV retinitis. And sir, treatment is high antiretroviral therapy. टीना की कितनी लेयर है? टीना की जवानी ला. टीना की 10 लेयर. टीना की कितनी? 10 लेयर. 9 neurosensory layer, and 10th layer is retinal pigment. Retinal detachment के अंदर what is happening? 9 neurosensory layer are separated from the 10th layer, that is retinal pigment. Now sir, remember which glow you will see? Gray glow. And patient will be telling you, डॉक्टर साहब आंखों के सामने क्या है? एकदम से पर्दा गिर गया. अगर someone is saying this key punch word, cotton like sensation in front of eye, sudden painless loss of vision, sir, your direct answer is retinal detachment. Your direct answer is retinal detachment. Dun. Most common cause of tractional retinal detachment would be diabetic retinopathy. Most common cause of tractional retinal detachment would be diabetic retinopathy. Treatment is buckling. Diabetic retinopathy is 2 type. Type 1 में you have to examine after 5 years, and type 2 में immediately you have to examine. Earliest manifestation of diabetic retinopathy is microaneurysm, and earliest hallmark would be your neovascular. Sir, if there is a neovascularization, you have to do a pan photocoagulation. What you have to do? Pan photocoagulation. Done. Then vitreous hemorrhage, sir, sudden painless loss of vision. Guys, remember, vitreous hemorrhage is something very important, and overall most common cause is your diabetic retinopathy, but in the young adult the cause is trauma. Treatment is rest for 3 months, and also you have to do vitrectomy. Vitrectomy. Sir, CRVO, just remember, tomato splash appearance is seen in CRVO, and also neovascular glaucoma or 100-day glaucoma is seen in CRVO. 100-day glaucoma or neovascular glaucoma is seen in CRVO. Tomato splash appearance is also seen in CRVO. Sir, CRAO, cherry red spot is seen. Cattle track or boxcar appearance is seen. Marcus gun pupil is seen, and this is irreversible after 4 years. CRAO is irreversible after the 4 hours. Before that, if you can treat with the help of ocular massage. Immediately you have to lower the intraocular pressure by using the mannitol, IV mannitol, and also you can give it IV heparin. IV heparin. Sir, this is cherry red spot. This is a Marcus Garpus, or it is boxcar appearance, cattle track or boxcar appearance, CRAO. Then cystoid macular edema, you will see honeycomb crusting. You will see what? Honeycomb crusting. Done. Retinopathy of prematurity is mainly happening because of over oxygenation to a just born child. You will never give 100% oxygenation in a just born child. That is that हाँ एक नंबर का पक्का क्वेश्चन है भाई, सच्ची बात है. CRAO या CRBO में से. Retinitis pigmentosa के अंदर there is a night blindness, and guys remember it is autosomal recessive dominant X-linked, which is the most worst prognosis X-linked. And remember retinitis pigmentosa, what is happening? There is a night blindness, and it is a not a curable disease, but we can delay this disease with the help of vitamin A. How much dose is required? It is 15,000 international unit, and usually person become blind by 40. Now it is delayed to 47 year. Sir, hypertensive period, इसमें याद रखना hypertensive retinopathy. सलमान खान, किसको याद करोगे? सलमान खान. Gun sign, bonnet sign, and Sallu sign. Gun sign, bonnet sign, and Sallu sign. This is retinoblastoma. Most common ocular tumor of the childhood and genetics RB1. किस पे present? 13q14. RB1 gene is present in which chromosome? 13q14, 13q14. And remember leukocoria, cat eye pupil is a retinoblastoma. Now you will see a blast happen in the eye. This is a typical photo of the retinoblastoma, sir. And remember the primary management is save the life, save the eye, and save the vision. Enucleation is a better answer than chemoradiation. Why enucleation is better answer than chemoradiation? Because most common cause of death in the retinoblastoma would be metastasis to the brain. Metastasis to the brain. Next, sir, glaucoma. Before glaucoma, let's have a tea. Ladies and gentlemen, boys and girls, best friends and friends, please remember, glaucoma is something condition you all know, more than 21 mmHg. Second most common cause of blindness. First most common cause of blindness is cataract. It is cataract. It is cataract only. Second most common cause of blindness would be glaucoma. Guys, remember, gonioscope is check the angle of eye. To check the angle of eye, it is gonioscope. Adult glaucoma, remember, angle closer and open angle glaucoma. Two type of glaucoma is there, sir. Close and open angle glaucoma are the two type of glaucoma present over here. My dear friends, over here along with me in such a tight schedule, मैं तुम्हें अभी angle closer और open angle को ऐसा रटवाऊंगा, चाट के याद दिला दूंगा. Angle closer most common it is present in the female. Angle close किसका रहता है? Female का. Female never disclose their angles. एंगल क्लोजेस ऑफ फीमेल, एंड फीमेल की आंखें छोटी छोटी, फीमेल का सब छोटा छोटा, आंखें भी छोटी छोटी, हाइपरमेट्रोपिक आई. एंड फीमेल्स लव कलर्स. फीमेल लव कलर्स, सर. इट इज योर पिपुलरी color halos are seen, and those people who are irritating female, who are following the female, and they are continuously disturbing the female, what female do? Female block that pupil. Female block those people. Guys, remember, this is a typical feature of angle closer glaucoma. This is a typical feature of angle closer glaucoma. To block those people who will bother you. Females, yes. And I am never blocked by any female. Why? Because I never irritate anyone. I'm just a gentleman in the queue of more gentlemen. I'm the one gentleman who is treating you right now. Open angle glaucoma. Open angle mean everything is open, no gender predisposition, but it is mainly happening in the male more than female. Only happening in the male more than female. No, male. इसको मेल के हिसाब से पढ़ेंगे. मेल का सब बड़ा बड़ा, तो आंखें भी बड़ी बड़ी. मायोपिक क्या है? मायोपिक. और स्लो पेनलेस लॉस ऑफ विजन. एंड ऑल्सो सर हियर इज ट्रेबिकुलर फाइब्रोसिस, एंड हियर इज कलर रेसिस. सर ओपन, खुलने में क्या होती है? रेस होती है. ओपन एंगल में रेसिस होती है. रिमेंबर सर, ओपन एंगल ग्लूकोमा ड्रग ऑफ चॉइस इज लैटिनोप्रोस. Drug of choice is latanoprose. Angle closer glaucoma, the drug of choice would be your acetazolamide. Guys, Fincham test क्यों करते हैं? Fincham test is to check the color halos. If color halos is present, it is angle closer. If it is not present, it is open angle glaucoma. Done. Now sir, secondary glaucoma, leave. Neurophthalmic में just you have to remember optic neuritis and retrobulbar neuritis. Sir, remember optic neuritis, retrobulbar neuritis. Most common cause of optic neuritis, multiple sclerosis. and sudden painless loss of vision, and hallmark is disc edema. Hallmark is disc edema. ठीक है, disc edema. And guys, remember retrobulbar neuritis. Doctor and patient see nothing, means your patient will become blind, and doctor want to see something in the eye, and doctor will also see nothing. That means patient and doctor see nothing. That is retrobulbar neuritis. And remember, our treatment of optic neuritis and retrobulbar neuritis, so treatment is IV methylprednisolone. The treatment is IV methylprednisolone. Done. Toxic amblyopia, slow painless loss of vision, tobacco, alcohol, ethambutol भैया, ethambutol भैया, ethambutol से toxic amblyopia, and the treatment is withdraw the drug and give the vitamin B12. Argyle Roberts pupil, also known as your favorite prostitute people. Sir, what is happening in a prostitute people? There is a constricted eye like this, and accommodation power is pleasant. Because prostitute can accommodate anything onto her. She is having such a big heart that anyone can accommodate in that heart. And same way her eyes are working, and her eyes are like what? Accommodation power is present. There is a bilateral constricted pupil, and which is non-reactive. You go, you come, doesn't matter. That pupil is non-reactive. Done. Now guys, remember what? AD tonic is just opposite to the Argyle Robertson. In AD tonic, there is a bilateral dilated pupil, which is non-reactive, and accommodation power is also gone. Done. Sir, papilloedema, body khatarnak bimari, papilloedema. Increase in ICD plus disc edema. थंडर का ऐसा लगा चांटा मारे किसी ने, चांटा लगा आई लगा आजा राजा बंगले के पीछे तेरी बारी के नीचे ला. तो papilloedema, increase in ICT plus disc edema is thunderclap headache, worst headache of life. It is also seen in subarachnoid hemorrhage. It is also seen in papilloedema. What is happening here, sir? There is a sixth nerve palsy, and sixth nerve is the abducen nerve which control intracranial tension. Which controls, sir, what? Intracranial tension. There is a headache, there is a projectile vomiting, there is a disc edema, and you will see what? Bitemporal hemianopia. Just one question you have to remember: bitemporal hemianopia seen when there is a lesion on optic chiasma. Done. Conjunctiva में कौन सी लेयर होती है? Mucin layer, and it's formed by goblet cell. Sir, dry eyes or conjunctivitis, keratoconjunctivitis sicca. How you have to remember? Dry eyes or keratoconjunctivitis sicca, aqueous layer deficiency and a mucin layer deficiency. Aqueous layer deficiency and mucin layer deficiency. Sir, how you have to remember? Aqueous layer is secreted by lacrimal gland, and mucin layer is secreted by goblet cell. And remember, any old age people in your age, they will be complaining, beta मेरी आंखों में ऐसा लगता है कुछ चला गया. There is something in my eye, and there is a redness of eye. And whenever checking you on to that people, you will see nothing in the eye, and they are intolerant to fan and AC, and symptom worsen in the evening. You took them to a doctor, and you see rose Bengal stain positive. Rose Bengal stain is positive, and then Schimmer's line is less than 10 mm in 5 minutes. That is a confirmed diagnosis of dry eyes. Sir, in the treatment, you will give the lubricant. If someone is dry, you will use what? Lubricant, artificial tear and tear supplement, that is methyl cellulose. Xerophthalmia, night blindness. Z क्या? Night blindness. फिर X1A conjunctival xerosis, X1B bitoid spot, X2 corneal xerosis, X3A corneal ulceration keratomalgia involving less than 1/3. X3A is less than 1/3, X3B is more than 1/3 involvement, and XS is corneal scar, XS is xerophthalmic fundus. Sir, treatment of xerophthalmia less than 1 year, it is 1 lakh international unit, more than 1 year, 2 lakh international unit. Done. Then coming to, sir, important disease, that is your trachoma. Sir, trachoma, the hallmark are sago grain follicle. ये देखो साबूदाने जैसे, ये साबूदाने जैसे जो हाल है, ठीक है, साबूदाने, ठीक है, साबूदाना, sago grain follicle, Herbert Pin, arts line. And यहाँ पे एक strategy follow होती है, which is exam question safe strategy. Sir, trachoma is a most common infectious cause of blindness in the world, and if you remember safe strategy, number 1 is surgery, number 2 is antibiotic, and drug of choice for trachoma would be azithromycin, and facial hygiene, environmental improvement. Done. Blanket therapy में you will use 1% tetracycline, and also remember WHO grading, the name is is fisto. Follicles more than 5, intense infection, scar, tracheasis and opacities. Now spring cataract or vernal keratoconjunctivitis. Sir, important feature is what? Cobblestone papillae, ropey discharge, there is a shield ulcer, there is a Maxwell-Lyon sign. This is cobblestone papillae. This is cobblestone papillae. It is seen in spring cataract or vernal keratoconjunctivitis. Now, sir, important thing you have to remember over here. It is a acanthamoeba is a most painful ulcer. Acanthamoeba ulcer is a most painful ulcer, and the most common cause is contact lens. And which bacteria is infecting right now? It is a Pseudomonas, and the ring ulcers are seen. Now, sir, fungal keratitis. If I ask you, most common it is aspergillus. Signs are more than symptom. So finger-like projection, feather. These are the key punch word to solve the question of fungal keratitis. Finger-like projection, feathery margin, styloid margin, hypopyon is seen, and the treatment is natamycin, voriconazole. Natamycin and voriconazole is a treatment for the fungal keratitis. Sir, viral keratitis, most common cause is HSV. Most common cause is HSV, dendritic or geographical ulcer. Dendritic or geographical ulcer is present over there, sir. Loss of corneal sensation, it is HSV1. HSV1, why HSV1? Above the waist, HSV1 is causing the problem. Below the waist, it is HSV2. Treatment is acyclovir, valacyclovir. Now, sir, refractive surgery की बात करेंगे. If in myopia, when the eyeball is big, we are doing what? We make the cornea flat. If we increase the curvature, there will be more bending of the light, and it helps us to treat the hypermetropia. It helps to treat the hypermetropia. And remember, LASIK is something you all know who are wearing the glasses. They know about the LASIK surgery. LASIK is to treat the refractive errors. Remember, guys, it works till 10 diopter, and the laser used in the LASIK would be excimer. Fmge exam question. Now, sir, keratoconus, you will see Munson sign, Vogott stray, Hap stray, flasher ring. Munson sign, Vogott stray, Hap stray, flasher ring. Now, sir, refraction. Myopia means your eye is big. You have to converge the rays. Now, to converge the rays, we use a concave lens. Concave lens. And hypermetropia, you have to diverge. You have to, sorry, myopia, you have to diverge the rays. For diverging the rays, you will see you will use a concave lens. It is a diverging lens, and if you will not wear a diverging lens, it will lead to divergent squint. Sir, hypermetropia is a far-sightedness. Hypermetropia is a far-sightedness. Can see the near object. It can't see the near object. Okay? Hypermetropia can't see near object. It can see far objects. And remember, you will use a convex lens. You will use a convex lens over here. Astigmatism means two different foci after and before the retina. After and before the retina, and treatment is toric or cylinder lens. So treatment is toric or cylinder lens. Done. So dark room, then presbyopia. Old age के अंदर होता है presbyopia, accommodation power is lost. So lens become harder, and treatment is bifocal lens. You all know this type of lens is coming for the near vision, and for the far vision you are using bifocal lens. So now dark room procedure is the second last topic for the ophthalmology. Remember, retinoscopy, distance for retinoscopy is 1 meter, and there is a pinhole test to confirm the refractive error. Pinhole diameter in the retinoscope is 1 millimeter. And guys, remember, myopia, hypermetropia, astigmatism, these all are the refractive errors. Okay? And to correct the refractive error, we use a LASIK surgery. And in LASIK surgery, which laser we will use, sir? It is your excimer laser. It is your excimer laser. Now, direct ophthalmoscope. Direct ophthalmoscope is of two types: distant direct ophthalmoscope and direct ophthalmoscope. Distant direct, guys, remember something distance is 25 centimeter. Healthy red glow is seen in normal eye. If your normal eye is there, you will see a healthy red glow. Gray glow is seen in retinal detachment, where your 9th layer is detached from the 9th neurosensory layer is detached from the 10th neurosensory. और आपको सामने क्या गिर गया था? पर्दा गिर गया था. Yellow glow is seen in endophthalmitis. No glow is seen in vitreous hemorrhage. No glow is seen in vitreous hemorrhage. Black color glow is seen in all the opacities and cataract. So direct ophthalmoscope, remember, distance is not fixed. Now everything is direct. Now everything is direct. Done. Now distance is not fixed. Fovea macula optics. Fovea macula optic. Qualities of the image would be virtual erect. If everything is direct, अगर तुम डायरेक्टली किसी चीज को छू लेते हो तो चीजें इरेक्ट हो जाती है. Virtual erect magnified. 15x. Now sir, Indirect ophthalmoscope, guys, remember quality of the image, real inverted magnified, and magnification power is 5x, and you can see up to pars plana, done, 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 done. Episcleritis and scleritis, remember epic color is red color. तो कैसे याद करना है हिंदी के अंदर, जल्दी से, ठीक है, जल्दी से। क्या है सबसे पहले, ना दर्द है ना सूजन है ना किसी से लेना देना, ना दर्द है ना सूजन है ना किसी से लेना देना, पेन इज एब्सेंट, नो scleroderma and no association with the systemic disease. In such patient you will give a reassurance and topical NSAID. Now scleritis, सूज गया, क्या हो गया, सूज गया, वॉयलेट ब्लूइश कलर का भी हो गया, दर्द भी है सूजन भी है, क्यों है, क्योंकि हर किसी से लेना देना। Pain is present, scleroderma is present, association with the systemic disease. In such cases, sir, oral NSAID and steroid. Oral NSAIDs and steroid. Dandana, 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 done. Ophthalmology is over. Now, if you allow me, sir. If you allow me, sir, now I can start the next chapter. I can start the next chapter, and the name of next chapter would be your वाह 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 वाह, मजे आ गए भाई, मजे आ गए। 6 बजे अभी और कर लेंगे, डोंट वरी। Guys, ENT, let's start with the ENT. Guys, remember now pinna developed from first and second arch, hillock of 6 in number, that is from the external ear. Absence of anti-helix will lead to bat ear, it will lead to bat ear, and surgical correction you have to do after the 6th year. वो गांधी वाले कान आ जाते हैं ना, surgical correction you have to do after the 6th year. Guys, remember tympanic membrane developed from ectoderm, endoderm and, ठीक है, ectoderm, endoderm and ectoderm, endoderm and mesoderm, ectoderm, endoderm and mesoderm. You want break, you want break, do you want break for 10 minutes? Okay, we can give 6:15 p.m. we will start, 6:15 p.m. we will start, ठीक है, okay, do ले लो भाई, ले लो, कोई दिक्कत। Okay, done. चलो जी, let's start. Let's start. Let's start. ENT 3, 2, 1, go. Peanut develops from first and second arch. He loves of his are 6 in numbers and absent of Halley and anti-Alex would lead to bad ear. A surgical correction you have to deal after the 6 years. Sir, tympanic membrane develop from all three: ecto, endo, mesoderm. Ecto, endo, mesoderm. Ossicles are MIS. Malleus, incus, stapes. Malleus, incus, and stapes. First arch, it is malleus and incus, stapes. As for stapes, as for second arch, as for stapes, as for second arch. Dandana, 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 done. Then coming to sir. Coming to middle ear transformation ratio, it is 1, doesn't matter. Pinna hematoma, most common causes trauma, sir. Treatment is aspiration, otherwise boxer's ear or cauliflower ear. Boxer's ear or cauliflower ear. Guys, remember, pinna hematoma causes trauma. Treatment is aspiration, otherwise boxer's ear or cauliflower ear. Length of external auditory canal would be 24 millimeter. Out of that, you remember, external 1/3 would be a cartilaginous part, inner 2/3 will be a bony part, Then disease of external auditory canal. Number 1, diffuse otitis media. Infection of complete scan of external auditory canal. It is goby everywhere. Yes, goby is everywhere. Goby is very famous food of like Fmge exam and medical sciences. Localized otitis externa, it is an infection of hair follicle. Now sir, malignant otitis externa, where you have to pay attention. Malignant otitis externa, remember, ear pain, granulation, and there is a facial nerve is involved, and drug of choice would be third generation cephalosporin. Now sir, wet newspaper appearance is seen in otomycosis. Tympanic membrane, the color is pearly gray, somewhere it is written white also. So let's talk about that in a pearly gray white. That is pearly gray white. Angle is 55. अरे इसको कोई लुब्रिकेंट दो रे, बीच में आ गया, कहां से बार बार आ जाता है ये. Most reliable landmark is ambo. Pars tensa is something which is low, flaccida is something which is high, and which is high, guys, remember, which is high, there is a sharp nails membrane. That is sharpness membrane. Dandaga, dandana, dandana, done. Chalo, let's talk about something. Okay, let's talk about something. Eustachian tube length is 36 mm, and remember, muscle for opening of Eustachian tube, tensor veli, palatine muscle. Now some middle ear cleft is not about the acute suppurative otitis, ASOM. Which sign you will see, sir? Cartwheel sign is seen. CF type of chronic suppurative otitis media. Ear discharge is not foul smelling, not blood stain, not foul smelling, and not foul smelling and not blood stain, and there is a conductive hearing loss. Sir, most common bone to go under necrosis would be your incus. Sir, treatment is myringoplasty, type 3 tympanoplasty, and ossicular replacement prostate. It is a safe type of chronic suppurative otitis media. Acute mastitis, you have to remember 2 signs, that is reservoir sign and lighthouse sign. A pus fill immediately on clearing, this is known as reservoir sign, and a pus continuously moving, this is known as lighthouse sign. It is known as lighthouse sign. Dandana, dandana, done. So 2 views are there, Schuller's view and Townie's view, and treatment is Short's operation. And 2 surgical landmarks for the antrum, which is very important. It is McEwen's triangle and suprameatal triangle. McEwen triangle and suprameatal triangle. McEwen's and suprameatal triangle. McEwen's and suprameatal triangle. McEwen triangle is suprameatal triangle. Dandana, 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 done, sir. So next, coming to the next part, petrositis is also known as Grady-Negro syndrome. Answer, mnemonic is GERD. Ear discharge, retroorbital pain, and diplopia. And the management is surgical manner. Unsafe CSO, it is not cholecystitis. Now the discharge is scanty, foul smelling, and blood stains. Scanty, foul smelling and blood stain. Second T, foul smelling and blood stain. It is blood stain. Done, done, sir. Okay, chal. Let's talk about something known as the X-ray mastoid. You all know Schuller's and Townes, and treatment is modified radical mastoidectomy. Now, sir, sigmoid sinus or lateral sinus thrombosis. Remember, headache, spiky fever, and pitting edema on the mastoid, and there is a Grisinger sign. Which sign is seen, sir? Over here, the Grisinger sign. And on sigmoid sinus or lateral sinus thrombosis, which sign you will see? CT brain. You will see, sir, delta sign. You will see what delta sign? Glue, ear, serous otitis media. School age children, adenoid hypertrophy, there is a blockage of inner ear, endolymph, potassium is more and sodium is less, and perilymph, there is a less potassium, more sodium. Sir, this endolymph is secreted by stria vascularis. It is secreted by stria vascularis. Now, perilymph is connected to CSF with the help of aqueduct of cochlea. With the help of aqueduct of cochlea. Sir, coming to the BPPV, this is very important. Please pay attention to it. Benign proximal positional vertigo. Benign proximal positional vertigo. Clinical condition, vertigo on changing the head position. On changing the head position, there is a vertigo. Guys, remember, diagnosis, we are having something known as Dix-Hallpike maneuver. Diagnosis, D for diagnosis, D for Dix-Hallpike maneuver, and treatment is Apley's maneuver. Treatment is Apley's maneuver. The treatment is Apley's maneuver. Function of semicircular canal would be angular balance. Function of semicircular canal would be angular balance. Sensory end organ is crista. It is covered by gelatinous layer known as cupula. It is covered by gelatinous layer known as cupula. Crista is covered by cupula. So, Billy's bar is present in the bony septum of the upper part of internal auditory canal. Now, sir, Bira is having 7 waves. Most important wave is 5th wave, and for the well babies we are doing AOAE, autoacoustic emission, and for the sick babies we are doing the Bira. Sick baby हो तो क्या करना? Bira पिला देनी. क्या पिला देनी दोस्तों? Bira पिला देनी है. Most common used tonic for. If someone asks you which is the most commonly used tonic for, sir, your answer is 512 hertz. Your answer is 512 hertz. Your answer is 512 hertz. Done. Now, sir, Rene test and Weber test is something which is very important. You have to pay attention. Rene test कहता है AC is more than BC. AC is more normally what is happening? AC is more than BC. This is very normal. Sir, Rene negative mean BC is more than AC. Now, it is suggesting you have conductive hearing loss. If AC is more than BC, then it is pseudo positive test for the sensorineural hearing loss. It may be there, it cannot be there. Okay, Weber test heard in the center of forehead. Weber test is heard in the center of forehead, and conductive hearing loss, remember, here in the poor ear, and sensorineural hearing loss heard in the better ear. Poor ear में सुनाई दे conductive hearing loss, better ear में सुनाई sensorineural hearing loss. Sir, if AC-BC is less than 25, it is very normal. If AC-BC gap is more, it is conductive hearing loss. If AC-BC both, it is above 25, it is sensorineural hearing loss. Sir, coming to the tympanometry, type A curve is normal, B is bhara hua, glue ear, flat curve is coming, C for eustachian tube dysfunction, AS for otosclerosis, AD is for ossicular dislocation. So now coming to the hearing loss in the otosclerosis, it causes conductive hearing loss, and sir, on bone conduction on 2000 hertz there is a dip, and this dip is known as Carhart's notch. It is known as Carhart's notch. And remember, otosclerosis most commonly seen in the female love to travel in the auto. That is why maximum comes with it. It is a younger female, and pregnancy always aggravates it. Pregnancy always aggravates. At patient hears better in noisy area. This is known as paracosis Wilside. This is known as paracosis. Here, sir, short sign is positive, and short sign plays a very important role in the otosclerosis, and there is a flamingo pink appearance behind the tympanic membrane. This is your short sign. Treatment of choice would be stapidotomy. And sir, if your short sign is positive, you have to change your treatment, and now the new treatment is sodium fluoride. Short sign is positive in the otosclerosis, your new treatment is sodium fluoride. If short sign is not mentioned, then your treatment is stapidotomy. Now, sir, remembering the Van der Hoef syndrome, there is osteogenesis imperfecta, otosclerosis, and blue sclera. Acoustic neuroma or vestibular schwannoma, it is a tumor of 8th nerve. Now glomus jugulare location is jugular bulb. It is a highly vascular tumor and biopsy is contraindication. And glomus glow hota hai subah subah sun. तो याद रखना rising sun sign and brown sign. Rising sun sign and brown sign. And CT scan में you will see a FALP signs. FALP का bulb भी जगता है jugular film. Meniere's disease is also known as endolymphatic hydrop. Sir, remember there is a two marking crisis. Patient fall down without turning unconsciousness. If a patient hears loud sound more or it is known as recruitment phenomena. If patient get vertigo on hearing the loud sound, this is known as Thulios phenomena. Sir, diplacosis, a patient hears same sound at two frequencies. Diplacosis is patient hears same sound at two frequencies, sir. And the investigation electrocochleogram. Now, sir, medical management is failing. You will go for the surgical management. And sir, surgical management, there is a landmark for the endolymphatic sac decompression surgery, that is Dolanson sign. And remember, if this is not working, you will go for the transtympanic injection of the gentamicin. Sir, devising की बात करेंगे, hearing aid or the sound amplifier, it only works when there is a less than 90 decibel hearing loss. If sir more than 90 decibel hearing loss, you will go for the cochlear implant, and also the prerequisite for the cochlear implant would be the normal 8th nerve. If your 8th nerve is not normal and there is a more than 90 decibel hearing loss, this is a profound hearing loss, you will go for something known as auditory brainstem implant. You will go for, sir, auditory brainstem implant. Sir, coming to the Cotley's test, it is done to check the blockage of the nasal bag. Saddle nose is because of the trauma, and treatment is a augmentation rhinoplasty by using the iliac crest graft. Then coming, sir, basal external malignancy is basal cell carcinoma, rodent ulcer. This is basal cell carcinoma, rodent ulcer. Potato nose is rhinophyma. This is potato nose, this is rhinophyma. Sir, next coming the rhinolith means stone inside the nose, and for this you will do endoscopic removal. Nasal phimosis mean nasal biasis mean cryosomia, presence of maggots in the nose, and maggot oil is a treatment of nasal myiasis, that is chloroform and turpentine oil. So now coming to the nasal septum fracture. If force is from front, it is horizontal or Jargeway fracture. If the force is from below, it is vertical or Chevalier fracture. Sir, fracture reduction we using the Ash forceps. Now, sir, important is your paranasal sinus. Paranasal sinus, number one sinus is maxillary sinus, which is present by birth, and it is the largest sinus volume, 15 ml. First sinus to appear in the human is a maxillary sinus. It is a maxillary sinus. The next coming to the frontal sinus, the last sinus to start developing in the human, and the first radiological evidence is coming at 6 years. How do you have to remember? छक्का मारना है front foot पे आके last ball में, that is frontal sinus. Sphenoid sinus 4 years. Ethmoid sinus, ethmoid air cells are present, and this is bulla ethmodalis and agar nasi. Bulla ethmodalis, bulla रखता है सारी चीजें खुला खुला. It is the most constant and the largest anterior ethmoid air cell. Now, sir, most anterior ethmoid air cell would be your agar nasi. If these cells are present in 3 unusual locations, their names are changed. So remember, ethmoid air cell, if they are present on the orbital floor, the new name is Heller cell. If it is close to optic nerve, it is Onodi cell. If it is inside the medial terminal, it is concha bullosa. Now, sir, sinusitis, how it is happening, guys? Remember, osteometal complex, which is formed by buoy. Bulla ethmodalis, uncinate process, and ethmoid infundibulum. Guys, remember, in this such cases, osteometal complex is formed, and whenever there is a blockage of osteometal complex, there will be a sinusitis. Guys, remember, sinusitis ke andar there is one complication, that is your pot puffy tumor. It is not a tumor, it is an infection, and infection which leads to abscess, that is a subperiosteal frontal abscess. Done, done, and done. Now, sir, office headache is happening in the frontal sinus, and most common benign tumor of the sinus would be osteoma, and that is also happening in the frontal sinus. Most common fungus to cause sinusitis would be Aspergillus fumigatus, and most common sinus would be maxillary sinus. Sinus malignancy, most common sinus is maxillary sinus, and there is an Onger's line starting from the middle canthus to the lateral angle of mandible. Below this line there is a good prognosis, above this line there is a bad prognosis or the poor prognosis. Treatment of maxillary carcinoma would be total maxillectomy followed by Weger-Ferguson approach. Sir, mucormycosis, you know, it is present in the HIV, young positive, diabetes, black eye, amphotericin. It's a lysosomal amphotericin B is a best answer if it is given in the option. Sir, rhinitis medicamentosa, word itself is telling you it is caused due to the medicine. You just have to stop the medicine, and you just have to start the nasal spray, steroid nasal spray. So then coming Samterstide, which is very important. It is Na. The mnemonic is NAA, nasal polyp, asthma and allergy to NSAID like aspirin. Sir, patient of anosmia can still sense ammonia. How? Because ammonia is not a smell, it is an irritant. And to which nerve it is irritating, sir? It is your trigeminal nerve. The DNS nasal septum, you remember there is a blockage because there is a deviated nasal septum like this. You know there is a blockage, there is an inferior turbinate hypertrophy, and in DNS, because of inferior turbinate hypertrophy, you will see the Mulberry appearance. And sir, remember there is a Saddler's neuralgia. Headache is also seen in the patient of DNS. Treatment is septoplasty. Sir, long-term complication of FES or septoplasty would be Synechiae formation, and the drug of choice to break this Synechiae formation would be mitomycin C. Sir, septal hematoma, the cause is trauma, and you have to do the aspiration as our planned. Otherwise, it will lead to perforation. Guys, if perforation is there, remember cartilaginous part TB, lupus, leprosis, and bony part is by the syphilis. Clinical feature is whistling sound, and treatment is surgical closure of perforation by the septal button. Now coming to ectopic rhinitis. I hope speed is fine for all of you. I'm not getting feedbacks from so long. Chalo, let me see your feedback. How's it going on? Everything. Anji, क्या सीन है बताओ? सब बढ़िया? Perfect है? Everything going fine? Anji, good है? चलो. Ectopic rhinitis, also known as oozina. It is also known as nosina, and most common it is win. तो कहता है साथी रे तेरे बिना भी क्या जीना, ओ साथी रे तेरे बिना भी क्या जीना. Ectopic rhinitis, it is also most common in the female. It is known as a female. Guys, remember, infection is by the K. oozina, Klebsiella oozina. Roomy nasal cavity is filled with the crust, and bad smell from the patient, but patient has anosmia. So this is known as merciful anosmia, and the treatment is bicarbonate, biborate, and sodium chloride. Sir, coming to the surgical management, there is a Young's operation, modified Young operation, and the Latz-Langer operation. Done. Rhinoscleroma is a woody nose, and it is caused by K. rhinoscleromatis. Sir, on biopsy you will see Russell bodies and Mikulicz cells. Drug of choice with tetracycline, streptomycin. Done. Rhinosporidiosis, something caused Rhinosporidium seabreeze. It is called by Rhinosporidium seabreeze. It is caused by bathing in the pond. Sir, clinical feature is mulberry-like nasal mass with the epistaxis. Now, sir, treatment is excision with the electrocautery of the base. Always remember, whenever there is a history of bathing in the pond, they are taking what? The rhinosporidiosis. They are talking about the disease known as rhinosporidiosis. Okay? Done. Now coming, sir, this is a mulberry-like appearance seen in rhinosporidiosis. Done. Now, sir, CSF rhinorrhea, the cause is surgery and head injury. Clinical presentation, hello sign. It is your hello sign. And most common sign is cribriform plate. Diagnosis most confirmatory for the CSF rhinorrhea. Guys, remember, beta-2 transferrin estimation. How to find the site of leak? It would be your HRCT best. Treatment of choice is conservative. Just you have to change the position for some days, and it will be fine. ठीक है. चलो, उसके बाद क्या है? आर्टरी ऑफ एपिस्टेक्सिस, phenopalatine artery is an artery of epistaxis, and management you doesn't matter, no or no. That, guys, remember Killian's diastasis. Now we are talking about the pharynx. ठीक है. Killian's diastasis is present in the inferior constrictor muscle, and most common site of infection of foreign bodies, cricopharyngeal sphincter. It is present as C6. Done. Now, sir, most common site of hypopharyngeal malignancy, laryngopharynx, or it is also known as hypopharynx. Most common site of hypopharyngeal malignancy, sir, it is your pyriform sinus. Sir, nasopharynx के बारे में बात करेंगे. सबसे पहले क्या है इसके अंदर? Adenoid. We have to study about the adenoid. Sir, junction of roof and floor of doesn't matter. Adenoid had no capsule, no crypt, no definitive blood supply. This is a key word you have to remember about the adenoid, sir. No capsule, no crypt, no definitive blood supply. It is present at birth, grows up to 6 years, started declining and puberty, and disappeared by 20 years of life. Sir, adenoid hypertrophy, open mouth, pinch nose, high palate, malocclusion of teeth, and there will be a frog face deformity. No, that is seen in angiofibroma. Sorry. And there is a atlantoaxial subluxation. Atlantoaxial joint is a no movement joint. Atlanto-occipital is a just movement joint. So guys, remember this is Grisel syndrome. क्या देखने मिला? Grisel syndrome. And treatment of adenectomy in the rose position. Rose position. Angiofibroma. Always remember the case is coming of angiofibroma like this. A 13 to 14-year-old boy is present with the nasal mass and the perfuse epistaxis. Straight away diagnosis angiofibroma. There is a frog face deformity seen. Biopsy is contraindicated. Why biopsy is contraindicated here, sir? Because it is highly vascular tumor. Investigation choices CECT, Hallman-Miller sign or antral sign. See, it is Hallman-Miller sign or antral sign. Sir, nasopharyngeal carcinoma. क्या है? Nasopharyngeal carcinoma. Etiology is Epstein-Barr virus and most common presentation is secondary neck node mass is present. Now, trotter size is NPC. Nasopharyngeal carcinoma is trotter site. It is a trotter site. Can remember neuralgic pain is a temporoparietal area, parietal palsy, conductive hearing loss, that is unilateral. So, NPC. Tortoise stride, which is seen in nasopharyngeal carcinoma. Now, sir, key treatment is chemoradiation. Oropharynx में valvula is present, space between the base of tongue and the epiglottis. Tonsil has capsule, has crypt, has designated blood supply. Sir, main source of bleeding is paratonsillar vein. The main source of bleeding is paratonsillar vein. Hemorrhage in tonsillectomy, please remember this is highly important. Primary hemorrhage is happening during the surgery, reactionary happening within the 24 hours, and the main reason behind the reactionary hemorrhage is a lippage or slippage of ligature, and treatment is immediate re-exploration. Secondary hemorrhage after fifth day it is happening because of infection. The treatment is IV antibiotic. Now, sir, Walde's ring. Collection of lymphoid tissues. Walder quinsy is peritonsillar abscess. Examination is uvula pushed to other side and tonsil pushed medially. Uvula pushed other side and tonsil is pushed medially. But remember, in peritonsillar abscess, which is also known as quinsy, there is no outer neck swelling. Sir, there is no outer neck swelling, and clinical condition is throat pain, dysphagia, hot potato voice, and trismus. Trismus is due to spasm of medial pterygoid. Now, sir, treatment is very important. Per oral incision and drainage followed by tonsillectomy after 6 weeks. This is known as interval tonsillectomy. Now, sir, if same features like quinsy means uvula push to other side, tonsil push media, everything is written, hot potato voice is written. Only thing extra given is a outer neck node mass is present, outer neck swelling is present, then your diagnosis is changed from paratonsillar abscess to parapharyngeal abscess. It is your parapharyngeal abscess, ठीक है. Quins's disease क्या है? Quincke's disease is an angioneurotic edema of the abscess. Of the uvula, Ludwig's angina, something you have to remember. Sir, it is an infection of floor of mouth. There is a submandibular space over here. There will be chin swelling, trismus plus minus respiratory. It is the outer part present. That is why treatment is external incision and drainage. But in the quinsy, we were doing internal incision and drainage. Now, sir, commando operation is done for the oral cavity. Coming to the larynx, which is a deep thorax. It is a deep thorax, sir. Remember, thyroid cartilage like an open book. It is an Adam apple. It is forming Adam apple in the male. Thyroid cartilage is like a open book. Cricoid, ring like. Epiglottis is leaf like. पत्तों से ढके जाता है सामान पुराने जमाने में, बट यहाँ पे पत्तों से ढकी जा रही है vocal cord. It is used to cover the vocal cord. Sir, remember, thyroid angle in female is 120, male it is 90. Keratosis larynx is a pre-malignant condition. It is a pre-malignant condition where, remember, in some smokers their epithelium shreds faster. मतलब सुट्टा पीने वालों में जल्दी झड़ जाता है क्या? Epithelium. Chief complaint is hoarseness. Simply hoarse voice, and treatment is stripping of vocal cord mucosa. Stripping of vocal cord mucosa. Sir, puberphonia. High pitch voice in male. कैसे याद करा था हमने? High pitch voice present in male. It is known as puberphonia. And the treatment is speech therapy. You have to ask the man, gut man maneuver. Please, man, show some guts. That is gut man maneuver. And the treatment is type 3 thyroplasty. Puberphonia, high pitch voice in males. Treatment is speech therapy, Gutsman maneuver, and treatment of thyroid. Endorphonia is low pitch voice in the female. Low pitch voice in the female. Surgical treatment is type 4 thyroplasty. Type 4 thyroplasty. Dun. Sir, oil can of larynx is your laryngocele, and Rinke's edema in the space of vocal cord. Most common smoking and so Rinke's edema say all the people from the Bihar in the chat, Ghana for you. चट दिली मार दिली खींच के तमाचा, ही हंस दिली रिंकी आके पापा, ही हंस दिली रिंकी आके पापा, ही ए दोबारा आ गया रे, इसको हटाओ यहाँ से. वोकल नॉड्यूल, सिंगर नॉड्यूल, स्क्रीमर नॉड्यूल, टीचर नॉड्यूल, किसके अंदर हो सकते हैं ये तीनों फीचर किसके अंदर हो सकते हैं? यस, पी, जामवाल, सेवन, दुन 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 दुन. So teacher, singer, screamer nodule, vocal nodule. Cause is vocal abuse. Treatment is voice rest. Treatment is voice rest. Then sir, coming sir, abductor muscle is your posterior cricoarytenoid. Abductor muscle is your posterior cricoarytenoid and main tensor is cricothyroid. Quality of voice is maintained by vocalis. Vocal paralysis is mostly happening on the left side or right side? Sir, your very much correct answer is left side. There is a bilateral abductor palsy. Guys, remember bilateral abductor palsy, what you have to do, abduction is absent, now means bilateral abductor palsy, your finger is like this. Now you have to make like this. So it is 2. So type 2 thyroplasty is a treatment for bilateral abductor palsy. So bilateral adductor palsy, when the finger is like this. Now you have to make it like this, 1. So treatment for bilateral adductor palsy would be type 1 thyroplasty. Laryngomalacia, cry sound is normal. On crying it will increase. On prone position it will decrease. And examination, it is omega sign epiglottis. क्या देखने मिलता है? Omega sign epiglottis. क्या देखने में? Omega sign epiglottis. Guys, remember, treatment is conservative management. Conservative management. Now, sir, pediatric larynx infection, 100% exam question. It is 100% exam question. Number 1 is acute epiglottitis. Cause is streptococci. The cause is streptococci. Age is 2 to 7 year. Clinical presentation would be very sick child, respiratory distress, and child sitting in bending forward position. This position is known, sir, tripod sign. This is known as tripod sign. And epiglottis, you will see what? Acute epiglottis, you will see a thumb sign. You will see, sir, what? Thumb sign. Thumb sign is seen in acute epiglottis. Thumb sign is seen in acute epiglottis. Treatment is first intervention, steroid and antibiotic. Acute laryngotracheobronchitis or also croup disease. Cause is parainfluenza virus. Age is 3 months to 3 years. Clinical result same biphasic stridor or barking cough. Now your keyword is barking cough, and here you will see a steeple sign. Croup disease, or it is also known as acute laryngotracheobronchitis. You will see what, sir? Steeple sign. You will see what? Steeple sign. Done. Now sir, 2 sign of TB larynx. चूहे के सर पे पगड़ी पहना दी तो क्या है? Mouse nibble appearance, turban epiglottis. Mouse nibble appearance and turban epiglottis. Functional aphonia. If a young, sexy, beautiful female is making you fool by saying that she's not able to produce a voice, just take her in a corner and ask her to cough. If cough reflex is present, that means she is faking the condition. She needs a psychotherapy. Done. Now, sir, voice production after the laryngectomy. Esophageal voice is a poor method. Now this woman is using the vibrator. Vibrators are of tube type. If it is flat top vibrator, that means it is used for the production of voice. If it is like this is also used for the production of voice, but another kind of voice which you all know very much correctly. Now, sir, best is your tracheoesophageal puncture device. This is a best. High tracheostomy is done at first and second ring in the case of cancer larynx. Mid tracheostomy done as second and third ring. If the tube get blocked, अगर फंस जाता है तो क्या करोगे? Immediately remove the tube and put the new tube. If during the thoracotomy, guys, remember, your tube is getting stuck in between, you have to remove that tube and you have to put the new tube. Done. Now, sir, we are going to start next topic. See, next, if I tell you what you have to do for the next topic, that is your pedia, we can do chalo pedia. After pedia, I'll tell you what is the plan. After pedia, I will tell you. Okay? Then I'll tell you what is the plan, sir. Let me open pedia for all of you. After pediatrics, I'll tell you the next plan. Okay? Ciao. Everything working fine for all of you? All my friend on board right now with me, everything is fine? If everything is fine, just give me a thumbs up and let me check the chat because some problem is going on with my chat. है कहाँ का इरादा तुम्हारा सनम चांदनी रात में. मजे आ रहे भाई, मजे. मजे ही मजे। आह 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 आह। बेवफा हो गए देखते देखते, जीने मरने की तुम थे वजह, तो तुम्हें क्या से क्या हो गए देखते देखते। आहा 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 आहा। ओए होए ओए होए ओए होए ओए। कैपूट सक्सेडेनियम, सक्सेडेनियम मतलब सेकंड्स के अंदर हो रहा है दोस्तों, एट बर्थ सेकंड्स आफ्टर द बर्थ इफ इट इज हैपनिंग सक्सेडेनियम। इफ एल एल मतलब लॉन्ग टाइम, after 2 to 4 days, which is coming earlier, it is also going earlier, that means disappearing after the 24 hour, and which is long time taking, coming late, going late, that is cephal hematoma. Sir, L for cephaloderma, L for limited by suture line. Who is limited by suture line, sir? Who is limited by suture line, sir? Remember, the limitation of suture line is cephal hematoma. Who is extended over suture line? It is a caput succedaneum. Now sir, milestone, head control 6 week, partial head control 3 months, complete मसाज करते हैं सर से, मसाज क्या है, सॉरी मसाज क्या है, 5 month, sitting with support 5 months, sitting in tripod position it is 6 months, sitting without support, without 8 month, 8 months, stand with support 9 is like this, देखो डंडी होती है ऐसी, तो 9 months, stand without support 12 month, who can stand, he can also walk with support, that is again 12 month, walk without support, that's your 13 to 15 months, sir. Sir, climb stair it is 2 year, up down stair that is your 4 year, on both feet कूद कूद के चढ़ने लगता है 5 year. Sir, ulnar grasp it is your 7 month, radial grasp it is your 8 month, pincer immature grasp it is 9 month, mature it is 12 month. Tower of 2 cube 15 months, 6 cube 2 year, 20 cube 3 year. Scribbling start at 15 month, copy line. Please, scribbling 15 month, copy line 2 year, copy circle 3 year. Sir, never confuse with the triangle over here. Triangle is made at 5 year. Triangle is made at 5 year. Line 2 year, circle 3 year, cross or plus is having 4 quadrant, that is why 4 year. Hexagon it is 6 year. Hexagon it is 6 year. Now sir, language milestone vocalize कब कर रहा है, 1 month में, monosyllabus and babbling 6 month, bisyllabus baby, babu, shona, dona कब बोलता है, 9 month, 2 to 3 words in first year, sentence बोलेगा 2 year में, story बना देगा पूरी 4th year में, done done done. Social milestone, social smile 6 to 8 weeks. Social smile is coming 6 to 8 weeks. It is coming to 6 to 8. Recognize mother at 12 weeks or 3 months. Once one lady called me and saying, sir, आपने गलत पढ़ाया. Recognize mother is in 3 months. It is not 12 weeks. I was so shocked. I was driving car. I stopped. And then I feel so disappointed that I taught something wrong. Then I came home and I again opened my notes and I saw 12 weeks is equal to 3 months, and I was so shocked. I text that lady, may God bless you with extra brain. Recognize mother 12 weeks 3 months, 12 weeks 6. Smile at mirror image it is 6 months. Smile at mirror image 6 month. Stranger anxiety, stranger lives 7 seas apart, मैं 7 समंदर पार, तो कहला 7 समंदर पार मैं तेरे पीछे पीछे आ गया, मैं तेरे पीछे पीछे आ गया. वेव्स बाय बाय, कब तूने बाय बाय बोला, मदर के यूट्रस को कब बाय बाय बोला, 9 मंथ में, और तुम्हारा बच्चा भी बाय बाय करना कब चढ़ेगा, 9 मंथ. थ्रोइंग थिंग्स 1 ईयर, पीकॉक वो 10 to 12 months. Sir, dress and dress him 3 months. Undress him 3 months, then coming sir, your right and left handed net, some people have taken 3 years. Bladder control 5 years, bowel control 4 year. Done. Sir, breast milk की बात करेंगे. Breast milk के अंदर it is present IgA and whey protein is present. Storage temperature 8 hour, refrigerated 24. Room temperature में 8 hour, refrigerated 24. Breast milk has a higher content of carbohydrate and lower content of protein as compared to cow milk. Now sir, sequence of puberty which has been asked in the exam. Girls first is थिलारकी, last is मिनारकी. Boys में सबसे पहले टेस्टिकुलर ग्रोथ, सबसे पहले क्या बढ़ा तुम्हारा, टेस्टिस बढ़े, क्या बढ़े, टेस्टिकुलर ग्रोथ, एंड लास्ट इज बियर्ड और स्पर्मा की, डन डन डन. नाउ सर द इंपॉर्टेंट थिंग यू नीड टू रन ओवर हियर इज mid arm circumference, best is your bangles and Shakir step. Sir, Shakir step, if you remember, Arnold classification is there. There are three color, red color, yellow color and green color. Normal it is more than 13.5, 12.5 to 13.5 it is mild, and severe less than 12.5, severe less than 12.5. Now sir, what you have to remember over here is neonatology. First urine pass by 24 hours, ठीक है, stool pass by 48 hours, it pass by 48 hours. A newborn do not shiver and do not sweat because it generate heat by lipolysis of brown fat, lipolysis of brown fat. Now newborn lose heat. देखो धन लक्ष्मी हमारी जो हैं सीधा ही धन बरसा देती हैं, अपनी वोकैबुलरी का, अपनी डिक्शनरी में से निकाल के सीधे लफ्ज इन्होंने TATE लिख दिए. अब इनको जोर से अगर तुम अपनी जगह पे बैठ के चैंट करोगे तो हो सकता है पेरेंट्स तुम्हें चैंटा मार दें. दोस्तों कंडक्शन, newborn, guys remember how newborn lose heat, generate heat is by the lipolysis of brown fat. Now how newborn lose heat, sir, it is conduction, contact with the cold surface, contact with the cold surface. Guys remember conduction, contact with the cold surface. Convection, it is source of cool air. तो कैसे याद करोगे, जब चली ठंडी हवा तुझको है जाने वफा हम याद आने लगे, तो source of cool air. Evaporation is lost through the skin, which is most common at birth. If someone asks you what is the most common method of loss of all heat through the skin at the time of birth, it is, sir, evaporation. Overall most common type is radiation, that is near but not in touch with the cold surface. That is the overall most common method of newborn lose heat. Neonatal ICU temperature is 25 to 28, sir. And remember something known as primitive neonatal reflexes appear and disappear. Sir, grass reflex is something you are holding someone's finger. It is coming at 28 weeks, going at 3 months. Coming 28 weeks, going at 3 months. Then sir, rootling reflex. रूटलिंग रिफ्लेक्स, इट इज 32 वीक्स 1 मंथ. 32 वीक्स कहते हैं ग्राफ. रूटलिंग क्या होता है, whenever you are touching the baby, a baby will be moving like this is known as rootling. Now sir, morus, if someone sees something very unexpected thing and it will look like this, तो hand would be like this, oh कितना बड़ा है, ऐसे दोनों हाथ ऐसे एंड मुंह खुला का खुला. दिस इज नोन एज मूरोज रिफ्लेक्स. सर, इट इज कमिंग एट 28 to 32 weeks and it is disappearing by 3 to 6 months. Disappearing by 3 to 6 months. Now sir, parachute reflex, not a permittive reflex because it is present at birth. It is present by birth. After the birth, 6 to 9 months it takes to come and it persists throughout the life. It persists throughout the life. Now sir, Apgar score, which is very important. Let me make it simple for all of you. Appearance mean color. If your baby is of blue color, you will give 0 marks. If the hand and your feet are pink, body is blue, then you will give hand and feet are blue, body is pink, you will give 1 marks. And if your full body is pink, you will give 2 marks, sir. Grimace is something, a response. If no response is coming after putting a nasogastric tube, that is known as no response grimace, that is 0. If grimace is there, that means some movement is there, then 1 marks. If baby will cough after putting the nasogastric tube, that is known as, that will give you what, how many marks, sir? 2 marks. Activity tone, if I talk about poor tone, 0 marks. Some flexion, 1 marks. Flexion at all joints, sir, it will give you how many marks? Flexion of all joints, it will give you how many marks, sir? Flexion at all joint, it will give to 2. Sir, respiratory efforts ki if I talk, no effort 0, irregular efforts 1, regular effort 2, regular effort 2. Done. Now sir, this is a case of congenital diaphragmatic hernia. Congenital diaphragmatic hernia is a case. Done. Now sir, coming to the next thing, complication of infant in the diabetic mother. Large for gestational age, congenital malformation. Most common would be VSD, least common would be ASD. Most specific would be TGA. Neural tube defect and caudal regression syndrome. Metabolic complications, sir, would be hypoglycemia and hypocalcemia. Hypocalcemia. Respiratory complication, hyaline membrane disease. Term versus preterm baby, guys remember, dry and pink term, its skin is of term, smooth shiny skin is of preterm. Instant ear recoil is seen in term and slow ear recoil is seen in preterm. Sir, breast bud size less than 5, less than 10, it is your less than 5 also you can take, it is your preterm, and if it is more than 5 you can consider this as a term baby. Neonatal seizures are most common cause of neonatal seizure would be hypoxic ischemic encephalopathy, and most common subtype would be subtle seizure. Drug of choice for seizure would be phenobarbital. Drug of choice for the seizure would be phenobarbital, sir. Sir, neonatal jaundice is of two types, physiological and pathological jaundice. Physiological is coming after 24 hours and going within the 1 week. This is known as physiological jaundice. Pathological, which is coming before 24 weeks and going after 2 to 3 weeks, that is pathological jaundice. In pathological jaundice, the serum bilirubin is more than 15 mg per dl, and in physiological jaundice it is less than 15 mg per dl. Sir, gold standard method for the diagnosis of neonatal jaundice would be total serum bilirubin estimation. You will use a Kramer's rule. Head के अंदर discoloration होगा the 5. You have to massage head with the 5 finger, that is by 5. Chest you have to test 10. Chest it is 10, and remember whole body without palm and sole it is 15. Whole body with palm and sole it is more than 15. Abdomen and thigh it is 12. Sir, head pe it is 5. On your chest it is 10, and your abdomen and thigh it is your 12. Sir, management is phototherapy. Now miscellaneous point, if I talk about fasting is something known as weight for height. And sir, Waterloo is also known as weight for height. Fasting and Waterloo classification is for weight and height. Sir, stunt मारने के लिए you need a good height and a good age, experience age. Stunt it is your height for age. And sir, Gomez कहाँ जाना है? गोवा जाना है. For Goa, to go Goa you have to wait for your age. That is why Gomez classification weight for age. Common cause of neonatal hypoglycemia would be infant of diabetic, मतलब obvious thing. Now, sir, congenital rubella का triad. Cardiac malformation, sensorineural hearing loss, and cataract. Cardiac malformations is PDA and sensorineural hearing loss. Dun. Now, sir, Noonan syndrome, please remember, short stature, undistended testis, delayed puberty, pulmonary atresia with the normal karyotyping. It suggests of Noonan syndrome. Sir, remember the most common cause of cyanotic with the normal size heart is TOF. Now, acyanotic heart disease, we are having 3Ds. Acyanotic heart disease, we are having 3Ds, sir. It is ASD, VSD, PDA. ASD, VSD, PDA. ASD में MSD. कौन सा मरमर है? MSD. महेंद्र सिंह धोनी. ASD में क्या है? ASD तोड़ देता है, SD तोड़ देता है. महेंद्र सिंह ने छक्के मार के. मिड सिस्टोलिक डायस्टोलिक मरमर. VSD, it is PSM. VSD क्या है? PSM, पैन सिस्टोलिक मरमर. और पढ़ो कॉन्टिन्यूसली पढ़ो, क्या है? कॉन्टिन्यूस मरमर. सर, साइनोटिक के अंदर 5 T's आर देयर. सर, इट इज योर TOF, TA, PVR, TGA, TA. TOF stands for boot shape or tautology of Fowler. TA, PVR, snowman heart or 8 shape figure of 8. TGA is egg on string appearance. Tricuspid atresia and truncus arteriosus. So, tautology of Fowler is further divided in pulmonary stenosis, ventricular septal defect, right ventricular hypertrophy, and overriding of aorta. It is overriding of aorta. Done. So pedia is over, sir. Now what is my plan is anesthesia, psychiatry, derma, ortho, radio. For how many subjects? It is your it is your anesthesia plus psychiatry plus derma plus ortho plus radio. This short subject, please watch through the regular chanting video on YouTube. Please watch this regular chanting video on YouTube. It will just take your 6-7 hours and these many subjects are over. Just watch at 2x. It will take only 3 hours. It will take only 3 hours to complete those short subject. Please, for short subject, you go through the videos which are already available, Now, if you allow me, I would love to start with the FMT. I would love to start. And before that, please, if possible, take a 5 minutes break. Let's do the FMD, which is highly important subject, and I'll make it very simple for you. And please, FMT, let's start at 7:05. Let's start at 7:05. Okay? 7:05. Okay? So I need some energy to charge myself, and I'll be coming in front of you guys very soon. Okay? So God. So, hello, dear. Hello, जी. कैसे हो जी? कैसे हो? Everything is fine, guys. Are we audible? अरे video is not coming, Atulya. Yes, it is there, like that. Okay, now it's coming. Okay, just refresh. Hi. Welcome back, ladies and gentlemen. Let's start with the new subject, new energy, and look who is back. Oh
Yes.
my God, the
I got
handsome young man is back.
कुछ और बोलता, इंटेलिजेंट, हाँ, knowledgeable, experience
In what sense? Every sense. 360-degree experience.
So I was with one of our partners,
Yeah.
and he is a PhD in political science.
Oh my God.
And he said,
Come
"You
to
have-
Egypt.
yes." So we start talking about Egypt, that Tahrir Square revolution, all this.
Yep.
And yes, the Egypt, the pyramids, the Giza, and also the beauty,
gender.
beauty there. So we'll go. Me and Paras will go to
Go
Egypt
Egypt
also.
also.
We'll send you photos from there. We'll live stream that, okay? Live stream. Chalo.
So, ladies and gentlemen, let's start with the first chapter of FMD, that is Indian Penal System and Court Procedure. Guys, remember, IPC is Indian Penal Code, that is for the crime and punishment. CRPC is investigation and judgment. IPC is 511 and CRPC is 484. Guys, what is best? Oral is best. Always remember,
Yes, oral
is best and better. And Indian
Yes.
Evidence Act also says
And
oral is
oral
best.
nahi hai, to bekar.
Bekar.
No oral is useless.
No oral is useless. Guys, witness, most common it is eyewitness. Most common witness is eyewitness. Hearsay witness सुना हुआ है, not valid in India. Expert witness is you guys, Dr. Saab. Yes, you guys. Expert witness, it is qualified doctor. 45 Indian Evidence Act. Cognizable offense are those offenses in which you can arrest a person without even issuing a warrant. Without warrant, that comes under 2 CRPC codes. Number 1 is Supreme Court, High Court, Session Code, Additional Session Code, and sir, remember Assistant Session Code. That is police chauka marti hai, magistrate hit 6. Guys,
Yes.
remember police inquest, it is 174 CRPC and magistrate 176.
Yeah.
Just remember, in police inquest, the report is known as Panchanama. The report is known as Panchanama, and the minimum level of superior record is head constable. Upper
Yes.
can be any limit, it can be go through. Now, sir, police hai, if police is doing any kind of mishappening, like a custodial death is
Yes,
happening,
yes.
firing, a person is in a police interrogation, a person is dying, then you will go for the magistrate inquest, sir, which comes under 176 CRPC. And remember, exhumation is something which is very, very important. Exhumation matlab kya? Khudai karna. Kya matlab hai? Khudai karna. That means digging of the dead body. And sir, it is only possible in front of magistrate, and the lifetime you can do. It is no
Yes.
time limit for the exhumation.
खुदाई की कोई उम्र नहीं
होती,
कभी भी कर सकते हैं खुदाई पूरी जिंदगी
कर सकते हैं क्या खुदाई क्या कर सकते हैं दोस्तों खुदाई कर सकते हैं. Now let's see the court procedure. Summon is known as subpoena, that is known as under the penalty. So remember, if you willfully avoid the summon, then it is punishable. Now priority you will give to the criminal court or the civil court. Yes sir, your answer is criminal court. If both courts are of same level, you will give priority to the court which is reaching you the first. Now sir, oath, refusal of taking oath comes under 178 IPC. It is 178 under IPC. Perjury is false evidence after taking the oath. कसम खाने के बाद भी झूठी अगर सर्टिफिकेट झूठे document produce करे, that is known as perjury. And definition of perjury is 191, punishment is 193. Then coming sir, age less than 12 years, no need to take the oath.
बच्चे मन के सच्चे.
बच्चे मन के सच्चे.
But very soon it's going to change. आजकल के बच्चे आजकल के बच्चों को सब पता है. एक दिन parent asked the kid, son, let's talk about sex. So son कहता है, what do you want to know? Which position, which angle, which?
Yes. अच्छे पापा का अच्छा बेटा. Examination in chiefs, guys. Remember, examination in chief is done by the same side lawyer, and cross examination is by opposite side lawyer. And opposite side lawyer can ask you the leading question, that is yes or no. You just have to reply in yes or no. खाना खाया, yes or no. कुछ करा, yes or no.
क्या आप BSD के हो?
BSD के हो, yes or no. No time limit. And cross examination, sir, there is no time limit. Re-examination by the same side lawyer. Re-examination by the same side lawyer. And magistrate is a person who can interfere any point of time. Sir, then coming to dying declaration and dying deposition. In India, dying declaration is followed, and UK, US dying deposition is followed. Who is better? Dying deposition is better because it is always taken by a magistrate. Yes. Oath is also present there, and the leading question is also present there. Followed by the dying declaration, which is followed in the India, it is not that superior as compared to the dying deposition. Sir, oath is also not required because in India we believe that dying person cannot lie. मरता कभी झूठ नहीं बोलता और जाते जाते वो किसी की भी बजा के जा सकता है ना. Leading question is also not asked. What is the validity? How it is valid? Dying declaration is valid only when the person dies. So your words are only valid when you will die. When you will die, and there is a dying deposition is best and valid throughout the life. Sir, remembering the legal section of the IPC, you have to learn along with us right now. Sir, remember injury 44, life 45, and death 46. Criminal responsibility 82 IPC. What 82 IPC saying? Bacha is like a child less than 7 years is not responsible for any crime. It comes under 82 IPC. 7 to 12 years. Criminal responsibility depend on the mental maturity. It is 83. Magnoton rule. It is 84. Insane person if commits any crime, extradural hemorrhage, it is happening, and it is 84 IPC. Now coming, sir, 85 involuntary drunk, and then it is committing any crime, that person is not responsible, that is 85 IPC. And 86 IPC says voluntary drunk and responsible for crime. Homicide 300 is for the definition, 302 is the punishment of the murder, 304 is the homicide and not amounting to murder. That means what? The person is died, you were not intending to kill him. For example, I did an air fire and someone come in between and he died. My intention was not to kill him. 304 is divided into 2, 304A, 304B. 304A means apron, white apron. Who is wearing the white apron? Yes. It is your medical doctor. That is a medical negligence, sir. B for BV, dowry debt, it is a 304B. Sir, 307 is attempted to murder. 307 is attempted to murder. Dun. Hurt and grievous hurt. Remember 319 and 320. 319 is simple hurt, 320 is grievous hurt. Now 323, 324, 325, 326. How you have to remember? It is a very simple trick. All of them are voluntary. All of them are voluntary. Sir, follow the sequence from 323 to 326. Yes. Remember, simple hurt, grievous hurt. With non-dangerous weapon, non-dangerous weapon, dangerous weapon. So 322, 323, voluntary causing simple hurt with a non-dangerous weapon. 324, voluntary causing simple hurt with a dangerous weapon. Then 325, voluntary causing grievous hurt with a non-dangerous weapon. Then voluntary causing grievous hurt with a dangerous weapon. Sir, at acid 326 further divided into 2. क्या था? 3 ने 2 पे छिड़का. This is known as acid attack. 3 ने 2 पे छिड़का और बच गई, acid attack attempt. Sir, sexual offense is 375. It is the definition of rape. 376 it is a punishment of rape. Sir, 376 is further divided to A, B, C, D, E. A stands for away. A, gay, away. Rape victim या तो मर गए हैं या तो rape victim कोमा में चली गई है. 376A. B for wife. अगर if you are divorced, then you are going to a wife for the forceful sex. Sir, it is a crime. Yes. It is a crime. Forceful sex after the divorce is 376B. Yes. जितना करना divorce से पहले कर लेना, बाद में मत करना. C for custodial rape. D for dog. Dogs come in the झुंड में आते crowd. ठीक है? They comes in groups. So remember, it is a gang rape. 376E, it is a excess heinous crime. 498 is cruelty toward a woman by a husband or a relative. 498. It is 498. Now miscarriage with consent of woman, it is known as 312. Miscarriage without the consent of woman is 313. And death of mother occurs due to miscarriage. It is 314. Now, sir, chapter number 2, it is your traumatology. Blunt trauma forces abrasion, scratch, graze, pressure, pattern, aberration. In aberration, epidermis is gone. As you see, epidermis is gone. This is a love bite given by a very famous man who never give love bite, and he don't know how to give a love bite. Please teach him how to give a love bite. कुत्ते जैसे खाती है बेचारी की गर्दन. चलो. Oh my God, ये कहाँ चला गया?
क्या
फाइल ही चली गई मेरी.
आ जाएगा.
आजा तू तो प्यार मेरा, अल्लाह अल्लाह.
दो खुल गए.
आजा
इकरार मेरा आजा 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 आई बहार ओ तेरा इंतजार ला 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 ला. Contusion is something which is very important. There is intact skin, there is no rupture of epidermis or dermis. Contusion, remember, it is a bruise. Two type of bruises there: ectopic bruise, there anterior cranial fossa fracture, racuna eye, middle cranial fossa fracture, there is a battle eye, there is a battle eye. And remember what laceration, all the layers are gone. Split laceration mean bromopominasis is cut into two. Then stretch laceration is because of the stretching. Avulsion laceration is because of rotational forces. There is a degloving injury. And remember, cut laceration is chopped by the X if you are cutting the skin and you are also fracturing the bone, that is known as cut laceration. Sir, sharp force trauma in size wound, example is surgical blade. Tailing is seen. Tailing and babbling. Tailing is for the direction, babbling is for the angle. Lulululu. Stab injury, entry wound is large, exit wound is small. Harakiri or spiku. Harakiri or spiku. Guys, remember, stab injury, abdomen, there will be a death because of hypovolemic shock. There is a death because of hypovolemic shock. Death because of hypovolemic shock. Dun, 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 dun. Then coming to the fracture, sir. Number one is fissure fracture or linear fracture. Most common fracture of skull vault. There is a single fracture line. Depressed fracture is because of hammer, and you can see depression over here. Second most common fracture. Comminuted fracture, you will see multiple fracture lines dissecting, intersecting with each other. Intersecting with each other. Sir, sutural diastatic fracture line run along the suture line. Fracture line run along the suture line. Sir, Pons fracture, or it is also known as ping pong fracture. It has been asked in the Fmge exam. Most common seen due to the forceps delivery. Forensic ballistics, if I talk about, shotgun range is 50 to 60, revolver 200 yard, pistol 400, military rifle 2000 yard. Military rifle, it is 200 yard, 200, so 2000 yard. Sir, remembering about the shots, contact shot, it is tightly onto the skin. You will come to know by seeing the stellate wound or cruciate margin. Dun, 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 dun. Close shot is less than 1 meter. You will see tattooing over there. Near shot 1 to 2 meter. You will see a single hole with the irregular margin. Then coming to the intermediate shot, it is 2 to 4 meter. You will see a single hole comprising of small rat holes. Now, sir, dispersion is started, and after 4 meter, you will see a complete dispersion happen. There is no single hole. There is a multiple small holes present over there. Sir, entry wound. Bullet entry wound is small, exit wound is large. Now, sir, type of bullet, maximum damage is caused by dum-dum bullet. Kya hai? Dum-dum bullet. And if a bullet breaks down into maximum pieces, that is frangible bullet. And if tumbling bullet which rotate and hit the target, tumbling bullet is like this. Dun, 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 dun. Express bullet kya hai? एक्सप्रेस, चेन्नई एक्सप्रेस पता ना, एक्सप्रेस क्यों तेज? क्योंकि पीछे होल हो रखा, क्या हो रखा है? नीचे होल हो रखा है, होल इन द बॉडी टू इंक्रीज द वेलोसिटी, दैट इज एक्सप्रेस बुलेट. सोवनियस बुलेट मतलब बॉडी के अंदर गया और सो गया, बॉडी के अंदर गया और सो गया. उसके बाद क्या? कैनेडिस फिनोमेना. टू स्टडी द एंट्री एंड एक्सिट वुंड वी यूज अ फिनोमेना नोन द कैनेडी फिनोमेना. पपीज रूल इज अ fracture line will touch each other and tell the sequence of bullet. Dun, 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 dun. Sir, car injury में number one is your neck पे होता है hyper extension, जिसकी वजह से whiplash injury होती है. Face पे what is happening? Sparrow feet mark because of glass. In abdomen, in the aorta tear will be seen because of tearing, and seat belt there will be injury of mesentery. Sir, blast injury में what is first gone? Tympanic membrane is gone at very first. Now remember, electrical injuries, if I talk about, AC is more than DC. AC is more than DC. AC is more than DC. Cause of death in electrical injuries because of cardiac arrhythmia. It is because of cardiac arrhythmia. Most resistant organ to the electrical injury would be the bone and skin. Now the type, it is jewel burn, crocodile burn, and filigree burn. जूल बन गया, झूला कैसे धीरे धीरे झुलाते हो, तो ड्यू टू लो वोल्टेज इट इज जूल बर्न. क्रोकोडाइल बर्न इट इज ड्यू टू हाई वोल्टेज. फिलिग्री इज ड्यू टू लाइटनिंग. लेट्स टॉक अबाउट द टॉर्चर मेथड. कानों को बार बार पीटते हैं. इफ यू आर बीटिंग द ईयर्स अगेन एंड अगेन बिकॉज यू आर पुटिंग योर टेलीफोन ऑन द ईयर्स, दैट इज नोन एज टेलीफोना. फैलंगा बीटिंग द सोल. ड्राई सबमरीन मीन्स you are putting a plastic bag on the face. If you are submerging someone into water, that is known as wet submarine. If you are hanging someone with the hands and legs on a single rod, that is parrot's breach. And if you are putting someone on a triangular surface like this and you are saying what? लकड़ी की काठी काठी पे घोड़ा, घोड़े की दुम पे जो मारा थोड़ा, घोड़ा 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 दुम, थोड़ा sawhorse, make person sit on a triangular surface, और बीच में क्या हो जाएगा फिर चीर फाड़. Black surface क्या है कालिदास, insertion of hot metallic rod into the anus of a victim. Planton, it is prolonged standing. Ghutna, it is a rolling of heavy wood on the log over the body. Now chapter 3 is thanatology, is a study of death. Guys, remember there is a somatic death and the cellular death. Somatic death means your heart, lung and brain will stop working. Cellular death means now cell will start dying. Now this time gap is between, there is a time gap between the somatic death and the cellular death. That time gap is known as supravital period. That is known as supravital period. Now sir, after death what is happening? If you are short, don't worry, after dying you will be, length will be increased, length increase in 2 to 3 centimeter. Eyes में changes, number 1 is Kevorkian sign, number 2 is trachenoid. Trachenoid में your sclera is involved. And remember algar mortis, algar mortis में Algae का freeze होता है. Freeze क्या करता है? Temperature को कम करता है. Rate of fall in summer is slightly less as compared to winter. Summer it is 0.5, winter it is 0.7. Postmortem caloricity means increase in temperature. First 2 hours what is happening? There is increase in temperature because of septicemia, because of the some bacterial activity. Remember liger mortis. Liger mortis mean postmortem staining. Mechanism of liver mortis, which mean the area which is not touching the ground, in those areas there will be postmortem staining, and most common color would be of bluish purple color. And guys, this liver mortis is absent in case of drowning. In case of drowning, this liver mortis is absent because it is happening because of gravity. It is happening because of gravity. Now sir, on hanging is postmortem staining is seen in feet, hand, penis. Now this staining color change according to the poisoning. Let's importantly read about those. And carbon monoxide poisoning, cherry red staining is seen, cyanide poisoning, brick red is seen, hydrogen sulfide bluish green, opium poisoning black, and chocolate should be banned. Chocolate should be banned, benzene, aniline and nitrate. Rigor mortis means rigidity. Rigor mortis means rigidity, that is also because of decrease in ATP. First site of rigor mortis would be your myocardium. Inside first most common site is myocardium. Overall most common site is myocardium. Specifically they are asking the first external site, then your answer is eyelid. Now eyelid to toes it is going, that is known as Niston's rule. That rule is known as Niston rule. And also for the rigor mortis, the rule is of rule of 12. 12 hour it involve all the muscle, 12 hour it remains, and after 12 hour it disappears. Now sir, condition that look like a rigor mortis, it is a cadaveric spasm. This is a sign of struggle present over here. This is a cadaveric spasm. This has been asked in your exam. This is because of antepartum drowning. Mean person was alive before throwing into the water, and that is why the sign of struggle is present, and this kind of spasm is known as cadaveric spasm. Then heat stiffening as a cold stiffening. Sir, what is happening in heat stiffening? You can compare it with the egg. You can compare it with the egg. Before making the omelette, you will see, you will heat it, then there will be a coagulation of the protein and it will be a stiffening. Like same way in our muscle it is happening. Muscle will be heated on more than 65 degrees Celsius, protein coagulate, and there will be a stiffening. And there is a cold stiffening because body fluid will become ice crystal, joint cannot move, and remember cold stiffening is seen. And also in the burn patient you will see boxer's attitude or pugilistic attitude. Putrefaction is as sure as sign of death. Putrefaction is as sure as sign of death, and most common bacteria is Clostridium welchii. Enzyme involves in lecithinase. Enzyme involves lecithinase. First color change in the external side, it is greenish discoloration of the right iliac fossa. First color changes in the putrefaction is a greenish discoloration of the right iliac fossa, then coming to the marbling, then coming to the maggot formation. Maggot formation, ENT, already we have discussed. Gas production, the predominant gas production of the putrefaction, that is your hydrogen sulfide, and because of this hydrogen sulfide only body floats. Now sir, organ involved in the putrefaction, first is larynx and last is the bone or tooth. Casper-Dicton mean rate of putrefaction. Rate of putrefaction. Guys, remember air, water, soil. Air, water, soil. Air it is 1 week, water 2 weeks, soil it is 8 weeks. Now coming to the putrefaction, first is adipocere. Adipocere, first there is a adipocere formation, mean there is a soap formation. Emulsification happening there, and guys remember the smell of adipocere is ammonical, and the time appearance would be 3 days to 3 months. 3 days to 3 months. Mummification is happening, drying, dehydration of the body in the mummification. Time is 3 months to 12 months, and it is odorless. Ammonical swell is present in ammonification. Adipocere formation, and mummification is odorless. Embalming of Thanatoprasia is a preserving of body, and most commonly used is formalin. Chapter number 4 is postmortem diagnosis. Remember in this chapter you don't have to remember anything else. Just remember medical legal autopsy. It is done due to request of the investigating officer, and remember it is done in the case of unnatural death. If you not found anything in the autopsy, that is known as negative autopsy. It fails to reveal the cause of death. death. Now sir, opening the cavity, poisoning cases you will open the cranial cavity. ठीक है, in the poisoning cases you will open the cranial cavity. Then newborn में you will open the abdominal cavity. Air embolism you will open the ventricle. Asphyxial deaths you will open first the cranial cavity, followed by thorax, followed by neck. In the end you will open the neck. In the end you are opening the neck. Why? Because you need a bloodless dissection. Sir, then coming to the chapter number 5, that is human identification. Just remember this: 70 to 75, 75 to 80, 80 to 85, 80 to 85, 70 to 75, 70 to 75, 70 to 75, 75 to 80, 80 to 80. You are starting from the 70, you are going to the 85, 70 to 75, 75, 80, 80, 85. Guys remember कैसे याद करना? DMB कैसे याद करोगे? DMB, डोला डोला डोला. क्या बोला? ओ मेरा डोला नहीं आया डोला, मेरा डोला नहीं आया डोला, अब दुनिया खेल है खेले, रोज लगाए मेले, और कहंदा कुछ ना बदला, झूठ बोले, और डोला डोला डोला. डार्क नीग्रो. क्या है? नीग्रो. डार्क इज नीग्रो. मस्ती करते कौन? इंडिया वाले चाइना में जाके मस्ती करते हैं. नी हाओ फंगियो, नी हाओ मा. मैं सेंटर स्पेलिंग ब्रा में सब गोल गोल, तो क्या है? मंगोल. ब्राकी ब्राकोल गोल, मंगोल मंगोल मंगोल. डंडना 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 डन. Sexual identification, guys remember to identify male and female, the best bone is a pelvic bone and best parameter is sciatic notch. Sciatic notch in the male pelvis it is short and in the female pelvis it is wide and large. Age estimation is not that important. Guys remember, now you have to remember the identification method. Poroscopy to study the skin pore. Poroscopy to study the skin pore by the Lockhart. Cilioscopy to study the lip print by the Suzuki. Palatography is by the hard palate, और hard palate आगे होता है Allen. It is by the Allen. Guys remember, anthropometry is for the Bartolian system. It is for the gumshuda ki talash, the missing person to be identified with the help of Bartolian system, that is anthropometry. Dactylography is the best to identify the fingerprint. It is by the Galton system of William Herschel. Guys remember Quetelet rule. What Quetelet rule says? It says fingerprint is not same in the identical twins. Quetelet rule says the fingerprint is not same in the identical twins. Classification of Henry. Guys remember 3 type of fingerprint is there: loop, whirl, arch. Most common type of fingerprint would be loop, least common would be arch, least common would be arch. Then coming to the permanent loss of fingerprint is seen in leprosy, radiation, charring. Leprosy, radiation, charring. Leprosy, radiation, charring. Chapter number 6 is the asphyxial death. Asphyxia में tried is seen. It is known as CPC tried. Asphyxia, West-tried is seen. It is CPC tried. Cyanosis, petechic congestion. Guys remember, tardive spot is seen whenever you are dying by hanging. Trachinoid is seen in the normal death. Now weight of constriction, the mnemonic is JCTV. Jugular vein, carotid, trachea better. Jugular vein is 2 kg, carotid artery 5 kg, trachea 15, vertebra 30. Now sir, suffocation. This is known as smothering. You are covering actually the oropharynx and your nasopharynx. This is known as smothering. Now sir, this is known as gagging. This is known as gagging. You are putting a gag inside the oropharynx. This is known as gagging. Now sir, choking is something which is need to be taken care of, because choking is a severe emergency. In that case your treatment is your Helmich maneuver. Sir, traumatic asphyxia, there is a mechanical fixation of chest whenever someone is on you while performing sex. Also while performing a cowboy position sex, there might be a chances that someone can choke you on your chest like this and you can die of traumatic asphyxia. Burking, सीखो बुर के ऊपर किंग चढ़ गया दोस्तों, देखो कैसे है. Oropharynx, nasopharynx is blocked. Also there is a mechanical fixation of the chest. This is known as burking. This is known as burking. Dun, 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 dun. Then positional asphyxia, jackknife position. Because of this position a person can die. Dun, 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 dun. Now based on the knot, we will define the hanging. We will define the hanging. Guys remember, if knot is at the occiput, it is known as typical hanging. If knot is somewhere else, it is known as atypical hanging. Now based on the suspension, if the complete body is on the air, then you can say the constriction force is whole body. Partial hanging, the constriction force is a head weight. Constriction force is a head weight. Guys remember, now postmortem finding in the hanging person, it is very important. Number 1 is tardive spot. You already showed there is an involvement of conjunctiva, protrusion of tongue, semen discharge, dribbling of saliva, head bone fracture, that is at C2, that is also known as hangman fracture. Then you have to remember manner of hanging, suicidal hanging and homicidal hanging. ठीक है, उसके बाद judicial hanging which is practiced in India, and there is a hangman fracture as vertebra C2. Now sir, type of strangulation, if we talk about, mugging is with the elbow. Mugging is with the elbow. Garroting is with the metallic collar. It is used in the Spain. Throating is seen with the hand. Bans dolaga with the stick. And first cavity to be opened in the asphyxial death is your cranium, then your thorax, then your abdomen, then your neck. Done. Sir, drowning most commonly is accidental. Why accident is most commonly because suicide people rarely do by jumping into water, because it is highly painful. It takes time. And to what I mean, remember what wet drowning and dry drowning. Guys, remember wet drowning. There are two type of wet drowning. There is a freshwater drowning and seawater drowning. Freshwater drowning, guys, remember hemodilution is there because of decrease in potassium. There is a ventricular fibrillation. Seawater drowning, what is there? There is a bradycardia. The cause of death in the seawater drowning would be bradycardia. Freshwater drowning, the cause of death will be ventricular arrhythmia. Then dry drowning, what is happening after jumping into the water? There will be laryngospasm. Because of laryngospasm, no water will go inside, no air will go inside, and patient will die. And the patient will die. Now, sir, near drowning is done. Now, near drowning is something post-mortem drowning complication. Let's suppose a person saved after jumping into the pond. Now you will say there is a pulmonary infection and there is an electrolyte imbalance. There is a pulmonary infection and there is an electrolyte imbalance, sir. Now remember hydrocution. It is also known as immersion syndrome. Because of cold water, there is a vasovagal shock and a person will die. Now, post-mortem changes in the drowning, sir. It is very, very important. If death is inside the water, you will see a clench fit, that is known as cadaveric spasm. You have seen the image-based question of that. Remember, clench hand with some grass particle inside. Lungs, you will see emphysema question, there is a filling of water. Mouth and nose, you will see mucoid lateral frothy discharge. Now, sir, trachea, you will see mud particles in GIT, mud plus water. Diatoms is present in antepartum drowning, mean person was alive before jumping into the pond. As I already posted one short video on the diatoms, please go through it. Diatoms is present because circulation will actually carry those diatoms from the blood to the bone. That is why it is positive in the antepartum drowning and diatoms are absent in the postmortem drowning. Now, sir, both antepartum and postmortem Washer-Bowman syndrome is seen. Palm and soles are involved. They are wrinkled. You actually, as you jump in the swimming pool, you all see what your hands and palm will turn white. That is known as Washer-Bowman syndrome. Then flotation, body start floating because of a predominant gas known as hydrogen sulfide. Sir, in winter it is 1 to 2 days and in summer it is 24 hours. It is 24 hours. Done. ठीक है? क्या हो गया? स्पीड ज्यादा होगी क्या? That is a energy drink known as Monster. ज्यादा स्पीड होगी क्या? एग्जाम नहीं लिखना क्या परसों? स्पीड नहीं चाहिए क्या? What is happening? क्या हो गया भाई? गुस्सा क्यों कर रहे हो? क्या हो गया बताओ? What is happening? गुस्सा नहीं करना. चलो बताओ. धीरे पढ़ाऊं? धीरे पढ़ो, धीरे धीरे से मेरी जिंदगी में आना, आके देखो कैसे. अबे भाई नेट रुक गया मेरा. मिस्टर अतुल्य यार, yes, my devices are today not working fine. I'm not able to take the feedback. Without feedback I can't survive if I can't interact. Yes, fine. Now it's coming. Oh my god. Faster or slower? Just tell me, faster or slower? As per you say, I will go. Please tell me, faster or slower? Faster or slower? What do you prefer, sir? Little slower. Okay, little slower. Now, sir, natural sexual offense. Penovaginal penetration is a natural sexual offense. It is a natural sexual offense, sir. Rape definition is 375, punishment is 376. And rape punishment is minimum 10 years and maximum life imprisonment. Now, what is rape, sir? If you are doing something against her will, without her consent, and if even you are having consent, but her age is less than 18 years, and if even you are doing sex in case of intoxication, in case of insanity, in case of fear, these all conditions are considered as rape. These all are considered as rape, sir. Remember, sir, even slight touch of a glans penis on the vagina is considered as rape. Now, sir, examination of rape victim. If you disclose the identity, if you disclose the identity, then it comes under 228 IPC. And guys, remember, crime scene, sperm, it is 10%, barbados, fluorescence and Christmas. How we have remember for the sperm? Barbie गई फ्लोरिडा क्या मनाने? क्रिसमस मनाने गई. तो क्या है वहां पे स्पर्म मिल रहे थे? Barbados, fluorescence, Christmas stain. Now, sir, seminal stain 90%, lactate dehydrogenase, more specific type. Now, sir, we are bloodstream. I'm talking about the confirmatory would be spectroscopy, Takayama Tickman. Confirmatory Takayama Tickman, and incest is a sex between the two blood relative. Now, sir, adultery is a male having sex with the wife of another male. Yes, I want to highlight this point. A male having sex with the wife of another male is not punishable. It is not punishable. Lage raho, lage raho, lage raho. A male having sex with the wife of another male, it is not punishable, sir, and it can be a ground for divorce. And it can be a ground for divorce. Sir, unnatural sexual offense. Unnatural sexual offense 377 377 क्या है 377 377 सोडोमी लव या बकरी. तो कोई बोले आई लव यू, उसका मतलब कुछ हो रही है. That means he wants some unnatural sex, and that unnatural sex can be anal sex, that can be oral sex. Sodomy, love or buggery. Sodomy, love or buggery. So guys, please be aware of the people who says I love you. That means there is something else which they are demanding. So penoanal intercourse can be between a male and female, and it can be between a male and male. It can be a male and female, male and. Now, sir, lesbianism is a forensic medicine is a complete imagination subject. Please imagine along with my teaching. You will love it. Guys, remember lesbianism is also known as tribadism. It is tribadism. Active female is known as butch or die. ये die मार के ऊपर चढ़ जाती है. Passive is femme. Passive is femme. Buccal coitus, oral sex, also known as sin of Gomorrah. ये क्या है? पाप of Gomorrah. Sin of Gomorrah. Sin of Gomorrah. Now, sir, fellatio, if a oral stimulus of a penis, if female is giving a oral stimulus to a penis, that is known as fellatio. If a talented male is giving a oral stimulus to a female vagina, that is known as cunnilingus. That is not cunnilingus. और cunnilingus का नाम सुनते ही एक डॉक्टर क्यूनिलिंगस हमारे बीच में आ चुके हैं. देखो वाह वाह वाह, ऐसी गंदी बात सुनते कैसे आ जाते हो बाहर से, मुझे ये समझ नहीं आया.
What is tossing the salad?
That is something I think.
ये किसी को नहीं पता होगा. I don't think anyone know what is this.
Oh my God.
Rimming क्या होता है? Rimming. Let's check their.
इनको बस गपागप पता है क्या होता है, बाकी
मतलब very less knowledge है. What is rimming?
पता है. और लड़कों से ज्यादा लड़कियों को पता होता है ऐसे वर्ड के. ये तो मैंने पर्सनली ऑब्जर्व कर.
देखो किसी को नहीं पता. No one knows. So that shows. I know more.
Oh my God. Bestiality. Some of the people I have seen, they are writing beast on their cars. They say they write beast on their car. Beast mean beast, sex with animals. Sex with animal, it is known as bestiality.
Also called zoophilia.
Zoophilia. And remember, sexual.
किसी को नहीं आता.
देख रहे हो?
No, मतलब. वाह.
Don't know about the bad terms. If you don't know about the bad terms, let me take you on the next term. That is a sexual perversion, sir. Sir, sadism. A person enjoy giving the pain.
Yes.
Masochism. A person enjoy suffering
Like
the pain.
Examiner are sadists.
They are sadists. They enjoy giving the pain.
Yes.
And you guys are masochism, enjoy suffering the pain. Now, sir, frotteurism. It means rubbing of private part on the female parts. Any part of female in the public, these guys are doing this activity. Fetish mean a person enjoy with the object related to female. For example, a beautiful lounging.
Yes.
Then transvestism means a person enjoy wearing opposite sex clothes. A person enjoy wearing opposite sex clothes. Exhibitionism is a bulla रखता है सारी चीजें खुला and on bulla there can be a IPC 294, sir.
Yes.
Flashing is person suddenly shows genitalia. आ जाते एकदम से पेट नीचे शू करके पट से हेडशॉट. Mooning मतलब gluteal region are like moon. तो क्या बोलते हैं? तुम आई तो आया मुझे याद, गली में आज चांद निकला. Analogous meaning remark. Analogous means very. Wow. So guys remember, moon कौन होते हैं? Moon कौन है? Gluteal region. तो क्या बोला उसने? बड़ा अच्छा गाना गाया, सच में सोच के गाया. तुम आए तो आया मुझे याद, गली में आज चांद निकला. जाने कितने दिनों के बाद गली में आ, वो जो चांद था वो क्या था? अ पर्सन शोज ग्लूटियल रीजन है, पर्सन शोज ग्लूटियल रीजन। स्ट्रीकिंग क्या है? नंगे होके भाग जाना। पर्सन एंजॉय रनिंग नेकेड, अ पर्सन enjoy running naked.
Yes.
And if you want English translation of that song, I can also do for you guys. nahi, I don't know after how many days in my lane there is a moon. This Voyeurism is scotology or peeping Tom. A person enjoy watching the private acts of a female and IPC 354C. To see someone doing some private activity, that's the 354C. Necrophilia, IPC 297. Person enjoy having sex with dead body. Necrophagia, person enjoy eating dead body.
Partner act like dead body.
Yes, that is also
necrophilia.
It actually happens. Sometimes you go to some places where there is paid things. There it happens like that only. Coprophilia, person enjoy by watching or having the smell of feces.
Oh.
Coprophilia. Urophilia, a person enjoy by watching or having a smell of urine. Masturbation, I know you have never done in your life. Never done in your life, and you will never do in your life.
Yes.
This is a very complicated procedure. For this you need a very high training.
Yes.
Masturbation, it is known as masturbation. A person enjoy shaking his own
Penis and also something can be female masturbation.
that is known as fingering. शर्मा लगा इसमें, बुक में लिखा हुआ। अगर किसी का बॉबी काट दिया, तो क्या है? बॉबिट। क्या है? बॉबिट। मेल जेनिटलिया is amputated by female. Scatology is mobile sex. Once these all people came back to their places from foreign universities, suddenly there is a lockdown. And what happened in lockdown? All the couples were away from each other, and those conditions, guys were begging girls, baby please, एक photo भेजो please, इतने दिन हो गए please. That is scatology.
Why are they asking for photos? There are so many photos.
No, but that isn't real. अपनेपन की भी तो बात कर, कहते अपना है जो कि अपनी होती है।
Photoshop कर
रोटी नहीं भाई, वो आप जैसे लोग होंगे। So guys, mobile sex is done. Now medical jurisprudence, you can actually just relate to the if there is some problem, there is a violation of medical ethics, guys, there will be a state medical council at the first go who will take care of that. Remember, there are two type of cases: simple cases and severe cases. Simple cases only warning is given, and the severe cases penal erasure is done. And remember, two type of penal erasure is done. One is temporary, one is permanent. Permanent penal erasure is also known as professional death sentence. It is also known as professional death sentence. It is confirmed by MCI or NMC. MCI or NMC. MCI is not used nowadays. NMC you can go to. If NMC is also not listening to you for your permanent erasure, you can go to the health ministry. You can go survey health ministry. Done. Next set. Which is the best consent? Someone asks you. It is a written and informed. It is a written and informed. Written and informed. ठीक है?
क्या हो गया? IPC.
ठीक है. Now, who can give consent, sir? Minimum age is 12 years. Consent for any major procedure would be 18 years. Done. Now, sir, your important thing is your impotency. Inability of a person to achieve and maintain a penile erection. अगर हिंदी में बोलूं तो बड़ा वल्गर लगेगा, पर इंग्लिश में बड़ा क्लासी लग रहा है, इसलिए I want to be classy today. Inability of a person to achieve and maintain a penile erection, that is most common cause is psychological cause. That means because of stress, sometime it happens that erection is gone. It might be happening with all of you right now, maybe some of you right now, because of exam stress. It is like this only. Now, sir, type 1 is your quad. Type 1 is your quad. ये जो बीच में बोलते हैं ना, अभी क्या हो जाए? क्या कहते हैं?
Yes. खड़ा है दर पे तेरे आशिक खड़ा। ये भी गाना है।
सही गाना गाया। डॉक्टर बोनी कह रहे हैं, खड़ा है तेरे आशिक खड़ा है।
खोल 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 दरवाजा।
दरवाजा खोल 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 दरवाजा खोल, आशिक खड़ा है। क्वाड इज इम्पोर्टेंसी टुवर्ड अ पर्टिकुलर वुमन, मतलब जमाने की सारी वुमेन्स के साथ उसको मजा आता है, खुद के वाली के साथ नहीं आता, कि खुद वाली क्या बन चुकी है, कवाड़ बन चुकी है, दैट इज नोन एज क्वाड। फ्रिजिडिटी मींस यू हैव परफॉर्म्ड a tremendous amount of stunts, you have done all the foreplay activities and still female is cold, she's not even turning wet, she's not turning on. That means now that female is becoming a fridge, and that fridge is the strongest ground for divorce. That fridge is the strongest ground for divorce. Sterility, inability to produce a children in both male and female. Sir, virginity, I know all of you are virgin who are watching me right now, all of you are virgin, ठीक है? Virginity, a person who has never experienced sexual court, including me, including sir, you guys all are virgin, guys. Remember, person who has not experienced a sexual intercourse is known as virgin. It is known as virgin.
क्या हो गया?
मोस्ट कॉमन टाइप ऑफ वेजाइना, इट इज सेमी ल्यूनर और क्रीसेंट। तो देखो, जो लोग कहते हैं ना आई लव यू फ्रॉम मून एंड बैक, ये देखो वेजाइना की शेप कैसी है, सेमी ल्यूनर और क्रीसेंटिक शेप। तो एक्चुअली वो कहना चाहता आई लव यू फ्रॉम मून एंड बैक, मतलब सामने से लेके पीछे तक प्यार करूंगा चांद के। Defloridation is loss of virginity, and who is false virgin? Intact hymen after the intercourse. Even after the intercourse, the hymen is still intact, अपनी जगह पे खड़ा हुआ है। दोस्तों, most common site of rupture, it is posterolateral if it's due to penetration, and if it due to masturbation, because female don't masturbate, it is your fingering, it is your anterior surface, it will be gone. Now sir, superfecundation, क्या है? Superman, two ovaries fertilized in the same ovulatory cycle, because one Superman came, two separate act of coitus, one normal man was there, another best friend was there, ठीक है? So all my dear friends and best friends, two separate acts of coitus, that is superfecundation. Superfecundation, sir, legitimate child is a child born during the legal marriage. Supposititious child is a female faking the pregnancy just to gain the money, dun 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 dun. Then coming sir, posthumous child, a child born after the death of father. MTQ Act छोड़ दो, यहाँ पढ़ लो बस। MTB Act 2021 says more than 24 weeks also you can do abortion for the special cases. 0 to 12 week you need sir one doctor, 12 to 24 you need two doctors, dun 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 dun. Now sir, can you tell me who is most poisonous? Option A and option B.
Yes.
Option A and option B. Sir, who is most poisonous? I want all of you to answer in the chat box right now.
Yes. I think both are non-poisonous. So this is a python. Python is non-poisonous. And how can a girl be poisonous? They are sweet, na.
मक्खन बाजी किसी काम नहीं आई।
So both are non-poisonous.
So ladies and gentlemen, friends and best friends, please remember cobra and common crate. Cobra and common crate. Cobra and common crate, guys. Remember, fatal dose of cobra is 12 and fatal dose of common crate is 6.
Yes.
Remember, the treatment is neostigmine. Yes. Plus anti-snake venom, and they both, common crate and cobra, is a neurotoxic and patient can go into coma. Sir, viper is a V shape, triangular shape head is there, and V for viper, V for vasculotoxic. Yes. Sea snake is a myotoxic, non-poisonous snake. They are the non-poisonous snake. ठीक है? ठीक है? Then most common cause of death in the snake is fear due to bite. Fear due to bite, and the treatment is right. Reassure, immobilize, go to hospital and start the treatment. Yes. Now, in all the snake bites, you have to give the anti-snake venom except myotoxic snake, that is sea snake. Dun, 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 dun. Poisonous snakes are having 2 fangs, and non-poisonous snakes are having multiple teeth bite mark. Means the love bite which snakes are giving to their cats, that is non-poisonous, that is non-poisonous. ये देखो सर, आज स्पॉन्सर बहुत तगड़ी आ रही है आज हमें, आई थिंक 20-30 बार आ चुकी है अभी से।
ऐसा क्यों हो रहा है?
ऐसा क्यों हो रहा है? ऐसा क्यों हो हो रहा,
दुश्मनों की साजिश है।
जाने क्यों।
क्या ये एग्जामिनर की साजिश है कि
क्या
बच्चे
ये
ना पढ़ पाए?
भटकाना चाह रहे हैं? क्या ये हमारे एफएमजीज को भटकाना चाहते हैं? इनकी खोई हुई वर्जिनिटी को लौटाना चाहते हैं? प्लांट टॉक्सिन, रिमेंबर number of seeds as fetal dose, 1 is for strychnine, 4 is for Jamal Gota or Nepala, and 10 is for castor or R&D, 100 is for Datura.
Yes.
Now, so strychnine is Nexavomica. It mimics tetanus. Tetanus is 8th rate disease, and most common position will be osteotonous position, and the antidote is diazepam. Strychnine or Nexavomica, which mimics tetanus, antidote is diazepam. Datura is a 9D poison except diarrhea. Antidote of Datura is physostigmine. Then chilly hand disease is dermatitis Hunan hand. That is dermatitis Hunan hand. ठीक है, ठीक है. Chilly seed disease is dermatitis Hunan hand. Done, done, and done. Now, sir, cannabis sativa. It is very important. Cannabis sativa. Just remember the ganja. It is from the dried flower of female plant, and there you feeling a run amok. What is run amok? You will feel like running or going somewhere. Either you will feel like killing someone or killing yourself, and there is a amotivation syndrome. Sir, opium is also known as afim. Antidote for afim or opium would be your naltrexone.
This
and
year NEET PG
naloxone.
question.
NEET PG exam question, naltrexone or naloxone.
Naloxone will prefer for acute poisoning. Okay. और इसमें क्या करेंगे? This is for withdrawal. Naltrexone is withdrawal. भाई मुंह में कब दोगे? withdrawal से दोगे. और अगर acute है तो ये. और इसमें क्या है? याद करना पिन पॉइंट पीपल. एक पिन पॉइंट याद कर लो.
एक और जगह सर पिन पॉइंट पीपल,
3 जगह याद कर लो. कुछ और. ओपियम पॉइजनिंग पिन पॉइंट, ऑर्गेनोफॉस्फेट पिन पॉइंट एंड पोंटाइन हेमरेज.
ना एक चौथा भी है.
वो तो बता.
आर्गाइल रॉबर्टसन प्यूपिल पढ़ाया मैंने इनको. आर्गाइल रॉबर्टसन प्यूपिल और प्रोस्टिट्यूट प्यूपिल. देखिए छोटी छोटी आंखें थी, कैसे थी आंखें थी, तो क्या बताए? आंखें तेरी इतनी हंसी ला 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 La 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 la.
कितने बच्चे अभी भी देख.
Now 769. Opiate, morphine और codeine. Opioids का क्या है दोस्तों, याद रखना कोकीन. सबसे पहले बात करो कोकीन, भूल जाओ सारी चीजें. कोकीन, कोकीन इज आल्सो नोन एज व्हाइट लेडी. ऑब्टेन फ्रॉम कोका 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 leaf. Sign and symptom is maximum symptom. You will feel like running off insect on your body, sir. Then taken as a smoking or snorting. देखो black teeth, black tongue. कहने को व्हाइट लेडी है, टू से इट इज अ व्हाइट लेडी, पर काम सारे काले हैं. वर्क इज ऑल ब्लैक, लाइक अ ब्लैक टीथ, ब्लैक टंग. एन एंटीडोट ऑफ कोकीन वुड बी आमिल नाइट्रेट. आम मिलो कब? रात में मिलो. तो व्हाइट लेडी से व्हेन यू वांट टू मीट सर एट नाइट. व्हाइट लेडी से कब मिलना चाहोगे? रात को मिलना चाहोगे. और व्हाइट लेडी के सारे काम कैसे हैं? ब्लैक. दैट इज व्हाई ब्लैक टंग, ब्लैक म्यूकोसा. नाउ सर स्पीड बॉल, हीरोइन प्लस कोकीन. Speedball is heroin plus cocaine, and most common substance abused in India is alcohol. Most common substance used in India is tobacco. It is tobacco. Arsenic poisoning mimics the cholera, and garlic smell is seen. Eldritch mealine is seen. That is white niche. Garlic is also white, and your eldritch mealine is also of white color. Antidote is ball. Arsenic. Arsenic. आ रहा कि नहीं? आ रहा कि तेरे बाल खींचूं? आ रहा है. बाल क्या है? बाल. Red velvety mucosa, blackfoot disease. Number cyanoid. Antidote is also amyl nitrate. Amyl nitrate. Remember cyanide and the cocaine. The antidote is amyl nitrate. Amyl nitrate. Guys, remember now your important thing I want to tell you is your phosphorus. Sir, two type of phosphorus there, white and red phosphorus. White phosphorus is Diwali poisoning. White phosphorus Diwali poisoning. And remember, toxic smell is also present. Garlic smell. White poison is toxic and garlic smell is present. Red is side of matchbox and it is non-toxic. It is non-toxic. Then coming to the antidote of phosphorus poisoning, it is your copper sulfate. It is your copper sulfate. Sir, copper sulfate poisoning की वजह से Fossey joint, hand tremor. Mercury, very important, Minamata disease of Japan. There will be pink disease. There will be hatter shake, glass blower shake. There will be erythrism. That is a person become shy. Japanese people are actually shy and they are of pink color. Their color tone is pink color.
They are so shy. They don't show the genitalia.
Yeah.
They do pixels.
Yes.
Boxes are there. Boxes. People remember.
Boxes. Ball. Mercury, it is wall. Mercury poisoning, it is wall. Guys, lead poisoning is the most common heavy metal poisoning in the world. Guys, remember, wrist drop and foot drop is seen, and also Bartolian line and basophilic stippling. Antidote is EDTA. Now, sir, ethanol, the limit is 30 mg, 80 mg पे nystagmus, 150 पे motor incontinence and 400 पे coma या death. ठीक है? Now, sir, methanol antidote is ethanol. Which poisoning is most dangerous? Alkali is most dangerous as compared to the acid poisoning. Now, sir, oxalic acid is an ink remover. Antidote is calcium gluconate, and the treatment is wall scraping. Treatment is wall scraping. Okay? Also, sulfuric acid, strongest acid, it is also known as acid of vitriolate. That means acid attack 326A, 326B. Done. Now, sir, poisoning and their smell. Hydrogen. Whenever you're opening the cranial cavity in the poisoning, you will sense a different smell. You will see a different smell. Okay, guys, remember. Okay. Now, hydrogen sulfide, it is rotanac. Ethanol, it is fruity. Nitrobenzene, it is shoe polish. Hemlock is a nerve poison. It is carrot-like smell. So, two things are there: body packer syndrome and body stuffer. Body packer is you are taking a condom, putting a drug, and you are swallowing it. It is known as body packer. Stuffing means you are stuffing that drug into some cavity, like a vagina, like an abdominal, like an anal cavity. These all cavities is body stuffer syndrome. So done. Next subject we are going to start, sir. It is your favorite. आजा तो प्यार जनरल फार्मा we will be discussing in a quick move. चल इसको बता दो थोड़ा.
चलो ठीक है. I'll do. You take break. भाई देखो जनरल फार्मा, you don't even have to see this. Just understand. First, what is dynamic is what the drug do, and kinetic is what kidney do. So what does the kidney do? Remove the drug. So remember, kinetic is removal of the drug in the body. That is the kidneys. Okay. So what the body do drug is kidney. Now उसमें क्या होता है? ADME. First the drug come, absorption is enter the blood. So drug come to blood, then via cardiovascular system it spread to the body, then it is metabolized by the liver, and finally kidney will break and remove the drug in urine. So that is called, and this is the story. Now comes the question. There are two routes of admission or administration. One is systemic route, it is entry into the blood, and local is not in blood. So local never reach the blood. Why? Because once it goes to blood, it reach each and every part. That's it. Now topical is surface. Any cream, ointment लगाते हैं ना अपने चेहरे पे, सब किसमें आता है? Topical. They all are topical. No more net is left. शगुफ्ता आप बाद में देखना बच्चा, एक बार आपका 12 बजे शायद नेट हो जाता है. ठीक है, अब क्या कर सकते हैं कि नहीं. तो अगेन इंपॉर्टेंट है, एजुकेशन के लिए थोड़ा बहुत तो सैक्रिफाइस करना ही पड़ेगा बच्चा. ठीक है. इज द वॉइस कमिंग? आई होप सो. आ जाओ. Now, what is the two routes of systemic? That is, you can either give it directly in the body, that is called as parenteral. That is called as the parenteral. And if the drug is given via GIT, it is called as enteral. So, what is enteral? GIT. And there are two routes in enteral. First is it can be oral and other is rectal. It is not anal. Oral or anal कुछ और है बच्चों. ठीक है, oral or anal. Okay, that is your unnatural sexual offense. Okay. This is your oral and rectal route, okay, and they go to liver and liver break, and this is called as bioavailability. It's the percentage of drug which reach systemic circulation after liver break it. So if a liver break 50%, how much drug will reach? 50%. This is called what? Bioavailability, okay. Now first question, if there's a very high first pass, there's a very low availability and it cannot reach. Now IV drug has the 100% bioavailability, okay. So 100% bioavailability is there. Done, okay. See, we are left with hardly 3 subjects, okay. Clear? So we are trying our level best. Micro all done in concise class, biochemistry done. Okay, anatomy Shrikant sir took. Okay, we'll take some part of patho because Devesh sir also took PSM also. So ऐसे हो चुका है ना सब कुछ. So वो आप high speed में देख लेना. We are doing the pharma which was pending. Okay, चलो. Now, what is the formula for volume of distribution? It is amount of drug by concentration. Remember, amount by concentration give you volume of distribution. Now remember, loading dose depends on VD. LD, VD, LD, VD. Remember LD, VD, LD, VD, LD, VD. And what about the maintenance? So if you want to maintain, you take clearance. So depends on clearance. So remember MC. You all know MC is what? MC means lots of things. It is most common. So maintenance depends on clearance. Maintenance depends on clearance. 100% exam question. Maintenance depends on clearance. Loading, loading VD. L V में जाएगा. L V में जाएगा. Loading V. So L V. L V. Love होता है ना? Love. L love. तो yeah, L V में जाएगा. Done, done or done. Now liver will break in two. So first phase 1 is break and phase 2 is join. So remember that is what you do. You break someone relation and start your own relation. है कि नहीं? तो किसी का तोड़ोगे तभी तो अपना जोड़ोगे रे. So that's why phase 1 is breaking, phase 2 is joining. What is phase 1? It is oxidation, reduction, cyclization and decyclization. ठीक है? तो उसका निमोनिक है कॉर्ड. तो पहले किसी की कॉर्ड काटो फिर अपनी जोड़ो. तो पहले काटो फिर जोड़ो. और जोड़ो किससे? जी, ग्लू से. तो 3 जी, ग्लूटाथाइन conjugation, glycine and glucuronide conjugation, also methylation. So remember these are the two. Now what are the enzyme inducer? Remember antibiotics are inhibitor and antiepileptics are inducers. Remember antiepileptics are what? They are enzyme inhibitor and antiepileptics are enzyme inducer. So antibiotic all except rifampicin. So except rifampicin all antibiotic can be said to be inhibitor and all antiepileptic except valproate is what? Enzyme inhibitor. So valproate is what? It is an enzyme inhibitor, but phenytoin, phenobarbital, carbamazepine, they are all enzyme inducer. And this is the case. Now what is prodrug? The drug which is inactive initially and then become active is called as what? It is called as the prodrug, like L-dopa, methyl-dopa. Then also remember your ACE inhibitors. ACE, except captopril, lisinopril. Mnemonic is captain, listen to me. क्या बोल रहे हो? एक कप्तान मेरी सुन ले. सही है. So captain, listen to me. So captopril, lisinopril. Captopril, they are which drug? They are your very one line summary. They are prodrug and also your steroid. SONS. Which SONS? Prednisone, cortisone. Prednisone, they are also prodrug. Okay. Plus also which are the prodrug? We also have the joint drug like allopurinol. Allo. तो आलू पूरी नहीं खा सकते. क्यों? घुटनों में दर्द है, बैठ नहीं सकते. तो कैसे खिलाते हैं आलू पूरी? जिमाते ना बैठा के नीचे. तो खा ही नहीं सकते आलू पूरी. तो गाउट में. So chronic gout, what is the drug of choice? Aloo puri, aloo puri. Now kidney remove, that is called as clearance. Now remember first what is the half life? What is the half life? So what is the half life? It is the time taken for drug to become 50%. So after one half life 50%, second half life 25%. So याद करना 100%, 50%, 25%, 12.5%. They ask you how much time will take to become 50%? That is called as T half. Okay. Now comes the question. There are two order. Zero order first. Just remember, if constant amount is removed, amount, that is called as zero order. If percentage is removed, that is first order. Most drugs are first order. Most drugs are first. Rest all are zero. So what are the zero order? Remember, alcohol पी. गोवा गए आप एग्जाम पास करके and in Goa you drink Fanny alcohol. क्या पिया आपने? Fanny. Fanny alcohol पिया और उसके बाद में लड़ाई करी. सबको मारा पीटा. ओके. और क्या किया? तोड़ दिया, फोड़ दिया. तोलबुतामाइड, थियोफाइलिन फेंक दिया. तोड़ा, फेंका और फिर सर में दर्द हुआ सुबह तो एस्पिरिन ले ली. डन है. सो अल्कोहल पी कहां? गोवा में कौन सी दारू मिलती है पारस? फेनीटॉइन. अल्कोहल पी और फिर आपने लड़ाई करी. दारू पी के. भाई क्या लड़ाई करी बंदे ने, क्या भागा है मारने के लिए. तो फेनीटॉइन, वारफेरिन और फिर थियोफाइलिन बुटामाइड. थियोफाइलिन बुटामाइड. ये जीरो वर्ड पावर की जरूरत नहीं भाई, सारी ड्रग पी वाली हैं. अब इसमें वर्ड में टी है, टी से 100 ड्रग्स हैं. आपको क्या याद रहेगा बच्चा एग्जाम में? ये याद करो. तोड़ा फोड़ा. चलो फार्माकोडायनामिक याद कर लो. रिसेप्टर, नॉन रिसेप्टर. इसमें आता है एंटासिड, प्लेसिबो, नोसिबो. क्या होता है? एनीवन? व्हाट इज नोसिबो इफेक्ट? व्हाट इज नोसिबो इफेक्ट? एनीवन? नोसिबो. टेल मी व्हाट इज नोसिबो? क्या है हमारा नोसिबो इफेक्ट? टेल मी व्हाट इज नोसिबो. एनीवन? बार कहां से आ जाते हैं?
आने तो इनको भी धंधा सबको करना चाहिए.
नहीं अभी हम कर रहे हैं. हमारे टाइम पे
सबका चलना चाहिए भाई.
हाँ सही बात है. क्या
ये भी तो बेचारे
क्या? हाँ कोई भी धंधा छोटा नहीं होता और धंधे से बड़ा कोई धर्म नहीं होता. तो ये भी धंधा कर रहे हैं. ठीक है. वेरी गुड. अलाउ कर, yes, negative effect is nocebo effect. So negative effect is our nocebo effect. Are you clear? So what is the negative effect? Nocebo. चल हट यहाँ से, भगा दिया मैंने. So I've removed. चलो आगे चलते हैं. Now this curve याद करना, agonist is one with affinity and intrinsic action. Antagonist is नल्ला, याद करना नल्ला. ये प्यार तो करता है लेकिन एक्शन कुछ नहीं कर सकता, नल्ला है. क्यों? एक्शन नहीं है इसका, पर क्या किसी को करने भी नहीं देगा, ना करूंगा ना करने दूंगा, ना खाऊंगा ना खा दो. कुत्ता नहीं, तो कुत्ता क्या करता है, घास पे बैठ जाता है. गाय भैंस को नहीं खाना भाई, कुत्ते तो नल्ला. ओके, दिस कॉल इज नल्ला. ओके, नल्ला. ओके, चलो ड्रग रिस्पॉन्स का याद कर लो, वेरी सिंपल. अगर ऊपर गया फ्लाई अप, अप फ्लाई अप मतलब एफिकेसी, ऊपर गया तो एफिकेसी, और पलट गया, एल से क्या आती है, पावर. एल है पावर के लिए, एल मतलब लव ना, लव से पावर आती है. एल इज पोटेंसी मतलब लेफ्ट शिफ्ट. तो बस याद कर लो, लेफ्ट गया तो पोटेंट है, लेफ्ट गया तो पोटेंट, एंड फ्लाई अप ऊपर उड़ गया तो एफिकेसी है, ऊपर उड़ गया तो एफिकेसी, ऊपर उड़ गया तो एफिकेसी. वेरी गुड. तो इन दिस ग्राफ बताओ भाई, which drug is most potent? A, B, C. Yes.
100% exam question.
Which is, yeah, negative effect is nocebo. बताओ भाई, A, B, C. Which is most potent? Most potent. कौन सबसे लेफ्ट में है? Most potent. A. Very good. A, फिर B, फिर C. And which is most efficacious? सबसे ऊपर कौन है efficacy में? सबसे ऊपर B. ये बिल्कुल सही आंसर दे रहे हो आप. B, उसके बाद C, फिर ए. वाह वाह वाह, बढ़िया बढ़िया बढ़िया. और फिर आ गया हमारा लीथल डोज इज द डोज विच कॉज डेथ 50% में, इफेक्टिव विच कॉज. रिमेंबर, सोशल डिस्टेंसिंग इज अ मस्ट. 2 गज की दूरी मास्क है जरूरी. इफ डिस्टेंस इज लेस इट इज अ प्रॉब्लम. सो दैट्स व्हाई बिग गैप बिटवीन एलडी एंड ईडी शो सेफ ड्रग, स्मॉल गैप इज डेंजर. तो क्या करना है, बिग गैप, सोशल डिस्टेंसिंग इज अ मस्ट, एंड दैट इज कॉल्ड एज द therapeutic index. LD by ED, bigger the therapeutic index, safer the drug, small the index, unsafe. तो याद क्या करोगे, LD by ED, LD by ED, LD by ED. Okay. Now, if high TI, safe. If small, very narrow, is unsafe. And it need therapeutic index. It need what? A therapeutic index, and we do drug monitoring. Like example, lithium, theophylline, digoxin. These drugs need what? They need the therapeutic, yes, monitoring index. Okay. Now कंप्यूटर में याद करना, 2 ग्राफ देंगे. इफ यू सी 2 ग्राफ, इट इज कंपटीशन बिटवीन 2 पीपल. 2 ग्राफ इज कंपटीशन, एक आगे एक पीछे, पर इनकी हाइट तो सेम है, तो वी मैक्स इज सेम. पर एक आगे पीछे तो किलोमीटर आगे, सो किलोमीटर इंक्रीज. सो रिमेंबर कंपटीशन. बट इन नॉन कंपटीटिव, लाइक एग्जांपल, हैव यू सीन दैट मूवी द डिक्टेटर? इसमें अलादीन क्या करता है, गन लेके शूट कर देता है, तो सामने वाला भाग ही नहीं सकता. तो इसमें क्या होगा, एक ही ग्राफ होता है, दूसरा ऐसे झुक जाता है. तो क्या कर दिया, आगे झुका के घोड़ी बना दिया उसे. ठीक है, तो क्या है, इफ यू सी अ ग्राफ बेंडिंग डाउनवर्ड, ये है नॉन कंपटीशन. कंपटीशन की इसने गेम बजा दी, नो कंपटीशन, नो कंपटीशन. सो व्हाट इज नो कंपटीशन? इट इज बेंडिंग फॉरवर्ड, इट इज बेंडिंग फॉरवर्ड. सो इफ यू सी अ ग्राफ विद 1 पोजीशन 2, सो दैट्स व्हाई केएम क्या है इसका, सेम है. सो केमैक्स इज सेम, केमैक्स इज सेम. तो याद करना, इन नॉन कंपटीशन द केमैक्स इज सेम, वीमैक्स डिक्रीज, डिक्रीज Vmax. ओके, डन डना डन. चल, एंड ये हो गया हमारा, हाँ, बड़ा शेड्यूल एच क्या है, ये आपको तभी मिलेगी जब आपके पास डॉक्टर का पर्चा हो. किसकी हामी चाहिए, हाँ चाहिए, हाँ. डॉक्टर ने बोला हाँ जी ले लो, हाँ, तभी मिलेगी. अगर डॉक्टर बोला ना तो नहीं मिलेगी. एंड ओवर द काउंटर ये आपको मिल जाता है. जैसे इमरजेंसी कॉन्ट्रासेप्शन, इज इट ओवर द काउंटर और परमिशन चाहिए डॉक्टर की?
ओवर द काउंटर.
एक्सपीरियंस बोलता है, एक्सपीरियंस. यही सुनना चाहता था मैं, यही बुलवाना चाहता. एक्सपीरियंस कितना है, वाह 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 वाह. तो दैट इज योर पेन किलर. ओके, चलो ला एएनएस कर.
I'll do quickly, let's do it. चलो जी, सर ने बढ़िया तड़का मार दिया हमारी जनरल फार्मा को. जी फार्मा बहुत प्यार से लिए सर ने. दोस्तों, let's continue our journey of success, and it is 8 hours now. We have started this live. This is gonna be huge record today. ठीक है. So, my dear friends, along with me, ANS, remember, parasympathetic, sympathetic, you all know. Parasympathetic, below the abdomen, everything will increase, and above the abdomen, everything will decrease. Sympathetic, below the abdomen, everything will decrease, and above the abdomen, everything will increase. Parasympathetic, below the abdomen, everything will increase means erection. Penis would be erect, and sympathetic ejaculation. किसको कौन कॉल कर रहा है भाई? ये कौन है भाई? कॉल कूल करने वाले के हैं? ठीक है दोस्तों. देन रिमेंबर, अल्फा बीटा किसके रिसेप्टर है? सिंपैथेटिक. किसके हैं? सिंपैथेटिक. M1 M2 किसके हैं? पैरासिम्पैथेटिक. जस्ट रिमेंबर द ड्रग. tertiary amines are lipid soluble, quaternary amines are water soluble. Quater किस में मिलाते हो? पानी में मिलाते हो, इसलिए quaternary amines are water soluble, sir. They all are water soluble. Guys, remember, tertiary amines are lipid soluble, they can cross blood brain barrier, and quaternary amines are water soluble. Now tertiary means the drug is physostigmine. It's used for the treatment of atropine poisoning. It's used for the treatment of atropine poisoning. ठीक है. Quaternary amine is water soluble. They do not cross blood brain barrier. Do not cross blood brain barrier. So treatment is Myasthenia gravis by increasing the acetylcholine level, pyridostigmine and neostigmine. Drug of choice for Myasthenia gravis would be pyridostigmine and neostigmine. Sir, Alzheimer's disease. कोई बात नहीं भाई, रसल वाइपर मेरे प्यारे भाई, चिंता नहीं करनी. Alzheimer's disease, your drug of choice will be donepezil. Alzheimer's disease, drug of choice, donepezil. Organophosphate poisoning, drug of choice will be atropine oxime plus Oxime. You will give Oxime. Sir, now selective M3 blockers with ipratropium, tiotropium. M3 is present everywhere. M3 is present everywhere. So broncho, it will be causing constriction. When I am blocking this, it will be producing what? Bronchodilation. Bronchodilation. Now, sir, peptic ulcer में you will use prinzapine, tilenzapine, prinzapine and tilenzapine. Let me take you to the systemic here it is very important. Drug of choice for anaphylactic shock would be your adrenaline. Drug of choice for anaphylactic shock would be your adrenaline. Drug of choice for shock with oliguria would be dopamine, and drug of choice for cardiogenic shock is dobutamine. It is your dobutamine. Drug of choice for shock with oliguria, dopamine. Drug of choice for shock, cardiogenic shock, it is dobutamine. And sir, drug of choice for neurogenic shock would be phenylephrine. Would be phenylephrine. Guys, remember. Then coming to your this orthostatic hypotension. Orthostatic hypotension, your drug of choice will be midodrine. Your drug of choice will be midodrine. Beta 2 agonist SABA and LABA, you already know. Then coming sir, beta 3 agonist. Overactive bladder का treatment, just remember, मीरा डरी और सो गई. मीरा डारी सोली, मीरा डारी सोली, मीरा डर के मारे सो गई. It is a treatment of overactive bladder. It is a treatment of overactive bladder. क्या होता है? मीरा हो गई मगन, ऐसी लागी लगन, वो तगली गली हरी गुन गाने लगी, महलों में रही बन के जोगन चली, वो तो गली गली हरी गुन गाने लगी. मीरा बैग्राम, मीरा डारी सोली, मीरा डारी सोली. एंटी एड्रेनर्जिक ड्रग की बात करेंगे. अल्फा ब्लॉकर, सिलेक्टिव अल्फा ब्लॉकर सर, मेनली अल्फा 1 जोसिन, पैरा 13 डॉक्सा. स्कॉर्पियन स्टिंग, ड्रग ऑफ चॉइस विल बी प्राजोसिन. इट इज योर प्राजोसिन. बीपीएच ड्रग ऑफ चॉइस इज फेनेस्टिराइड. इट इज फेनेस्टिराइड 5 अल्फा रिडक्टेज इनहिबिटर. बीपीएच प्लस हाइपरटेंशन वुड बी प्राजोसिन. So scorpion sting also, sir, the drug of choice is prazosin. BPH plus hypertension, drug of choice is prazosin. It is your prazosin. Prazosin. Guys, beta blocker. Beta blocker say what you have to remember. Just remember, beta blocker is all the low. All the lows are beta blockers. Drug of choice for dissecting aortic aneurysm, it is esmolol. Beta blocker toxicity, it is a glucagon. Longest acting beta blocker. कैसे याद करो? Longest acting beta blocker नंबा क्या होता है? लाड़ा. नाड़ा is always very long. तो longest acting beta blocker would be your nadolol. Would be your nadolol. So हरियाणा वाले क्या बोलेंगे? लाडो लाडो कह के मन बोरा बोरा खा गई, घर का खसियाड़ा छोरा पागल बना गई. लाडो लाडो कह के मन बोरा बोरा खा गई, घर का खसियाड़ा छोरा पागल बना गई. दोस्तों, ड्रग ऑफ चॉइस फॉर हाइपरटेंशन इज प्रेगनेंसी क्या है? ला बेटा लोल. क्या है, लाबेटालोल, 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 लाबेटालोल. Sir, kidney, if I talk about aldosterone, if there is an increase in भाई ये हैप्पीनेस जोन, मेरे मुंह पे क्यों मुरझाहट ला रहे हो, इट इज PARAS नॉट PARA, ये पराग दूध की डेयरी नहीं है जिसका नाम ले रहे हो. तो एल्डोस्टेरॉन कॉन सिंड्रोम, एल्डोस्टेरॉन क्या है, कॉन, एवरीथिंग इज ऑन, एल्डोस्टेरॉन कॉन सिंड्रोम, देयर इज इंक्रीज इन सोडियम, डिक्रीज इन पोटेशियम. सर रिमेंबर, एल्डोस्टेरॉन अगर कम हो जाएगा तो दिस इज एडिशन डिजीज, इट इज एन एडिशन डिजीज. Less sodium, more potassium. Now diuretic, if I talk about, sir, carbonic anhydrase inhibitor. Mechanism of action is sodium loss diuretic. Sodium loss and diuretic, and treatment is astazolamide. Sodium carbonic anhydrase inhibitor, astazolamide, dorzolamide, brinzolamide. Sir, astazolamide is a drug of choice for mountain sickness, plus it is a drug of choice for angle closure glaucoma. It is a drug of choice for angle closure glaucoma, angle closure glaucoma. Now sir, loop diuretic, loop lose everything. Mechanism of action is blocking the sodium potassium 2 chloride symport, sodium potassium 2 chloride symport, sir. And remember the treatment is furosemide, torsemide, bumetanide. I'll make it very simple for you. Torsemide टूर लगाने जाते हैं, लॉन्ग टूर पे, कहाँ पे जाते हैं, लॉन्ग टूर पे. इट इज अ लॉन्गेस्ट एक्टिंग. सर भूमि देश की बहुत जरूरी है, क्या होता है, मेरे देश की भूमि उगले हीरे मोती, मेरे देश की धरती, ओ bumetanide is most potent. Bumetanide is most potent. Then coming, sir, thiazide. Thiazide, they lose all iron except calcium. Sir, it is not contraindicated in renal failure, rather it is indicated in renal stone. It is indicated in renal stone. Why? Because other than calcium, it releases everything from the kidney, and you don't want more calcium in the kidney because already stone is present there. Sir, thiazide is that important for the calcium stone. It is given in the treatment of calcium stone. Sorry, renal stone. It is given. So, what is the drug, sir? Chlorothiazide, polythiazide, hydrochlorothiazide, indapamide, that is work in the renal failure, metolazone, chlorothalidone. Then coming, sir, motion sickness, it is hyoscine. ठीक है, nephrogenic diabetes insipidus, also the drug of choice would be thiazide. Sir, ENaC channels are blocked by amyloid, and aldosterone is blocked by spironolactone. And sir, remember, potassium sparing diuretics are both amyloid and spironolactone. Now sir, drug of choice for acute congestive glaucoma would be your mannitol. This is very important. ADH or vasopressin, this is important. If there is less ADH, mean this is a central problem, and central diabetes insipidus, the drug of choice would be your desmopressin, sir. Sir, if there is a ADH and there is a less receptor in the kidneys, that means now this problem is nephrogenic. And just now I have told you something, that nephrogenic diabetes insipidus, the drug of choice would be your thiazide. Sir, treatment of SIDH, syndrome of inappropriate ADH, the drug of choice would be Vaptane. कोनिटोलिमोजी, कौन से वैप्टेन है, कोनिटोलिमोजी. तो मोज लेते लेते पढ़ेंगे और साथ में क्या बोलेंगे, आई विल पास. अब की बार 200 पार, हम होंगे कामयाब एक दिन. मन में है विश्वास, हमें पूरा है विश्वास, हम होंगे कामयाब एक दिन. एक दिन कब है, 4 जून को. कब है, 4 जून को. डंडना 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 डा. CVS दोस्तों, नाइट्रेट ड्रग इज यूज्ड इन द एंजाइना एंड मायोकार्डियल इन्फेक्शन. Angina and the myocardial infection. Sir, how you have to remember the nitrate drugs? It is very important. Glycerin trinitrate, nitroglycerin, isosorbate mononitrate, isosorbate dinitrate. Then bro, amyl nitrate. amyl nitrate में नाइट्रेट ड्रग है, किसमें यूज होता है, साइनाइड पॉइजनिंग एंड कोकीन पॉइजन, साइनाइड एंड कोकीन के अंदर भी बीटा ब्लॉकर्स, ऑल बीटा ब्लॉकर्स आर यूज्ड इन क्लासिकल एंजाइना एंड दे आर कॉन्ट्राइंडिकेटेड इन वेरिएंट एंजाइना, दे आर कॉन्ट्राइंडिकेटेड इन वेरिएंट एंजाइना। कैल्शियम चैनल ब्लॉकर, कैल्शियम चैनल ब्लॉकर में क्या क्या आया, विरापा, वीरा तेरा दिल, दिल डूब गया, डिपिन, वीरा, diltiazem and dipin, verapamil, diltiazem and dipin. Now dipins you have to study in the brief, sir. Nimilodipin, सबसे पहले क्या बोलता है वो, nimilodipin. Nimilodipin is used for the treatment of subarachnoid hemorrhage. It is used for the treatment of subarachnoid hemorrhage. Then sir it is coming your nifedipine, clavidipine of nodules. फिर बोलता है amilodipine, क्या बोलता है, amilodipine. वो फिर उसने पूछा क्यों मिलो, मिलो क्यों मिलो, उसने बोला नी कार डिपिन, और लेके मेरी गाड़ी गाड़ी कार डार्लिंग, आओ तेरे घर के मैं बाहर डार्लिंग। या फिर क्या बोलोगे, वो मैं निकला वो गड्डी लेके और रस्ते पे एक मोड़ आया, उते दिल छोड़ आया, मिलो डिपिन, क्यों मिलो निकार डिपिन, डंडना डन, डिंग 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 डिंग। चलो, newer drug for the treatment of angina, sir, it is your rho kinase inhibitor, that is fosadil. कैसा है, दिल फ्रेंड जोन हो गया, फोसादिल, क्या है, फोसादिल। ऑल माय डियर फ्रेंड्स एंड बेस्ट फ्रेंड्स ओवर देयर ऑन द चैट, एक्टिव, जल्दी से जग जाओ। पीफॉक्स इनहिबिटर कौन है, ट्राइमेटाजिडिन, क्या है, ट्राइमेटाजिडिन। सर वेरी सिंपल एग्जाम क्वेश्चन कमिंग राइट नाउ ऑन द 4th of June. Non-ST elevated myocardial infection would be mona, morphine, oxygen, nitrate, aspirin. Now sir, ST elevated myocardial infection, S mona, it is sweet mona. It is sweet mona. Guys, remember mona is sweet. So guys, remember S for streptokinase, M for morphine, O for oxygen, N for nitrate, A for aspirin, clopidogrel. Dandana, 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 duh. Now, sir, antihypertensive drug alpha-2 agonist clonidine methyldopa. Pheochromocytoma, the drug of choice would be phenoxybenzamine, but the treatment of choice is surgery. Pheochromocytoma, sir, your drug of choice would be phenoxybenzamine, and also you can give phentolamine, but phentolamine is basically given for the treatment of cheese reaction. दादी जी को अत्यंत प्यार, उनके चरणों में स्पष्ट, पूजा जी की दादी को चरणों में स्पष्ट, उनको बोलना मुझे आशीर्वाद दे ताकि मैं इसी तरीके से चैटिंग कराता रहूं, गला बुलंद रहे, हमेशा बड़ों का आशीर्वाद सर पे रहे, बोलो दादी जी की जय। चलो, बीटा ब्लॉकर में क्या दोगे, लोल। उसके बाद रेनिन इनहिबिटर दोगे। एंटी हाइपरटेंसिव ड्रग में क्या दोगे, रेनिन इनहिबिटर, क्या दोगे, रेनिन इनहिबिटर। किरण, क्या है, तू है मेरी किरण, एक गाना ना शाहरुख खान का, रेनिन रेनिन किरण किरण किरण, एलिस किरण, एनाली किरण, एरिस किरण, आली किरण, Alice Kiran, Inali Kiran, ACs and nerves, comprils and sartan, A sartan, low sartan, do sartan, jao sartan, pills, captopril, lisinopril, dun, lansopril, ठीक है। डायरेटिक के अंदर लूप डायरेटिक्स देने हैं। नाइट्रेस में यू कैन हाइड्राजिन, नाइट्रोप्रोसाइड, ठीक है। चलो, डन। सीसीबीज में क्या था, टिपोडिपिन, निकार्डिपिन सब दे दो, पोटेशियम हाइड्रोलाजिन दे दो। कंजेस्टिव हार्ट फेलियर, सर यू हैव टू गिव द आइनोट्रोपिक एजेंट, ताकि वो हार्ट को क्या सके, दबा सके, हार्ट को क्या कर सके, दबा सके, क्या करें, दबा सके। डोबूटामीन, ड्रग ऑफ चॉइस फॉर कार्डियोजेनिक शॉक। Dopamine is a drug of choice for shock with oliguria and also isoprenaline. PD6 inhibitor which can be given acute congestive heart failure, sir, it will be your PD6 inhibitor, क्या है, milrinone, amrinone, sir, digitalis is very important, digitalis। एक होता है डिजॉक्सिन, एक होता है डिजिटॉक्सिन। सर हु इज डूइंग डिटॉक्स इन द बॉडी, दैट इज नन अदर देन योर लीवर। सो डिजिटॉक्सिन इज नॉट गिवन इन लिवर डिजीज एंड डिजॉक्सिन इज नॉट गिवन इन किडनी डिजीज। सर निमोनिक फॉर द मैनेजमेंट ऑफ डिजिटालिक टॉक्सिसिटी वुड बी योर डाल के। निमोनिक क्या है, डाल के, DALK, कैसे करके, डाल के, मैनेजमेंट डिजिटालिक टॉक्सिसिटी इज डाल के क्या है, डिजिबिंड, atropine, lignocaine, potassium supplements, dun. Sir, treatment of chronic congestive heart failure, nitrate, hydralazine, ACs and nitrate, hydralazine, ACs and sir, beta blocker, कार्डिबिलोल, मेटाप्रोलोल, बिस्प्रोलोल, कार्डी मेटा बिस्प्रोलोल, डंडना 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 डन. Single wagon classification of antiarrhythmic drug is very important. Class 1 is sodium channel blocker, class 2 is beta blocker, class 3 is potassium channel blocker, class 4 is verapamil and diltiazem, and class 5 is miscellaneous. Verapamil diltiazem is a calcium channel blocker. How you have to remember? Alphabet B is at second number, that is why class 2 is beta blocker. Potassium का K कैसे बना? 1 2 3. तो third classification, third is a potassium channel. C से क्या है? Calcium. C से क्या है? Calcium. और C से क्या है? 4. तो कहता है जीने के है 4 दिन, ओ बाकी है बेकार दिन, ओ आया है जाए जाए एक बार जो आए, जवानी फिर ना जाए, ओ जवानी फिर ना जाए. क्या बात है क्या बात है, क्या बात है, क्या बात है. क्लास 1A क्विनिडीन prokenamide, quinidine and prokenamide, quinidine and prokenamide. Class 1B is lignocaine and phenytoin, lignocaine and phenytoin, lignocaine, phenytoin, lignocaine and phenytoin. ठीक है. Class 1B is लगे रहो phenytoin. ठीक है. Class C is flecainide. Flecainide is a drug of choice for WPW syndrome. It is a drug of choice for WPW syndrome. WPW syndrome. Dandana, 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 dun. Class 3 is a potassium channel blocker, that is amiodarone. Amiodarone is a drug of choice for ventricular arrhythmia, ventricular fibrillation. ये जो बिन बुलाए मेहमान आते हैं, डिमांडिंग बन जाते हैं, है ना, जैसे इनको यहाँ बुलाया हो, एक फुर्सत लगेगी अभी 1 सेकंड ग्रुप से और सब चीजों से निकालने में, है ना. और दोस्तों इनके लिए एक बात है, उन्हें क्या, मुझसे नफरत करने वाले भी कमाल का हुनर रखते हैं, मुझसे नफरत करने वाले भी कमाल का हुनर रखते हैं, मुझे देखना भी नहीं चाहते और नजर भी मुझे पे रखते हैं. भागो यहां से. चलो उसके बाद है पोटेशियम चैनल ओपनर. पोटेशियम चैनल ओपनर इज योर amiodarone. इट इज योर amiodarone, ड्रग ऑफ चॉइस फॉर वेंट्रिकुलर टैकीकार्डिया एंड वेंट्रिकुलर फिब्रिलेशन. Class 4 is calcium channel blocker, and calcium channel blocker is a drug of choice for PSVT prophylaxis and PSVT bronchial asthma. It is bronchial asthma. It is bronchial asthma. Dandana, dandana, dun. Then sir, class 5, digoxin, atrial flutter. It is drug of choice for atrial flutter, but sorry, it is given in atrial flutter, but the drug of choice is dophytilide. Dophytilide. Dandana, 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 dun. Then sir, coming atropine is a drug of choice for AV block bradycardia. Atropine is a drug of choice for AV block bradycardia. Adenosine is a drug of choice for PSVT. Adenosine is a drug of choice for PSVT. Sir, side effect is bronchospasm, and if a person is a, ठीक है, if person is already asthmatic, in those cases you will not give adenosine. Why? Because side effect is bronchospasm. And if asthma is there, you will give another drug, that is your verapamil. That is your verapamil. So PSVT, your drug of choice would be adenosine. For PSVT asthma patient, it is your verapamil. It is your verapamil. Verapamil. ठीक है. Verapamil, 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 verapamil. Then sir, atrial fibrillation, amiodarone. क्या दोगे? Amiodarone. But drug of choice would be ebutilide. Atrial fibrillation में main treatment of choice, if someone is asking you, that is your cardioversion. In chemical cardioversion, your drug of choice is ebutilide. Sir, mechanism of action or digoxin induced, sorry, myocardial infarction or digoxin induced ventricular arrhythmia, it is lignocaine. It is your lignocaine. And drug of choice for ventricular tachycardia and ventricular fibrillation would be amiodarone. टॉर्सिडिस और क्यूटीसी बढ़ जाए तो क्या देना है? मैग्नीशियम. क्या देना है? मैग्नीशियम. मैग्नीशियम, मैग्नीशियम. नाउ सर, सीएनएस के लिए क्या ड्रग याद करने तुम्हें? पार्किंसंस के ड्रग याद कर लो. अमन लब बेंजकार रोलिंग ग्लाइडिंग नॉट पाथ. अमन लब Benz car, rolling, gliding down. Aman is amantadine, love is levodopa, benzene is benzhexol, benztropine, car is carbidopa, rolling is ropinirole, pramipexole, gliding is Gillig, and not Parkinson, entacapone. So drug of choice in drug-induced Parkinsonism would be your benzhexol, benztropine, but in normal Parkinson disease, your drug of choice would be ropinirole. Drug of choice would be ropinirole. Okay? Ropinirole. Sir, anti-epileptic, if I ask you, you have to remember a sodium valproate. Sir, it is a first and second line drug for all epilepsy. First line and second line drug for all epilepsy and drug of choice for tonic-clonic seizure. Now, sir, in the case of absence seizure, more than 2 years, drug of choice would be valproate. Drug of choice would be valproate, and less than 2 years, the drug of choice will be ethosuximide. Absence seizure, more than 2 year, drug of choice would be valproate, and less than 2 year, the drug of choice would be ethosuximide, sir. Sir, lamotrigine is a drug of choice for focal seizure in pregnancy. It is drug of choice focal seizure in pregnancy. Now, you have to remember something, tardive dyskinesia. Abnormal movement like this will happen in tardive dyskinesia, sir. Treatment is VMAT2 blocker. The treatment is VMAT2 blocker, valbanazine, tetrabenazine, tardive dyskinesia, VMAT2 blockers, valbanazine and tetrabenazine, दोबारा आ चुके हैं यहाँ पे मेहनती लोग ये देखो मेहनत वाले लोग है ना, कुछ HD फन दे रहे हैं, ये बेचारे क्यूट लोग हैं, बार बार आ जाते हैं यार Then, sir, coming malignant neuroleptic syndrome. Malignant neuroleptic syndrome is your malignant hyperthermia. Drug of choice is dantrolene sodium. Drug of choice is dantrolene sodium. Guest is here, guys. Then, sir, lithium is a drug of choice for depression, both unipolar, bipolar, and also mania. Now, sir, anti-cancer drug, if I ask you, cyclophosphamide is a drug of choice for Wegener's granulomatosis. Nitrosourea is used for brain tumor. Carmustine, lomustine, semimustine. कैसे लो कार में? Carmustine, lomustine, semimustine. Carmustine, lomustine and semimustine. Carmustine, lomustine, semimustine. Bhusulfan, treatment of myeloid leukemia. Bhusulfan, treatment of myeloid leukemia. Procar, Dakar, it is Hodgkin's lymphoma. Procar, Dakar, Hodgkin's lymphoma. Temozolomide, drug of choice for Glioblastoma is temozolomide. It is temozolomide. Now, sir, Melphan. It is a treatment for multiple myeloma. Melphan, multiple myeloma. Oxyplatin is used for colorectal cancer. क्या colorectal cancer? Colorectal cancer. और कौन सी regime है? Folfox regime, sir. Cisplatin is used everywhere. Cisplatin is used everywhere. Now, sir, vomiting in cancer patient. If vomiting is happening after the chemotherapy, vomiting is happening within the 24 hours, that is ondansetron you have to give. If it is happening after 24 hours, that it will be pitant, niti rola, pitant. Sir, drug of choice for methotrexate toxicity would be folinic acid, would be your folinic acid, ठीक है? चलो भाई, उसके बाद क्या है? क्लैड्रीबिन इज अ ड्रग ऑफ चॉइस फॉर हेरी सेल ल्यूकीमिया. फ्लूड्राबिन इज अ ड्रग ऑफ चॉइस फॉर CLL. विनक्रिस्टिन इमोनिक इज CNW. कार्टून नेटवर्क, चाइल्डहुड ट्यूमर, विल्स ट्यूनर एंड नॉन हॉजकिंस लिम्फोमा. सर, विनब्लास्टिन इज यूज्ड फॉर द हॉजकिंस लिम्फोमा. विनब्लास्टिन इज एरिबुलिन. ये देखो ब्रेस्ट कैंसर का कैसे याद रहूंगा. देखो बुई मैंने मिल्क, वो क्या बोलता है? एरी. देर क्या है? एरीबुलिन, इच्छा अभी पी लूं. तो कैसे बोलोगे? एरीबुलिन, इच्छा अभी पी लूं. एरीबुलिन, इच्छा अभी पी लूं. क्या पी लूं? मिल्क पी लूं. तो इट्स अ ट्रीटमेंट फॉर ब्रेस्ट कैंसर. इट इज अ ट्रीटमेंट फॉर ब्रेस्ट कैंसर. एरीबुलिन, इच्छा अभी पी लूं, ब्रेस्ट कैंसर. फिर एस्ट्रा, प्रोस्टेट कैंसर. Astramustin, prostate cancer. Astramustin, Prostate cancer. Target anti-cancer therapy. Imatinib, drug of choice for CML. CML में what is happening, sir? There is a CML, there is a Philadelphia chromosome 9 and 22. This is a balanced translocation which will further activate a hybrid proto-oncogene, which will further activate 210 P210, and it will lead to cancer. To inhibit P210, we are using imatinib. Now sir, sorafenib is a drug of choice for hepatocellular carcinoma. Sir, lungs are present in rib cage. Lungs are present in rib cage, and remember, lung cancer anti-cancer therapy target therapy would be your cage. C for serotinib, A for afatinib, G for genitinib and erlotinib. तो cage में क्या tinib क्या है? tinib, serotinib, afatinib, gelatinib and erlotinib. Lung cancer. Now sir, renal cancer, what is the mnemonic? Pass. I will pass. Pazopanib, axitinib, tanib, sorafenib, sunitinib. Imatinib is a drug of choice for GIST. Vandetanib, medullary thyroid tumor. उसके बाद क्या है तुम्हारा? respiratory drug. See, cough is of two types, nose sputum and sputum. Cough is of two types, sputum and nose sputum. Guys, remember, if no sputum is present, you will state with the codeine, falcodine, dextromethorphan and noscapine. Dextromethorphan and noscapine. Sir, sputum एक्सपेक्टोरेंट मतलब हिला के गिराता है स्पूटम को ये, तो याद रखना गुआफेनासिन एंड पोटेशियम आयोडाइड. म्यूकोलिटिक में ब्रो क्या है? प्रो. एम्ब्रक्सोल, ब्रूमेक्सिन, एसिटिल सिस्टीन. सर, ब्रोंकियल आस्मा ट्रीटमेंट नंबर 1, एल्टी रिसेप्टर एंटागोनिस्ट. प्रीवियस ईयर क्वेश्चन, मॉन्टी एंड जाफरी लुकास. लॉक्स ओओओ ज़ाइल्यूटॉन. क्या है? ज़ाइल्यूटॉन. सर, बीटा ब्लॉकर, बीटा 2 एगोनिस्ट, साबा लाबा. शॉर्ट एक्टिंग एंड लॉन्ग एक्टिंग. शॉर्ट एक्टिंग में बूटा is a small, it is by small. Buta is small. Saba, salbutamol, terbutaline. Laba is salmetrol, formetrol. Now, fastest acting, if someone asks you, are formetrol. If longest acting, they will ask you, that is formetrol. Sir, M3 blockers, it is anticholinergic. The selective M3 blockers, already we have discussed. This is tiotropium, ipratropium. M3 blockers will produce a bronchodilation. It is used for the treatment COPD and status asthmaticus. Sir, only corticosteroid which is given by the IV route, that is your hydrocortisone. Now, sir, drug acting on GIT, peptic ulcer disease, M1 blocker, zip लगा देते हैं. क्या लगाने? Zip. Pirenzapine, and Trenzapine. H2 blocker, Renti, Fomenti. Then proton pump inhibitor, you all know already, omeprazole, pantaprazole, rabiprazole. Guys, these proton pump inhibitor are drug of choice for peptic ulcer disease, GERD, NSAID-induced ulcer and Zolliger-Ellison syndrome. What is Zolliger-Ellison syndrome, sir? Upar aag. There is an increased HCl secretion in GIT and there is diarrhea. Upar aag, niche pani. Now, sir, ulcer protective agent sucralfate is also there, but you will never give PPIs along with the ulcer protective agent like sucralfate. Now, sir, H. pylori, if it is present, you will initially treat with the triple therapy, and the mnemonic is CAP, clarithromycin, amoxicillin and PPIs for 14 days. If still it is not treated, you will go for the eradication therapy. Sir. Now, sir, drug of choice for motion sickness would be maclizine. Now, sir, it is hyoscine. Drug of choice for motion sickness would be your hyoscine. It is your hyoscine. It is your hyoscine. But if someone asking the longest acting, then your answer is meclizine. Longest acting is meclizine, but drug of choice for motion sickness would be hyoscine. Mountain sickness would be acetazolamide, and morning sickness it will be your doxylamide. Now, sir, remember something known as ulcerative colitis. Drug of choice will be sulfasalazine, osalazine, sulfasalazine, osalazine, sulfasalazine, osalazine. Now, Crohn's disease treatment is scam. Mnemonic is scam, steroid, sartolizumab, adalimumab, methotrexate. Sartolizumab क्या क्या है? एस से स्टीरॉइड, सी से सार्टालिजुमैब, ए से एडालिजुमैब, एन से मेथोट्रेक्सेट, एम से क्या है? मेथोट्रेक्सेट. सर कॉन्स्टिपेशन treatment is laxative and osmotic purgative. Just remember two names, that is lactulose and magnesium sulfide. Stool softener, just two names, diacetyl sodium and sulfosuccinate. Diacetyl sodium and sulfosuccinate, sir. Stimulant में who all are there? Castor oil, Sina, Cascara and Bisacodil. Castor oil, Sina, Cascara and Bisacodil. Dandana, 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 done. Now, sir, acute gout treatment is NSAID and corticosteroid. In NSAID, what will you give in the acute gout? It will be your endomethacin and diclofenac. Chronic gout, you will giving a prophylaxis, that is your xanthine oxidase inhibitor, and drug of choice would be allopurinol. You will give allopurinol. Chronic gout, the drug of choice is allopurinol. Acute gout, the drug of choice is NSAIDs and corticosteroid. In NSAID also diclofenac and indomethacin. Indomethacin. Dandana, 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 done. Then, sir, we are done with the pharmacology. Let's start another thing, and that is your quickest PSM. Let's start with another thing, that is your quickest PSM, sir. Number one thing is your protein. Sir, highest quality is present in egg. Sunday ho ya Monday रोज खाओ अंडे. Highest quality is present in soybean. Then, sir, important thing, vitamin A source is halibut fish liver oil. Overall, ठीक है, and also vegetable, that is carrot. Vegetable source is carrot and halibut fish oil. It's overall most common and non-vegetarian most common source. ठीक है, चलो उसके बाद क्या है दोस्तों? उसके बाद क्या आया तुम्हारा? एनर्जी रिक्वायरमेंट. सर एनर्जी रिक्वायरमेंट इन फीमेल देयर आर थ्री टाइप ऑफ लाइफस्टाइल: sedentary, moderate, heavy. Sedentary, moderate, heavy. 1700, 2100, 27. 1700, 2100, 2700. Sir, sedentary, moderate and heavy. 1700, 2100, 2700. And male में 21, 27, 35. 21, 37, 35. Done. Guys, remember additional energy requirement in the pregnant woman would be plus 350, but the lactating woman from 0 to 6 months it is 600, 6 to 12 months it is plus 520. This is plus 520. 100% question on 4th of June. Pregnancy 350, lactation 0 to 6 months 600, 6 to 12 months it is 520. Sir, folic acid, see, man and woman, how many people are they in total? 2 people. So that is why 200. That is why 200. ठीक है, man and woman are 2 people. That is why 200. Now men and women, they are lactate. Man and woman, now woman is lactating. That is why remember three things are there. Man भी होगा, woman भी होगी, उनका बच्चा भी होगा. 3 things are there. That is why lactation it is 300. Pregnancy, P for pregnancy, P for 5, it is 500. Now, sir, man and woman, all calcium requirement would be 1000. Now iron. Guys, remember woman it is 1.6, man it is 0.8. ठीक है, man it is 0.8, woman it is 1.6. It is very famous saying that a man is a better half of a woman. Sir, it is 0.8, 1.6. Pregnancy it is 2.8. Lactation it is 1.6. Sir, then coming to the zinc requirement, that is 10 to 12 mg per TL. Guys, remember zinc requirement. Zinc deficiency will lead to a disease known as acute dermatitis enteropathica. Sir, fluorine is the most common sources drinking water. Optimum intake is 0.5 to 0.8. Now, so dental caries will start if it is less than 0.5. Dental fluorosis will start if it is more than 0.8. It is more than 0.8. Okay? Done. Now, sir, for the defluoridation of water, we are using a MCQ technique, that is your Nalgonda technique. Water disinfection, what is the best method, sir? It is with boiling, and second best is your chlorine. Chlorine की बात कर लेते हैं. Drinking water chlorine level should be 0.5 to 0.7. Swimming pool it should be 1. During the flood, the chlorine in the water should be your 0.8. Sir, free chlorine level can be estimated by chloroscope. Orthotolerant test, it gives you free and combined chlorine. Now, better modification of orthotolerant is OTA. This is orthotolerant arsenide test. Guys, it is giving you combined total chlorine plus residual chlorine. Total chlorine plus residual chlorine. So OTA is better than OT. OTA is better than OT. OTA is better than OT. Now, sir, chlorine demand can be estimated by Horrocks apparatus. It is one Horrocks apparatus. Horrocks apparatus. Drinking water quality in India. Hardness less than 100 to 300, pH 6.5 to 8.5, fluorides less than 1. Sir, air के लिए क्या था? चली चली फिर चली FM जिसकी हवा चली.
हवा में काई बुलाते हैं, काई से काटा.
नो एयर वेलोसिटी. क्या बोला? काटा लगा हाय लगा आजा राजा बंगले के पीछे तेरी बैरी के नीचे. Hygrometer, it is here humidity. H for hygro, it is for haha. H for humidity. Now, sir, indicator of air pollution, soiling index. जब हवा चलती है मिट्टी भी पड़ती है साथ में, तो soiling index. Overall best pollution indicator is sulfur dioxide. दिल्ली में कितना pollution है, we will tell you sulfur dioxide. उसके बाद sir housing standard, जो कि गौतम नगर में हमारे बिल्कुल नहीं है. Floor space per person should be more than 50 to 100, but गौतम नगर में it is only 5 to 10.
Yes.
It is 5 to 10.
People stay in this size room. 10 by 10 के room में.
And why it is so? Why? Because they people actually constructed these kind of houses to make people close to each other, so that they can FMGs can stay close to each other. Small room, more love, more interaction with each other.
I heard in China and other countries,
yes,
and other hostel,
10 people.
There are room there. So like there'll be one room with 2 girls and other room with 2 boys. So they will be allocated.
Yes.
And then there is a exchange system.
Yes.
So they exchange.
That's very true. Yes, sir. Okay. I can guarantee.
It's a good scheme.
Okay, that is very good scheme. Indian student also.
Parents also happy, kids happy,
everyone is happy.
कितने तेजस्वी लोग हैं.
तेजस्वी नहीं है और तेजस्वी है. दो हैं. तेजस्विनी भी है, तेजस्वी भी है. Sir, cubic space per person should be more than 500 cubes. More than 500 feet cubes. Guys, remember door and window area should be 40% of floor area, but Gautam Nagar
no windows.
See,
it is also no window.
It is intentionally made like that so that other people should not know what is happening in the room. Why? As it is पूरी तैयारी के साथ है भाई. They know FMGs are coming from abroad. They are broad-minded medicos. They are broad-minded medicos. Remember radiation. The thickness of lead apron is more than 0.5 and total natural radiation received is 0.1. Now, sir, maximum permissible radiation exposure man it is 5, pregnancy 0.5. Sewage, biological oxygen demand and chemical oxygen demand. Who is best? Biological oxygen demand. Vectors and disease very important. Anopheles it is malaria. Aedes it is your Zika virus, yellow fever, chikungunya, Rift Valley fever and dengue. कैसे याद करो? Zika, जायकेदार येलो चिकन कहाँ बैठ के खाया? रिफ्ट वैली में. क्या हो गया? डेंगू. क्यूलेक्स के लिए याद करो, जापान वालों ने बेस्ट वाली की फाइलेरिया से जापानीज वेस्ट नाइल फीवर.
ये काइस वाला मैं बाद में बता दूंगा.
डंडना
जब आएगा विल एक्सप्लेन.
हाँ, जब टाइम आएगा. ठीक है. हवस का पुजारी.
कैसे वेरी
सैंड फ्लाई का निमोनिक है कोसो, काला आजार, ओरिएंटल सोर, सैंड फ्लाई फीवर, ओराया फीवर. से फ्लाई क्या है? स्लीपिंग सिकनेस.
सो जाओ।
Sleeping sickness, black fly, onchocerciasis, soft people are cute people, that is why Q fever, hard tick, KFD tick, typhus, mite, scrub typhus, rickettsial power, louse, epidemic typhus, rat flea, bubonic plague, endemic typhus, red epidemic, Chagas disease, and itch mite, it is scabies. Itch mite, it is scabies. Itch mite, it is scabies. Dandana, 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 done. चलो, ये मच्छर है एनोफ्लिस, that causes malaria. ये मच्छर है
अच्छा, इसमें एक बात सुन लो भाई।
एनोटिक।
हाँ, पर अगर इसने एनो नीचे कर ली,
हाँ,
मतलब ये नहीं एनोफ्लिस नहीं है। उस दिन बच्चे झगड़ रहे हैं, कह रहे ये तो हो ही नहीं सकता। ये मतलब ये क्या मतलब? मतलब ये क्या मतलब?
हाय 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 दोस्तों, उसके बाद दिस इज टाइगर मॉस्किटो, इट इज causes dengue, it is aedes which causes dengue, this is culex which causes Japanese encephalitis, West Nile fever, and filariasis. Then coming sir, best control for a measure, that is source reduction. How you will control the disease like malaria, dengue? Their best is your source reduction, and mosquito net size is 0.0475. 0.0475. Dandana, 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 dun. Sir, healthcare in India, primary, secondary, and tertiary. Primary level, PHC and subcenter. PHC and subcenter. Guys, remember, it is the first place where the community and the healthcare system of the country is interacting with each other, and the name is PHC. 5,000, sorry, subcenter is 5,000, 3,000. ठीक है? Guys, remember, secondary level it is CHC. Here surgeons are present. So first referral unit would be CHC. Second would be your district hospital or medical college, and top of them there is a AIMS. There is a AIMS. Now, आओ नीचे आओ, आ जाओ भाई। कहाँ चले गया?
टाइम
देखो, एलिमेंट्स ऑफ प्राइमरी हेल्थ केयर, निमोनिक वॉस एलिमेंट, पिलर्स ऑफ प्राइमरी हेल्थ केयर, इट इज वेरी इंपॉर्टेंट। क्या बोलता है? कद्दू कटेगा तो सब में बटेगा, कद्दू कटेगा तो सब में बटेगा। इक्विटेबल, जो कद्दू नहीं खाता वो भाई फिर जाए यहाँ से। इक्विटेबल डिस्ट्रीब्यूशन, एप्रोप्रिएट टेक्नोलॉजी, कम्युनिटी पार्टिसिपेशन, इंट्रासेक्टोरल कोऑर्डिनेशन। आशा
100% एग्जाम क्वेश्चन।
आशा 1/1000 अभी है, फ्यूचर में कितनी चाहिए? कितनी चाहिए फ्यूचर में? इट इज 2/1000। 10th पास होनी चाहिए और फीमेल होनी चाहिए,
और लोकल रेजिडेंट ऑफ द विलेज।
यस, शी शुड बी
कहीं और से ना बुलाओ।
यस,
अपनी आशा होनी चाहिए।
अपनी आशा होनी चाहिए, किसी और जगह से नहीं बुला। बस आशा, आशा सपनों की। सब सेंटर इट इज 1/5000, हिली 1/3000, PHC 30,000, 20,000, CSC 1,20,000, 80,000, UHC अर्बन हेल्थ केयर से बेहतर। नाउ आशा एक होती है, मल्टीपर्पस वर्कर एक पर 5,000 होता है। मल्टीपर्पस वर्कर्स कॉन्सेप्ट वाज गिवन बाय Kartar Singh committee. Now sir, one doctor is having 1,000 population, and one doctor is having 3 nurses. So after passing the FMG exam, they will be getting the 3 nurses, and nurse can be male also, nurse can be female. इसलिए दोनों को मजे आ सकते हैं।
फिर से आ गया, देखो
कोई बात नहीं सर, इनको धंधा करने दो। Ophthalmologist it is 50,000 population, and one pharmacist it is 10,000 population. It is 10,000 population. Sir, one lab technician 10,000. Number of bed in PHC 4 to 6 bed. Number of bed in subcenter would be two types. One is A and one is B. A, it is no delivery, 0 bed. B, there are deliveries happening 1 to 2 bed. CHC is 30. MD, MS level, FSC level, CHC level. Dun. Now, sir, we have to do another subject, which is your anatomy.
Okay.
We are doing what? Anatomy.
Anatomy जो सर वाला है उसी का हर मेन पॉइंट करते हैं।
हाँ, मेन पॉइंट
है। Just do main point. ठीक है, and if you want to do, you can just see the PDF of sir. एनी टाइम। देखो,
चलो एनाटॉमी से पहले जनरल पैथोलॉजी खत्म करते हैं। जनरल पैथो खत्म करते हैं। चलो जनरल पैथो खत्म करते हैं फ्रेंड्स। जनरल पैथो, लेट्स डू जनरल पैथो। हाइपरट्रॉफी मींस इंक्रीज इन सेल साइज। ट्रॉफी बड़ी होनी चाहिए लाइफ में दोस्तों, तो हाइपरट्रॉफी इज इंक्रीज इन सेल साइज। हाइपरप्लेशिया इज मल्टीप्लिकेशन, दैट मींस इंक्रीज इन सेल नंबर। नाउ सर, एग्जांपल ऑफ हाइपरट्रॉफी वुड बी PPL, दैट इज प्यूबर्टी, प्रेगनेंसी, लैक्टेशन। प्यूबर्टी, प्रेगनेंसी, लैक्टेशन। नाउ सर, हाइपरप्लेशिया इट इज ओनली सीन इन PP, puberty and pregnancy. Metaplasia means change in phenotype. Metaplasia means change in phenotype, and best example would be columnar metaplasia. And in columnar metaplasia, you will see Barrett's esophagus, where the squamous cell is replaced by intestinal columnar cell. And hallmark of Barrett's esophagus would be your goblet cell, sir. And Barrett's esophagus will lead to adenocarcinoma. सर, कनेक्टिव टिश्यू के अंदर मायोसाइटिस ओसिफिकस। आई स्टिल रिमेंबर द ऑर्थोपेडिक्स चैंटिंग, द मोस्ट कॉमन मसल इन्वॉल्व वुड बी द ब्रेकियालिस। नाउ योर मसल इज कन्वर्टेड इनटू बोन, योर मसल इज कन्वर्टेड इनटू बोन। डंडना डंडना डन। ठीक है। Atrophy mean decrease in cell size, decrease in cell number. Now, sir, two type of cell injuries are there: reversible cell injury and irreversible cell injury. Remember, friends, reversible cell injury, the first cellular change is decrease in ATP. First cellular change is decrease in ATP, and the earliest ion involved is sodium. If sodium is involved, that means this is reversible injury. And first feature of cell injury would be cellular swelling, and only pycnosis is seen. In this, only pycnosis is seen. Now, irreversible cell injury, necrosis, apoptosis, all these are irreversible. Sir, in irreversible injury, which ion is involved? Someone asked you. It is your calcium. It is your calcium. And in necrosis, you will see all three. P, K, K. क्या है? P, K, K. Pycnosis, karyolexis, karyolysis. ठीक है?
अभी तो किया था ये.
वो ये अब बाद में देख रहा होगा ना, पुराना. ठीक है? Pycnosis, karyolexis and karyolysis. Large amorphous density is seen, and also myelin figure is seen. And sir, this is very important FMG exam question. Necrosis on DNA gel agar electrophoresis, we see, sir, smearing pattern. We see, sir, smearing pattern. And in apoptosis, we see step ladder pattern. We see step ladder pattern. Now, sir, type of necrosis. Number one type is coagulative necrosis. We see what is dry gangrene. We see what, sir? Dry gangrene. Next coming, sir, liquefactive necrosis. It is mostly seen in the brain. तो क्या बोलता आदमी? मेरे दिमाग का दही मत करो. तो दिमाग में कौन सी है? Liquefactive. It is wet gangrene. Sir, caseous. It is caseous. Caseous means cheese जैसा. Caseous मतलब cheese जैसा. और pneumonic TSH. TB, syphilis, histoplasmosis. TB, syphilis, histoplasmosis. TB, syphilis, histoplasmosis. Friends, then it is fatty necrosis. Fatty necrosis is chalky white deposit that is known as saponification. Saponification was also seen in adipocere formation, and also fibrinoid necrosis, homogeneous pink deposit is seen. Now, sir, apoptosis, there are anti-apoptotic genes. How you have to remember? Anti-apoptotic means these people are L kind of people. L kind of people, BCL126, BCL, MCL1.
इसको याद कर लो. L मतलब लाइफ दे, they prevent apoptosis.
Yes.
और याद करना BCMC.
ठीक है? BCMC. तो एंटी एपोप्टोटिक जीन, एंटी एपोप्टोटिक जीन को कम करते. कौन से वाले हैं ये डिक्रीज द एंटी एपोप्टोटिक जीन. ये कौन से? एल वाले हैं. कैसे हैं? एल वाले. BCL126, BCL, MCL1. नाउ सर, प्रो पीपल आर दोज पीपल ऑन योर बैक हु विल सपोर्ट यू. सर, बैक्स एंड बैक. नाउ सर, सेंसस की बात करेंगे. दिस इज बिम, बिड, बैड, नॉक्सा, पूमा. बिम, बिड, बैड, नॉक्सा, पूमा. Apoptosis with fever and inflammation is known as pyroptosis. Sir, the fear of fire is also known as pyrophobia. That is pyrophobia, and here fever with inflammation is a pyroptosis. Extrinsic, extrinsic, E for caspase 8. Intrinsic pathway, it is caspase 9. Executioner caspase is caspase 3 and 6. Caspase 3 and 6. Caspase 3 and 6. अरे फर्न टेस्ट इज नेगेटिव. हाँ, मैंने बताया था फर्न टेस्ट इज नेगेटिव इन योर टेस्टिकुलर टॉर्शन, बट इट इज पॉजिटिव इन योर एपिडर्मो ऑर्काइटिस. ठीक है? इट इज नॉट रिटन देयर. आई हैव टोल्ड यू व्हाई वर्बली. आई हैव टोल्ड यू. ठीक है? देन कमिंग, सर, special stain for the apoptosis would be annexin 5. And on DNA gel agar electrophoresis on apoptosis we see step ladder pattern. This is very important pattern, step ladder pattern. Dun. Then, sir, calcification. Dystrophic calcification is seen in dead and degenerated. DDD, dystrophic calcification is seen in dead and degenerated, and calcium levels are very much normal. Then, sir, metastatic calcification, if you remember, it is seen in living tissue, and calcium levels are raised. Pigments, the endogenous pigment mnemonic is MILF. No, sorry, MILF nahi, MIL. It is your MIL. Melanin, iron, lipofuscin, and hemocyanin. Sir, lipofuscin is also known as brown atrophy, or it is also known as wear tear pigment. Important FMG question of ठीक है, of your exam. It is your question of your exam. Exogenous pigment would be your skin or tattooing. You will see. ठीक है sir. Factor which delays the aging was your NEET PG exam question this time. Calorie restriction. It would be your calorie restriction. Calorie restriction is, and also you have to activate the sirtuin, and the most common source will be drinking the red wine. Drinking the red wine. Sir, cardinal sign of inflammation, you have to remember over here: Ruber, tumor, dollar, Keller, functulacia. First four, Ruber, tumor, dollar, Keller was given by Calcus. चार पहले किसने दिए थे? Calcus ने दिए थे. And functulacia is given by Rudolf Virchow. सर र्यूबर मतलब रगड़ लग गई, मतलब रेडनेस है. ट्यूमर मतलब सूज गया, और किसी का डॉलर गुम हो जाए तो बड़ी दर्द वाली कहानी है. क्या है? पेन. दिस इज नोन एज पेन. एंड कैलोरी इज ऑलवेज इंक्रीजिंग इन टेंपरेचर. दिस इज हीट. फंक्शन, दिस इज लॉस ऑफ फंक्शन. Now sir, cellular event, if I talk about, rolling is done by selective people, that is E-selectin, P-selectin. Addition is done by ICAM, VCAM, ICAM, VCAM. Diapidiasis PECAM1, chemokine C5A, LTB for interleukin 8. Now my question to all of my friends: which interleukin is a chemokine? Sir, your answer is interleukin 8. Your answer is interleukin 8. Now opsonin. Opsonin do the coating. So क्या क्या आंसर है इसका? 3C, 3B, 4B, 5B. And also one antibody which is opsonin. सर जीजी करके हम क्या करते हैं, किसी को वो कोट लगाते हैं, तो जीजी करके कोट लगाना है, तो याद रखना IgG is the only antibody which is a opsonin. Only interleukin which is a chemokine, it is interleukin 8. Only antibody which is a opsonin, sir, it is your IgG. Now histamine do what? Vasodilation, bronchoconstriction. Serotonin, vasoconstriction. Nitric oxide, vasodilation. Then PGD2 will do dilation. E2 fever, pain. F2 constriction. Yes. Thromboxane A2, sir. Thromboxane A2 vasoconstriction and increase platelet aggregation. Thromboxane A2 vasoconstriction plus there is an increase in platelet aggregation. Prostacyclin vasodilation and decrease in platelets. So thromboxane A2 is just opposite to the prostacyclin. Thromboxane A2 will do the vasoconstriction. जब vasoconstriction होगी, everything will be near. That is why it is written increase in the platelet aggregation. Now, sir, prostacyclin is a vasodilator and it will decrease the platelet aggregation. Strongest and the potent bronchoconstrictor would be LTC4. Yes. LT receptor antagonist would be Montelukast and Zafri. Monty and Zafri. Xylitol. क्या है? Low voice.
वॉइस देखिए एक बार.
I think ये cell ये ले लिया. Okay, guys, sorry.
वॉइस बैटरी चेंज कर दे.
ये वो तो नहीं है, बंद तो नहीं है.
नहीं ऑन है अभी. आ रही है.
Is audible guys? Are we audible? आवाज आ रही है अच्छे से? Okay, it's perfect. Okay, LOX inhibitor O is coming as we studied in the pharmacology also. LOX, it is xylitol. LOX, it is xylitol. Sir, this is your 2020 exam question, December. Membrane attack complex is found by C5, C6, C7, C8, T9, C9, C5, 6, 7, 8, 9. Sir, anti-inflammatory mediator. Remember, just remember cat scratch disease, star shape or stellate granuloma. Caseating granuloma, mnemonic is TSH, TB syphilis, histoplasma, TB syphilis, histoplasma, non-caseating granuloma, sarcoidosis, and in sarcoidosis, remember, bilateral hilar lymphadenopathy. Hallmark of primary healing would be granulation tissue and hallmark of secondary healing would be myofibroblast. Sir, now FMG exam 100% question, that is a hypertrophic scar and keloid. Hypertrophic scar is the same color as skin. Keloid is काला. क्या है? काला. तो क्या बोला? हम काले हैं तो क्या हुआ, दिल वाले हैं हम, तेरे 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 चाहने वाले हैं. Keloid, color darker than skin. Color darker than skin. And favorable side would be your pinna, sternum, shoulder. Pinna, sternum, shoulder. Pinna, sternum, shoulder. Sir, cells of innate immunity, and the first cell to react once there is antigen present in the body, that is your none other than natural killer cell. Natural killer cell is the first cell to come whenever it is time to fight with the antigen at very first go. Now, sir, cells of adaptive immunity, that is your B lymphocyte and T lymphocyte. Sir, B lymphocyte is produced in bone marrow and it got matured in bone marrow. T lymphocyte, it is produced in bone marrow but it is getting matured in your thymus. Which interleukin activate natural killer cell? It is interleukin 8. It is your interleukin 8. Now sir, MHC1 is a protective factor which is present in all of the tissues, but it is absent in the virus and tumor. That is why once natural killer sector is activated, it will never kill our body tissues. They directly kill the virus and tumor. Now sir, toll-like receptor, what you have to remember, 2 is for TB, 3 is for DNA RNA, 4 is for gram negatives, 5 F for flagella, 9 को उल्टा करो, P बन जाएगा प्रोटोजोआ. Remember, MHC1 present antigen to CD8 cell. It is presenting cell to CD8 cell. MHC2 present antigen to CD4 cell. Sir, hypersensitivity is of 4 types. Type 1 hypersensitivity is allergy. It is your allergy, asthma, atopy, allergy, and anaphylaxis. That is type 1 hypersensitivity. Sir, type 2 hypersensitivity is blood related. That is why mnemonic is also very famous. My blood group is Rh positive. It is myasthenia gravis. Blood, it is blood transfusion. Group is a good posture syndrome. Immune thrombocytopenic purpura. Immune thrombocytopenic purpura. And RH is RH incompatibility. RH is RH incompatibility. Positive is this pernicious anemia. They call all comes under type 2 hypersensitivity reaction. Type 2 hypersensitivity reaction. Type 3 hypersensitivity reaction sharp. The mnemonic is sharp. SLE, serum sickness and Hinauschalin purpura. Arthrex reaction, rheumatoid arthritis and polyarthritis nodosa. Sir, type 3 hypersensitivity reaction, remember type 2 Lepra reaction. It is seen in type 2 Lepra reaction. And type 4 hypersensitivity reaction, sir, it is seen in type 1 Lepra reaction. Now, sir, type of graft, if I talk about, remember, autograft is self-graft. Iso, it is identical twin. Allo, it is same species. Xeno, it is different species. Auto, self-graft. Iso, identical twin. Allo, same species. Xeno, different species. Done, done, and done. Now, sir, see, मिनट से क्या बनते हैं? मिनट से आवर. मिनट से क्या बना? आवर बना. डेज से बने वीक्स एंड मंथ से बना ईयर. तो हाइपर एक्यूट, एक्यूट एंड क्रॉनिक. हाइपर एक्यूट, एक्यूट एंड क्रॉनिक. गाइस रिमेंबर, हाइपर एक्यूट ग्राफ्ट रिजेक्शन विद इन मिनट टू आवर. Acute graft rejection is days to week. Chronic graft rejection is month to year. Month to year. Sir, amyloidosis. 100% exam question, amyloidosis. Number 1 is Alzheimer's disease. Number 2 is medullary thyroid carcinoma. Medullary thyroid carcinoma. Medullary thyroid carcinoma. Alzheimer's disease, organ is brain. Alzheimer's disease, organ is brain. And medullary thyroid carcinoma, organ is thyroid. Organ is thyroid. Then coming to the amyloid. एल्जीमर में कौन सा एमिलॉइड होता है? आ बेटा. और बेटा बेटा के बाद क्या याद करना? ताऊ प्रोटीन. इसमें क्या प्रेजेंट होती है? ताऊ प्रोटीन प्रेजेंट होती है. ताऊ प्रोटीन वाज एमसीक्यू ऑन 2020 December exam question. Now sir, medullary thyroid carcinoma, amyloid is acalcitonin. Amyloid is acalcitonin. Acalcitonin. Then sir, remember, most common cause of death in amyloidosis is because of arrhythmia. It is because of arrhythmia. Red pulp is seen in lordosis spleen. White pulp is seen in sago. Safed sago spleen. Sir, best to diagnose the amyloidosis would be the rectal biopsy. And on H&E stain, you will see homogeneous pink deposit. And Congo, कश्मीर में Congo कैसे करते हैं? किसी को एक दूसरे Congo एप्पल देके करते हैं, इसलिए Congo red staining में apple green birefringes. X-ray crystallography, you will see sir beta pleated sheet. You will see sir what? Beta pleated sheet. ठीक है. उसके बाद क्या है? Electron microscopy and branching fibrils. Sir, heart failure cells are seen in left lung. Virtuous triad is also seen in deep vein thrombosis. Endothelial injury, abnormal flow and hypercoagulability. And most abundant collagen in the body is type 1. Guys, just need a small break, then some small session will be there, and then we are done.
And now we have best of luck in exam preparation strategy tomorrow.
Don't forget this. Now we will meet at 9:20. need a little rest and then we will continue the
Last session,
ठीक है,
yeah.
last session we will be continuing, जो भी हमसे हो पाएगा we will try our level best to help
This
you
is more
guys.
than sufficient to pass,
ठीक है?
बच्चा.
Yes,
Don't
yes.
have to worry.
ठीक
Okay.
है, just give us 5-10 minutes and then we'll get in the charge, energy charge, and then we'll come back to do. ठीक है, 9:20 we'll see you on.
Yes.
चलो आ जाओ.
चलो.
Okay, no problem. Which I'm getting the final PDF which I need to load is our So now let's start with the anatomy. Welcome back to all of my friends over there on board right now with me. Let's start something known as anatomy. And remember, nerves related to the humerus. Number one is axillary nerve. When your axillary nerve is getting fractured, sir, when your surgical neck of humerus is getting fractured, then your axillary nerve injury would be there. Sir, if it is shaft is fractured, then there is a radial nerve injury, and if there is a posterior aspect of medial epicondyle is gone, then ulnar nerve would be gone. Then ulnar nerve would be gone. Done. Sir, coming most common deformities, ape thumb is seen in medial nerve injury, partial claw hand is seen in ulnar nerve, wrist drop radial, complete claw hand median plus ulnar. Tennis elbow and golfer. Tennis you play while stretching your arms, lateral position, that is why lateral epicondylitis. Golf you play like this is median epicondylitis. Musician nerve is a ulnar nerve. Musician nerve is a ulnar nerve. Foot drop you will see the common perennial nerve. It is a common perennial nerve, sir. Sir, labrador's nerve is a median nerve. Labrador's nerve is a median nerve, sir. Muscle of hand, bone of hand, if I talk, most common carpal bone to get fracture, it is your scaphoid, sir, and it is boat shape. It is boat shape. Now, sir, carpal bone most prone to avascular necrosis is also your scaphoid. If someone asks you most common dislocated carpal bone, sir, your answer is lunate. Your answer is rudate. Axillary nerve, remember the root value is upper root value is C5 to C6. C5 to C6. Then coming to the radial medial. क्या है? Radial medial. Radial medial. Radial medial. Full root value C5, C6, C7, C8, T1. Radial medial. Radial medial. रहता कहता सब ले आओ. Radial medial क्या है तुम्हारा? ठीक है, मीडियल रेडियल क्या है? पूरा का पूरा रूट वैल्यू. लॉन्ग थोरेसिक नर्व C5, C6, C7, C5, C6, C7. Then coming, sir, your dorsoscapular nerve. It is C5. Dorsoscapular nerve is C5, and ulnar nerve is slightly lower root value, that is your C7, C8, T1. Now, sir, muscles of rotator cuff, the mnemonic is sits. Supraspinatus, it is infraspinatus, it is teres minus and subscapularis. Sits is a mnemonic. Supraspinatus, infraspinatus, teres minus and subscapularis. Sir, it never involve major. Teres major is never involved in your rotator muscles of rotator cuff. Now, sir, winging of scapula is seen. Yes. It is due to long thoracic nerve injury, and root value for long thoracic nerve is C5, C6, C7, C5, C6, C7, C5, C6, C7. Then coming, sir, boxer's muscle. सराटे से आगे मारना है. क्या कहना? सराटे से आगे, serratus interior. That is serratus interior, and it is supplied by long thoracic nerve. Again, climber muscle. कैसे याद करना था? लेटे हुए पे चढ़ जाओ और डाल दो. लेटे हुए पे तो याद रखना latissimus dorsi. क्या है latissimus dorsi? It is supplied by thoracodorsal nerve. It is supplied by thoracodorsal nerve. Abduction of muscle. उठाना है तुम्हें क्या? कंधा. 0 to 15 degrees, sir, it is supraspinatus. 15 to 90 is deltoid, and more than 90 trapezius and serratus.
सुपरा अंदर आता है.
पहले सुपरा, छोटा सा उठाना है तो सुपरा, उसका 15 to 90 is deltoid, more than 90 trapezius and serratus anterior. Yes. Sir, axillary nerve injury, if I told you there is a rudimental batch area loss, and there will loss and sensation on the deltoid muscle. Also, it affects the deltoid motor function. That means deltoid and teri minus it paralyzed. That will be no abduction. There will be no. Sir, Ehlers palsy and Clamp-Case palsy, how you have to remember? RB people are slightly higher level of people, higher class of people. That is why root value involved with is slight higher, C5, C6. Root value involved with C5, C6. It is also known as, sir, policeman tip deformity. It is also known as policeman tip deformity. Sir, Clamp-Case palsy मतलब Clamp-Case लटके हुए. Clamp-Case क्या है? लटके हुए. ठीक है. Then remember CAT1 root values are involved, claw hand is seen, and that is full claw hand. Ulnar median both are involved. Also Horner syndrome is seen in clump case palsy. So in clump case palsy, claw hand is seen and Horner syndrome is seen. So remember now important muscles of the hand. See, all the muscles of the hand are supplied by ulnar nerve, sir, except first and second lumbrical, which is supplied by median nerve. First and second lumbrical is supplied by median nerve. Now dorsal interossei help in abduction of fingers, and palmar interossei helps in the adduction of a finger. Supination and pronation is occurring at radio ulnar joint. Next coming, sir, important, that is your lower limb. Lower limb may anterior compartment of the thigh is supplied by femoral nerve, posterior compartment of the thigh is supplied by sciatic nerve, and the medial compartment of the thigh is supplied by obturator nerve. Sir, floor of femoral triangle, the mnemonic is uppy. You have to start from the medial side and you have to go to the lateral side. Uppy stands for adductor longus, pectineus, psoas major, and iliacus. Pectineus, psoas major, and iliacus. Done. Now, sir, external iliac artery will pass through the inguinal ligament. It will pass to the inguinal ligament and it will form what? Femoral artery. Now, sir, femoral artery will pass through the adductor hiatus. It will form the popliteal artery. Now, femoral sheath, three compartments are there: lateral, central, medial. Lateral compartment, sir, one nerve is present, one artery is present. Femoral artery, genitofemoral nerve. Central compartment, femoral vein is present. Medial compartment, lymph node, cloacae or Rosenmuller is present. Then coming, sir, gluteal region, which is very famous favorite region of the examiner. Guys, remember, nerve supply would be inferior gluteal nerve. Gluteus maximus is supplied by inferior gluteus nerve. Gluteus medius and minimus is supplied by superior gluteal nerve. Gluteus maximus by inferior gluteal nerve. Gluteus medius and minimus is supplied by superior gluteal nerve. Sir, who is a chief abductor of the hip joint? टांगे खोलने में, चौड़ी करने में कौन काम आता है? Gluteus medius and minimus. Sitting and standing position, who is helping you, sir? It is your gluteus maximus. Now we are going to the legs. Remember, guys, sciatic nerve, it is tibial nerve. Sciatic nerve, it is supplying tibial nerve and also common peroneal. Two branches of sciatic nerve, tibial nerve and common peroneal nerve. Tibial nerve, it is a nerve of posterior compartment. Tibial nerve is a nerve of posterior compartment. Now, common peroneal nerve binds around the neck of fibula. It binds around the neck of fibula, sir. It is giving branch to deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve and superficial peroneal nerve. Deep peroneal nerve is a nerve of anterior compartment of the leg, and superficial peroneal nerve is a nerve of lateral compartment of the leg. Yes. Now coming, sir, eversion and inversion is occurring at the subtalar joint. A muscle of eversion would be peroneus longus, peroneus brevis. Yes. Muscle of inversion would be tibialis anterior, tibialis posterior. First web space of foot is supplied by deep peroneal nerve. It is supplied by deep peroneal nerve. Done. ठीक है, उसके बाद आया फुट ड्रॉप. इट इज ड्यू टू इंजरी टू द कॉमन पेरिनियल नर्व. इट इज इंजरी टू द कॉमन पेरिनियल नर्व. हेड एंड नेक की बात करेंगे. राइट कॉमन कैरोटिड आर्टरी इज अ ब्रांच ऑफ ब्रेकियोसेफेलिक आर्टरी एंड लेफ्ट कॉमन कैरोटिड आर्टरी इज अ ब्रांच ऑफ आर्च ऑफ अयोटा. ठीक है जी, चलो. Subclavian artery is divided with the help of one muscle known as calcaneus anterior muscle, and sir, mnemonic is vitamin C and D. जल्दी से vitamin vertebral artery, internal thoracic artery, thyrocervical trunk. Then second part is costocervical trunk. It is costocervical trunk. Congratulations स्वास्तिक राज, सर का आशीर्वाद आपके साथ हैं. Don't worry. ठीक है.
Next attempt get 1000.
Third part would be dorsoscapular artery. Sir. Yes. Sir, branches of external carotid artery. Let me make it very simple. Wow. First one is lingual. This is beautiful. तूने बनाया या लेके आया? दिल से. दिल में तुझे बसा के अपना.
मुझे एक डाउट है, ये लिप्स लाल क्यों किए?
लिप्स हमेशा लाल होते हैं सर, और गुलाबी जैसे गुलाबी आंखें होती है वैसे ही लिप्स भी लाल होते हैं. तो क्या पता है, गुलाबी जैसे लिप्स दिखाए. ये मेरा आईपैड भी हैंग हो गया. गुलाबी आंखें जो तेरी, नहीं शराबी की गुलाबी आंखें, गुलाबी आंखें जो तेरी देखी, शराबी ये दिल हो गया, सवालो मुझको ए मेरे यारो, सबल्ला मुश्किल हो गया, ला 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 रा 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 ला रा 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 lingual artery,
L for lingual.
lingual artery, superior thyroid artery, then coming to facial artery, occipital artery, posterior auricular artery, maxillary artery, supratemporal artery. It is supratemporal artery. Dandana, 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 dum. Then coming, sir, muscle of masturbation. No, muscle of mastication. Sir, it is your muscles of mastication. Mnemonic is temporalis, masseter, medial pterygoid, lateral pterygoid, and sir, it is supplied by mandibular. Now sir, cavernous sinus की बात करेंगे. It is present on the sphenoid bone, and remember there is a sinus present, and from the sinus the structure passing is your internal carotid artery and abducens nerve, and nearby the sinus what is passing, sir? Moto, maxillary, ophthalmic, trochlear, and oculomotor nerve. Now sir, parotid gland is drained by Stanson duct. It is piercing buccinator muscle and it is opening opposite to the upper second molar tooth. Submandibular gland, it is opening Wharton's duct and it opens the sublingual papilla in the floor of mouth. डंडना डंडना डन. ठीक है. और दोस्तों टंग, all the muscle, मेरे साथ साथ, all the muscle of the tongue are supplied by hypoglossal nerve except palatoglossus. It is supplied by vasoaccessory complex. It is supplied by vasoaccessory complex. Dandana dun. Who is a safety muscle of the tongue? It is genius muscle, genioglossus. Hypoglossal nerve injury will lead to deviation of the tongue to the same side. So Little's area is the most common site of epistaxis and it is supplied by mnemonic is gas. Gas stands for greater palatine artery, anterior ethmoid artery, sphenopalatine artery, and superior labial artery. Sir, sphenopalatine artery is the artery of epistaxis. Sphenopalatine artery is a artery of epistaxis. Carotid sheath, remember guys, blue color is internal jugular vein, red is common carotid artery and vagus nerve. Three structures are present in the carotid sheath. Number one is common carotid artery, internal jugular vein and vagus nerve. Guys remember, पीछे से लोग sympathy देते हैं, इसीलिए posterior part of the carotid sheath what is present, it is a sympathetic trunk, and anterior part is AAA, ansa cervicalis. Ansa cervicalis. Guys remember the mnemonic for ansa cervicalis would be your SOS, sternothyroid, omohyoid and sternohyoid. Sternothyroid, omohyoid, sternohyoid, SOS. Now sir, miscellaneous point, if I ask you, venous Vena caval opening is present at TN. Mnemonic है Voice of America. क्या mnemonic है? Voice of America. Guys remember, vena caval opening T8, inferior vena cava and right phrenic nerve. Esophageal opening is present at TN, esophagus, vagal trunk, and इसका mnemonic है OVL, esophagus, vagal trunk, and left gastric artery. Sir, aortic is present at T12. Mnemonic is aorta, thoracic duct, azygous vein. Sir, all the veins of the heart drains into coronary sinus except anterior cardiac vein, which is directly draining into the right atrium. Now, parts of the heart and the structure formed by inferior surface is formed by both the ventricle, base is formed by both the atria, apex is formed by both the ventricles. Inferior surface was ventricle, base is formed by both atria, apex is on left ventricle. Now, sir, neurovascular bundle is present on the lower border of the rib. That is why never ever puncture lower border of the rib, because vein, artery and nerve is present. Now coming to the next important thing, embryological structure in the adult ruminants. Sir, ductus venosus, ligamentum venosum, ductus arteriosus, ligamentum arteriosum, umbilical vein, which is need to be taken care of, ligament teres hepatis. Sir, umbilical artery is proximal part and distal part. Proximal part is giving you superior vesical artery. The proximal part is giving you superior vesical artery and the distal part is giving you medial umbilical ligament. Descent of testis. Testis की कहानी बहुत प्यारी है दोस्तों. 4 to 6 months your testis was present in deep inguinal ring. It was present in deep inguinal ring. 7 month your testes reach the inguinal canal. 8 month it reaches the superficial ring. Now sir, 9th month your testis came to the scrotum. Testis ऐसे गिरा 25 से scrotum के अंदर 9th month पे. Now if any this testis is stuck in this path, this is known as undistended testis. And if testis goes anywhere else, for example, it goes in throat, it comes in mouth, it comes in lungs, it comes in GIT, this is ectopic testis.
आएगी कैसे?
आ सकती है कैसे भी आ जाए? ectopic testis, this is known as ectopic testis. ठीक है?
I can't even imagine.
नो
और अकेली आई या साथ में?
भाई क्या ही बोले तो एक्टोपिक टेस्टिस, दिस इज नोन एज एक्टोपिक टेस्टिस. तो इसने क्या करा? एक्टोपिक टेस्टिस, अंडरस्टैंडेड टेस्टिस ट्रीटमेंट इज यू जस्ट हैव टू ब्रिंग द टेस्टिस बैक फ्रॉम दैट पाथ. एक्टोपिक टेस्टिस यू हैव टू रिमूव द टेस्टिस एंड यू विल सी यू हैव टू प्लेस अ स्टोन इन द स्क्रॉटम. और फिर क्या बोला? पत्थर के सनम तुझको हमने मोहब्बत का खुदा माना, बड़ी भूल हुई आज हमसे, ये क्या समझा ये क्या जाना, पत्थर के सनम. Next sir, it is your abdominal aortic branches. Ventral branch, celiac trunk, superior mesenteric and inferior mesenteric. Celiac trunk will supply to foregut, superior mesenteric will supply to midgut, inferior mesenteric will supply to hindgut. Sir, lateral branches में mnemonic is गर्मी, हाय गर्मी. गोनैडल आर्टरी, रीनल आर्टरी, मिड सुप्रा रीनल आर्टरी. कैसे याद करोगे? गोनैडल आर्टरी, रीनल आर्टरी, मिड सुप्रा रीनल आर्टरी. इंफीरियर फ्रेनिक आर्टरी क्या है? inferior phrenic artery. Now posterior branches, 4 pair of lumbar artery and 1 median sacral artery. 4 pairs of lumbar artery and 1 median sacral. Sir, terminal branches में right and left common iliac artery. Now cavity and the structure. Name. Cavity in the brain is known as ventricle. Now sir, cerebral hemisphere will form the lateral ventricle. Diencephalon will form the third ventricle. It will form the third ventricle. And hindbrain, it is fourth ventricle. It is fourth ventricle. Next coming sir, basilar artery. Just remember, basilar artery, Ica is a branch of basilar artery and Pica is a branch of vertebral artery. Ica is a branch of basilar artery, Pica is a branch of vertebral artery. Pica is a branch of vertebral artery. Sir, basal ganglia mnemonic is GCSSP. G for globus pallidum, C for caudate, S for substantia nigra, S for subthalamus, and P for putamen. P for putamen. P for putamen. Now sir, longest intracranial course. Longest intracranial course is of trochlear nerve. Most slender and thin nerve is also your trochlear nerve. Then largest, thickest nerve is your trigeminal nerve. Longest extracranial nerve is your vagus nerve. Longest intraosseous nerve is your facial nerve. क्या द्वारा? Longest intracranial course is of trochlear nerve. Most slender thin nerve is trochlear nerve. Thickest सबसे मोटी trigeminal. Longest extracranial course is of vagus nerve. Longest intraosseous course is of facial nerve. It is of facial nerve. Then coming deep, cerebral nucleus, dentate, emboliform, vestigial globus. Anatomy, dandana, done. If you allow me guys, let me start with the next subject, that is your biochemistry. That is your biochemistry. Guys, pathway number 1 is glycolysis or embedment of pathway. The rate limiting enzyme would be phosphofructokinase 1. Phosphofructokinase 1. Glycolysis, embedment of pathway. Rate limiting enzyme is phosphofructokinase 1. Fructokinase 1. Krebs cycle, TCA cycle, citric acid cycle. Citric से याद करना isocitrate dehydrogenase. Sir, gluconeogenesis. Gluconeogenesis, remember fructose 1,6 bisphosphatase, fructose 1,6 bisphosphatase, and glycogenesis. Glycogenesis is glycogen synthase, glycogenolysis मतलब breakdown, that is your glycogen phosphorylase, HMP shunt or pentose phosphate pathways, glucose 6 phosphate dehydrogenase, that is your G6PD. क्या है? G6PD. Guys, remember protein metabolism, urea cycle or ornithine cycle. It is your urea cycle or ornithine cycle, sir. Here is the liver, it is taking place in liver, and the enzyme is CPS1. The enzyme is CPS1. Sir, lipid metabolism is very easy. I'll make it very easy for you. बेटे को क्या पसंद है? कैट पसंद है, तो बीटा ऑक्सीडेशन ऑफ फैटी एसिड, द रेट लिमिट एंजाइम वुड बी कैट1. Carnitine acyltransferase. Sir, then coming to the ketogenesis. Ketogenesis, HMG. देखो कीटो कट गया तो उसको क्या करोगे? बनाओगे. If something is cutted, you will reconstruct it. तो it will be HMG CoA synthase. HMG CoA synthase. Cholesterol, if it is increased in the body, you will decrease that. HMG CoA reductase. फैटी एसिड, रिमेंबर घी. घी को क्या करना है? डब्बे में बंद करना, कार में ले जाना. दैट इज योर एसिटल CoA कार्बोक्सिलेज. Now, sir, purine synthesis, it is your PRPP, glutamyl aminotransferase. Done. Now, sir, type 1. कैसे जीतना है? कर हर मैदान फतेह, कर हर मैदान फतेह. 4 तारीख को हमारी जीत होने वाली है दोस्तों, और इंशाल्लाह विद द फ्लाइंग कलर्स वी ऑल आर गोइंग टू पास. ये जीत हमें गले लगाना चाहती है. ये मेहनत हमसे करवा रही है. क्या हार्डवर्क और ज्यादा करवा रही है, और ज्यादा मेहनत से मेहनत हो रही है. फिर कामयाबी तुम्हें गले लगाएगी. फिर क्या बोलोगे? जिंदगी गले लगा ले, कामयाबी गले लगा ले. तो 4 तारीख को चूम लेना है. किसको चूम लेना है? अपनी कामयाबी को चूमना. और क्या बोलना है? जरा सा चूम लूं मैं, अरे नारे ना, जरा सा चूम लूं मैं, अरे नारे ना. तू तो पास हो गया. ये वॉन गिरकी. क्या है? वॉन गिरकी. दोस्तों वॉन गिरकी याद रखना. वॉन गिरकी. ठीक है. वॉन गिरकी कैसे याद करोगे मेरे प्यारे दोस्तों? वॉन गिरकी मैं अभी याद कराता हूं तुम्हें. कैसे नहीं याद करोगे? जीतोगे. कैसे जीतोगे? ग्लूकोज पी के छक्का मारोगे. ग्लूकोज 6 phosphatase. इट इज योर ग्लूकोज 6 phosphatase. Then, sir, coming your Pompey's disease. Then comes your Pompey's disease. Pompey's, it is acid maltase. Pompey's, sir, it is your acid maltase. फिर क्या है? Cory's disease. CDAB. कोरी से क्या है? डी ब्रांचिंग, एंड एंडरसन से क्या है सर? ब्रांचिंग. कोरी से डी ब्रांचिंग एंड एंडरसन से ब्रांचिंग एंजाइम. सर मैकर्डल, recent NEET PG exam question. मैकर्डल्स, remember it is a muscle glycogen phosphorylase. Hirsch disease, it is hepatic glycogen phosphorylase. And sir, essential fructose urea. Essential fructose urea, fructokinase, fructose intolerance, aldolase B, galactosemia, oil drop, cataract. And sir, your answer is Galput. Your answer is Galput. Your answer is Galput. Now, sir, disease and the enzyme defect. Remember, phenylketonuria, mousy musty order. Phenylketonuria, mousy musty order, and enzyme deficiency would be phenylalanine hydroxylase. Phenylalanine hydroxylase. Phenylalanine hydroxylane. It is your hydroxylase. Now, sir, alkapnuria. K for kala, black urine disease. It is homogentisate oxidase. Then, sir, coming your maple syrup urine disease. Syrup is made up of sugar. Syrup is always made up of sugar. That is BCKD. BCKD, branch chain keto acid dehydrogenase and decarboxylase. Sir, next coming your disease and the enzyme defect. Number 1 is Niemann-Pick disease, sphingomyelinase. Niemann-Pick disease, sphingomyelinase. Gaucher's disease. In Gaucher disease, you will see crumpled tissue paper appearance, and it is beta-glucocerebrosidase. Beta-glucocerebrosidase. Krabbe's disease, beta-galactocerebrosidase. Fabry's, alpha-galactocerebrosidase. Tay-Sach, Tay-Hexoseminides A, Tay-Hexoseminides A, Tay-Hexoseminides A, Tay-Hexoseminides A, Tay-Hexoseminides A, Hexoseminides A. Sand-Hoff disease, Hexoseminides A and B. Hand-Hoff disease, Hexoseminides A and B. Sir, nucleotide, Leishman syndrome. In this Leishman syndrome, your nails are destructed. Remember, it is HGPRT. क्या याद करोगे? हरप्रीत. क्या है? हरप्रीत. And gout में what you will see, sir? Hyperuricemia. Now, amino acid and the special product, sir, it is your tyrosine, melanin, T3, T4 and catecholamine. Tyrosine, it is melanin, T3, T4 and catecholamine. Tryptophan, melatonin, serotonin, vitamin B3. Histidine, it is your histamine. Histidine, histamine. Arginine, nitrous oxide. Arginine, it is nitrous oxide. Inhibitor, sir, if I tell you inhibitor, it is fluoride, it is inhibited by anolase. Fluoride is inhibited by anolase. Barbiturates rotinon. Barbiturates rotinon complex 1. Barbiturates rotinon complex 1. उसके बाद मेलोनेट, क्या है? मेलोनेट कॉम्प्लेक्स 2. मेलोनेट कॉम्प्लेक्स 2. दिस इज रिसेंटली एग्जाम क्वेश्चन. कार्बन मोनोऑक्साइड, cyanide and hydrogen sulfide complex 4. It is your complex 4. Oligomycin, it is complex 5. Oligomycin is complex 5. ठीक है, तो याद रखना यहाँ पे important fluoride anolase, barbiturate rotinon complex 1, malonate complex 2, carbon monoxide, cyanide, hydrogen sulfide, it is your complex 4, oligomycin complex 5. Sir, cobalt. Sir, cobalt is a constituent. Cobalt is a constituent of vitamin B12. Cobalt is a constituent of vitamin B12. Chromium potentiate. Chromium potentiate the action of insulin. ठीक है, insulin. Then fluoride constituent of bone and teeth. फ्लूराइड की नॉर्मल वैल्यू क्या सिखाई थी? 0.5 to 0.8. लेस देन 0.5 it is your dental caries. More than 0.8 it will your fluorosis. Sir, iodine is for the thyroid hormone synthesis. It is for the thyroid hormone synthesis. मौली क्या है? X. मौली क्या है? X है दोस्तों. क्या याद रखना है? मौली की X से क्या याद करोगे? यहाँ देखो, ध्यान से देखो, मौली के X से क्या याद करोगे तुम? xanthine oxidase. क्या याद करोगे? xanthine oxidase. It is your xanthine oxidase. आ जा यार. xanthine oxidase. Selenium is a cofactor for glutathione peroxidase and dehydrogenase. Glutathione peroxidase and dehydrogenase. Sir, zinc. जिंक से क्या याद करोगे? काल. क्या याद करोगे? काल. CAAL. क्या बोलोगे? काल से काल मिला. ओ, थोड़ा चेंज कर दिया ना. काल से काल मिला. जिंक से C से कार्बोनिक एनहाइड्रेस, अल्कोहल डिहाइड्रोजिनेस, alkaline phosphatase and lactate dehydrogenase. And lactate dehydrogenase. महंगा आता है क्या मेरी बेबी का केक? महंगा आता है क्या मेरी बेबी का केक? तो केक इज अ निमोनिक. और दोस्तों केक डब्बे में डाल के लाते हैं, दैट इज बाय कार्बोक्सिलेज. दिस सी इज कार्बोक्सिलेज. A for arginine, K for kinase, E for anolase, E for anolase. Sir, then coming to the classification of amino acid, this is very simple. That is very simple. Remember guys, mnemonic is गौतम नगर वाली, ना जम्मू वाली, ना कश्मीर वाली, ना कन्याकुमारी की, ना गुजरात की, ना नॉर्थ ईस्ट की. भाई कहाँ वाली? गौतम नगर वाली. गौतम नगर वाली is a mnemonic for aliphatic amino acid. G for sir glycine. गौतम नगर से glycine, valine, isoleucine, leucine, alanine. Aliphatic amino acid डन. गौतम नगर में मोटे हो जाते हैं सब एलिफेंट की तरह, क्योंकि परांठे खाते हैं. क्या खाते हैं? परांठे खाते हैं. हाइड्रोक्सिल ग्रुप कंटेनिंग अमीनो एसिड वुड बी सर ST. इट इज योर सर ST. सर ST की बात करेंगे तो ST इज योर सीरीन एंड थ्रियोनिन. ST is your serine and threonine. Sir, sulfur containing amino acid would be CM, cysteine and methionine. CM क्या करते हैं? बिठाते हैं. और मीठी मीठी बात करें, sit and मीठा मीठा बोलो, किसका काम है? CM का काम है. sulfur containing amino acid. सर एसिडिक अमीनो एसिड निमोनिक इज आग. क्या है? आग. ए से क्या है? एस्पार्टिक एसिड. एस्पार्जिन. यस, Partic acid and aspargine. Glutamic acid and glutamine.
यस
Glutamic acid and glutamine.
अरे एस और ग्लूटियल एक ही बात होती है ना,
वही तो बात है।
एस और ग्लूटियल रीजन, क्या बात है, देखो वाह वाह वाह
वाह वाह वाह वाह जी, थैंक यू सो मच।
बिल्कुल
क्यूटी पाई, क्यूटी पाई। Basic amino acid. What is basic amino acid? The mnemonic is La. La. ये भी ला, वो भी ला, ये वाला सब्जेक्ट भी करा दे, वो वाला भी करा दे, क्या क्या करा दे। बेसिक अमीनो एसिड, इट इज ला, इट इज योर ला। कबूतर आ कबूतर जा जा जा। एरोमेटिक अमीनो एसिड, ला से क्या है? लाइसिन, आर्जिनिन, हिस्टिडीन। रिमेंबर गाइस, एरोमेटिक मतलब खुशबू लगाए, खुशबू लगाते ही पट जाती है, खुशबू लगाते ही पट जाती है, पट जाता है तो क्या है? पट। निमोनिक इज पट सर। फिनाइल अलानिन, टायरोसिन, ट्रिप्टोफैन। फिनाइल अलानिन, टायरोसिन, ट्रिप्टोफैन। सर अमीनो एसिड इज प्रोलीन। Essential amino acid, the mnemonic is TV till 8 p.m. The mnemonic is TV till 8 p.m. Guys, remember TV is tryptophan, valine. Tryptophan and valine. And remember threonine, isoleucine, leucine, lysine, phenylalanine and methionine. Break this TV into two parts, tryptophan and valine. Till threonine, isoleucine, leucine, lysine. What is left? PM. Phenylalanine and methionine. Phenylalanine and methionine. Sir, semi-essential amino acid would be कीटोजेनिक। कट गया, क्या कट गया? L कट गया, जैसे बॉबी कटा था बॉबिट में, तो याद रखना कीटोजेनिक इट इज LL, ल्यूसिन एंड लाइसिन। सर इट इज ल्यूसिन एंड लाइसिन, ठीक है। ठीक है, ल्यूसिन एंड लाइसिन। नाउ ग्लूकोजेनिक एंड कीटोजेनिक, अगर दो लोग आते हैं तो पिटाई हो जाती है। पिट क्या है दोस्तों? पिट। रिमेंबर पिट इज फिनाइल अलानिन, फिनाइल अलानिन, आइसोल्यूसिन, टायरोसिन एंड ट्रिप्टोफैन। 21st amino acid would be selenocysteine. 21st amino acid would be selenocysteine and 22nd amino acid would be your pyrrolysine. Sir, essential fatty acid would be your linoleic, linolenic and arachidonic acid. क्या निमोनिक है? लार। क्या है? लार टपकने लग जाती है। Linoleic, linolenic and arachidonic acid. Sir, remember miscellaneous point is very important. Uncoupler is 2,4-DNP and aspirin. Physiological uncouplers would be thermogenin and thyroxine. Thermogenin and thyroxine. Lipoprotein with the highest cholesterol would be LDL. Lipoprotein with the highest triglyceride would be chylomicron. Nature of enzymes are apo plus co will make holo. Now vitamins. Thiamine is a vitamin B1 and it leads to beriberi, and it is most commonly seen in the Polish rice eater. It is most commonly seen in the Polish rice eater. Dandana 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 dan. Riboflavin is B2 and क्या देखना है? Glossitis. Glossitis is seen in Plummer-Vinson syndrome. Niacin it is B3, it will lead to pellagra. यहाँ पे हो जाता है pellagra हो जाता है. Then pyridoxine it is B6 will lead to anemia. Cyanocobalamin vitamin B12 will lead to megaloblastic anemia, and pernicious anemia is a cause of megaloblastic anemia. Folic acid is vitamin B9, it will lead to folic acid deficiency anemia. Folic acid deficiency anemia, ठीक है दोस्तों। पैंटोथैनिक एसिड इज बर्निंग फीड। पैंटोथैनिक एसिड इज बर्निंग फीड। Biotin, pantothenic acid is B5, it is burning feed. Biotin, it is nerve disorder. Nervous, not nervous, it is nerves disorder. Ascorbic acid is vitamin C, it will lead to scurvy. It will lead to scurvy. White line of freckle is seen here. Sir, retinol, it is vitamin A, it will lead to night blindness and xerophthalmia. Calciferol is vitamin D, it will lead to the rickets. It will lead to the rickets. Tocopherol or vitamin E, sterility in female, abortion in sterility in male and abortion in female. Sir, vitamin K is of three types: K1, K2, K3. K1 it is polyquinone, manaquinone and manadione. It is K3 is manadione. K1 and K2 is lipid soluble and K3 is water soluble. It will lead to bleeding disorder. Bleeding disorder. ठीक है, this we have done. Just quickly one slide more we have to do, 10-15 minutes and we are over. Done.
Thank you Malik, Dr. Malik.
Munaza Malik, please, she is a continuous audience throughout the sessions. She was there. Let's talk about the last thing. We are going to study some part of micro and then we are over, sir.
And micro, please watch the concise class,
Yeah, that is the
double
best.
speed, or you can even read the PDF. Please don't forget the PDF of chanting and
Yeah.
the PYQ. Have a look at both in these.
Sir,
two
important things we will study,
Yes,
like
yes.
the
Yeah.
mortality.
Mortality.
Remember,
Culture media.
tumbling, it is Listeria monocytogens, and darting, it is Vibrio cholerae and Campylobacter jejuni. Swarming, sir, it is your Proteus. And gliding, it is your Mycoplasma. And twitching, TTT, Trichomonas vaginalis. Falling leaf क्या है? गिरा दिया, क्या है? गिरा दिया है मुझे, अलविदा तुझे, तुझे जीना है मेरे बिना. मुझे पता लिरिक्स कुछ और थे, बट क्या करें, आदत से मजबूर है ना. फॉलिंग लीफ, किसी भी बात का गाना बनाने की आदत होगी, ठीक है. रोटेटरी, दोस्तों घूमते घूमते घर जाओगे, जब बैलेंटीन्स पी लोगे तो याद रखना बैलेंटीनिडियम कोलाई. Corkscrew, it is spirochetes. Sir, then I want to ask you about the arrangement of the flagella. Basic part we will touch. Monotrichous means one flagella. Then two flagella are there. They can be one side, they can be two side also. Two flagellas, that is amphitrichous. Monotrichous mnemonic is VIP. Vibrio cholerae and Pseudomonas. Sir. And amphitrichous, it is AC. Alkaligens and Campylobacter jejuni. Then Lophotrichous, it is Spirillum minus. Then if it is covering all of the side, this is, sir, Peritrichous, it is Proteus, Salmonella, E. coli. Done. Now, sir, we are talking about the culture media. Simple media, it is nutrient agar, consists of peptone and meat extract. Complex media is of two types, solid and liquid. Solid is known as enrichment media, and liquid is known as, enriched media is solid and enrichment media is liquid. Now, sir, enriched media, it is your blood agar, chocolate agar and Loeffler serum solo. Mnemonic क्या? BCL, दिल्ली में बहुत कॉमन होता है सर, BCL
और L दोनों
BCL दोनों.
BC कर दो, L दे देते हैं.
blood agar, chocolate agar and Loeffler serum slope. Then coming, sir, enrichment media. Poll 4,252 people in total today joined our Maha chanting session, which is super successful for us, for you, for everyone, for the sake of humanity. The efforts which we are having, the vision which sir is having, we are also following the same path. Now it will enlighten.
Baki people are still coming.
Yes, they are still coming. 621. Now
And
these
some
are
place only 21 are there.
selenite F broth and alkaline peptone water. It is alkaline peptone water, sir. Sir, remember something that is known as selective media. Selective media, number one, sir, it is your TCBS. Thiosulfate citrate bile salt sucrose. Thiosulfate citrate bile salt sucrose. MSA is mannitol salt agar. MSA is mannitol salt agar and potassium telluride agar. Now, sir, transport media, if I talk about, it is your Venkate Raman media. Clary Blair also Vibrio cholerae. Venkate Raman media is for Vibrio cholerae. Clary Blair is also for the Vibrio cholerae. Sir, Pike's media is Streptococcus pyogenes. Steers or Amies media is for meningococci or gonococci. Meningio or gonococci. Done. Now, next thing I want to talk is something that is known as, let me take you on these things, a difference between a bacteria and virus. Sir, bacteria is large, virus is small. Yes. Bacteria comprise of both RNA and DNA. Virus is either having RNA or DNA. Either RNA or either DNA, sir. Sir, it multiply. Bacteria multiply B for binary fission, and bacteria is a pro because it is having what? RNA and DNA both. That is why bacteria is a prokaryote. Sir, virus is very small. It is having only RNA or DNA. Yes.
Very small.
Very small.
Yes.
Virus is very small and it multiplied by infective cycle. It is neither prokaryote nor eukaryote. Let's talk about something known as gram positive and gram negative. Guys, remember, gram positive is slightly thick because of thick peptidoglycan, and gram negative is thin, that is because of thin peptidoglycan. Guys, gram positive mein one other thing you have to remember of a color. The blue color is for gram positive, and something purple, pink, red color type, this is gram negative.
Yes,
The
very
teichoic acid once has been
Yes,
asked. Teichoic acid is for the attachment. Teichoic acid is for the attachment. Guys, remember, teichoic acid is present. It is act like a Fabicol, and it is present in gram positive. Teichoic acid is absent in gram negative. It is absent in gram negative. Sir, outer membrane is absent in gram positive. Why outer membrane is not there? Because it is already very thick. Now your gram negative is very thin. That is why it required outer membrane. Shape, if I talk about, 1 cocci is a cocci, 2 is diplococci, 4 is tetrad, and 8 is sarcina. उसके बाद क्या है? Staphylococci is a bunch shape. Chain shape is streptococci. Rod shape, it is bacilli. Cocobacilli is rod plus cocci. Diplococci, it is of 2 bacilli, and Vibrio cholerae, sir, it is of comma shape. This is a 100% MCQ on 4th of June. Bacterial growth curve, sir. Remember, bacterial growth curve, number of cell. How you have to remember? First is your lag phase. Lag phase mean increase in size. Second is your log phase, that mean binary fission. Lag phase mean increase in size. Log phase mean binary fission. Stationary phase is of spore formation. Stationary phase means spore formation, the Fmge exam question. D for decline phase, that is lysis by the endotoxin. Sporocidal agent, 100% MCQ on 4th of June. Ethylene oxide, it is heart lung machine. Formaldehyde is for OT and what? It is for OT and what? Glutaraldehyde, it is for bronchoscope, एंडोस्कोप एंड लैरिंगो. ये सारे तीनों डालने की चीजें हैं. तो ग्लूटरल में क्या है? डालना है. तो क्या क्या डालना है? ब्रोंकोस्कोप, एंडोस्कोप एंड लैरिंगोस्कोप. ब्रोंकोस्कोप, एंडोस्कोप एंड लैरिंगोस्कोप, सारे स्कोप इसी में डाल देने भाई. आइसोप्रोपाइल अल्कोहल, थर्मोमीटर. सर वरना जो वो नहीं होते, क्वैक्स नहीं होते, वो क्या करते हैं कि जो थर्मामीटर यहाँ डाला वहां डाला, उसी को दूसरे मुंह में डाल देते हैं. बट दे आर क्वालिफाइड, नॉट क्वालिफाइड डॉक्टर्स. Our doctors are qualified doctor and they are well trained in the chanting that thermometer को किस में डुबा के रखना है? Sir, it is your isopropyl alcohol. Never dip it in the alcohol, complete alcohol. They'll take a Ballantine's का bottle and they'll put in there. mix करते. That is isopropyl alcohol. That is isopropyl alcohol. Sir, phenol, it is Dettol. Dettol में chlorhexinol. And Savlon, it is chlorhexidine and citrimide. Next coming, sir, sterilization technique. 100% MCQ. जाओ, 100% MCQ. ठीक है? Done. उसके बाद क्या? ड्राई हीट स्टेरिलाइजेशन, इट विल डू द ऑक्सीडेटिव डैमेज. सर, incineration and hot air oven. Incineration and hot air oven is for the dry heat sterilization. Incineration, guys, remember hospital waste, and what is the temperature used here, sir? It is your 1200 degrees Celsius. Temperature used in the incineration would be 1200 degrees Celsius. Hot air oven temperature is 160 and the time is 2 hours. Hot air oven temperature is 160 for 2 hours. Now, sir, moist heat sterilization. There is a coagulation and denaturation of the protein. Less than 100, more than 100. Sir, less than 100, there will be a pasteurization and inspissation. 100 पे there is a boiling and tantalization. 100 there is a boiling and tantalization. And remember, more than 100 it is autoclave. More than 100 it is your autoclave. Sir, pasteurization of milk is done by 2 methods. Number 1 method is flash method. Number 2 method is holder method. Flash method 72 degrees Celsius for 15 to 20 seconds. Holder method 63 degrees Celsius for 30 minutes. Inspissation, sir, temperature is 80 to 85 degrees Celsius and 20 to 30 minutes for 3 days. Inspissation. Tantalization 100 degrees Celsius for again 20 to 30 minutes for 3 days. Autoclave. autoclave, remember 121 degrees Celsius for 15 minutes into 3 days, for 15 minutes into 3 days. Now remember something, copper penny body is seen in chromoblastomycosis. It is in chromoblastomycosis. Now this flower shape appearance is sporothorax shanky. It is caused by sporotrichosis and spread is by the thorn pick. It is spread by the thorn pick. And remember multiple discharging signs. The discharging lymphatics would be, there will be a scarring like this. Done. This is a case of स्पोरोट्राइकोसिस और रोज गार्डनर्स डिसीज. सर डीप माइकोसिस की बात करेंगे तो हिस्टोप्लाज्मोसिस के अंदर क्या याद करोगे? डार्लिंग. कैसे याद करोगे? डार्लिंग. आंखों से आंखें चार करने दो, आ जाओ गौतम नगर, हमको भी तुमसे प्यार करने दो. डार्लिंग डिसीज क्या है? डार्लिंग caused by histoplasm capsulatum. and डार्लिंग को चिट्ठी कैसे जाती थी? कबूतर के थ्रू जाती थी. क्या बोलते हैं? कबूतर आ आ आ, कबूतर जा जा जा, पहले प्यार की पहली चिट्ठी साजन को दे आ, कबूतर जा जा जा, कबूतर आ आ. और डार्लिंग को क्या पसंद है सर? टीवी देखना. डार्लिंग को क्या पसंद है सर? टीवी देखना पसंद है. तो या था इट रिसेंबल द टीवी. डन. ब्लास्ट होते हैं सर नॉर्थ अमेरिका में. ब्लास्ट कहां होते हैं? नॉर्थ अमेरिका में. कैसी अपीयरेंस दिखेंगी? फिगर ऑफ 8 अपीयरेंस. इट इज फिगर ऑफ 8 अपीयरेंस. पैराकोकिडोमाइकोसिस, साउथ अमेरिका's डिजीज. इट इज कॉज्ड बाय ब्रासिलेंसिस. इट इज कॉज्ड बाय ब्रासिलेंसिस. और यहां पे मिक्की माउस अपीयरेंस और पायलट व्हील अपीयरेंस इज सीन. Candida albicans, Raynaud Brody's phenomena seen. And guys remember oral thrush and vaginal candidiasis. Lab diagnosis, it is SDA, Saburad, dextrose, agar. Cryptococcus neoformans. Aerosol transmission to the pigeon feces. And remember most common cause of meningitis in the HIV positive patient would be your Cryptococcus neoformans. Cryptococcus neoformans. And remember sirs, your tinea versicolor. Tinea versicolor, it is caused by Malassezia furfur. It is caused by Malassezia furfur. 100% MCQ on 4th of June. Scales plus 10% QOH mount will give spaghetti and meatball appearance. But if you see these scales on the Woods lamp, tinea versicolor will show you golden yellow fluorescence. It will show you golden yellow fluorescence. Golden yellow fluorescence. Sir, treatment is selenium sulfide. ट्रीटमेंट इज सेलिनियस है. पीड्रा दो थे, ब्लैक पीड्रा, व्हाइट पीड्रा. पीड्रा ब्लैक पीड्रा इज बाय पीड्रा हॉटी. और व्हाइट पीड्रा कैसे याद करा था? बिजली बाबूजी जरा धीरे चलो, बिजली गिरी जरा बिजली गिरी, और इस पे गिरी उस पे गिरी, किस पे गिरी? सब पे गिरी. ट्राइकोस्पोरॉन बिजली. ऑक्यूपेशनल डिजीज में फार्मल टाइप 3 हाइपर सेंसिटिविटी. डन. नाउ सर inclusion body is a 100% exam MCQ. Inclusion body, intracytoplasmic inclusion body, sir. Number 1 is a Negri body. Negri body is seen in rabies. Guarneri body is seen in Vacciana. Paschen body is seen in variola. And Bollinger bodies are seen in foulpox. Henderson-Peterson body is seen in molluscum contagiosum. It is molluscum contagiosum. Now intranuclear inclusion bodies. Cowdry type A, it is herpes virus, yellow fever virus, cowdry type A plus also Tories bodies are seen. So yellow fever virus में दो देखने मिलते हैं तुम्हारी. Yellow fever, sorry, your cowdry type A and Tories body. Cowdry type B is seen in adeno and polio. Now sir, remember something which is very important. That is polio. Sorry, Tora. Chickenpox is caused by HHV3. Chickenpox is caused by HHV3. If there is a reactivation of herpes virus, it will lead to shingles. There is a dermatomal involvement. Now, cytomegalovirus, you will see owl eye appearance. You will see what? Owl eye appearance. Sir, Epstein-Barr virus will lead to Burkitt's lymphoma, nasopharyngeal carcinoma, oral hairy leukemia, infectious mononucleus, also known as kissing disease. ये कैसे कैसे ट्यूमर है? एक ब्लैडर का ट्यूमर है, किसका किस ट्यूमर? और बिनाइन ट्यूमर है. यहाँ पे भी इन्फेक्शियस मोनोन्यूक्लियोसिस. लाइक बुर्किट्स लिम्फोमा ट्रांसलोकेशन इज बिटवीन द 8-14. कैसे बोला? 8-14. दिस इज अ ट्यूमर ऑफ जॉ. बुर्किट्स लिम्फोमा इज अ ट्यूमर ऑफ जॉ एंड यू विल सी व्हाट? स्टारी स्काई अपीयरेंस. यू विल सी सर व्हाट? स्टारी स्काई अपीयरेंस. उसके बाद है HHV8, दैट इज योर कापोसी सार्कोमा. HHV, it is Kaposi sarcoma, common in HIV positive patient. It is common in HIV positive patient. It is a most vascular tumor, that is why biopsy is contraindicated. Now, sir, we are going to the 5th day disease. Parvovirus B19 will lead to 5th day disease, that is slap cheap appearance. That is your slap cheap appearance. Slap cheese appearance. ठीक है, ठीक है, चलो उसके बाद दोस्तों आगे पढ़ेंगे हम हमारा कॉक्सकी वायरस, पक्का 100% एग्जाम क्वेश्चन फॉर कॉक्सकी वायरस A and B, it will lead to what? hand foot mouth disease. उसके बाद है सर ऑर्थोमिक्सोविरिडी फैमिली, इसमें H5N1 is for the bird flu, H1N1 is for the swine flu. H5N1 bird flu, H1N1 swine flu, and drug of choice would be your oseltamivir. It is your oseltamivir. Dun. Next, sir, coming your mumps. Mumps is a bilateral parotitis. There is a bilateral parotitis, unilateral oophorytis or unilateral orchiditis. Measles is a 100% exam question. This is a measles rash, and measles में देखने मिलता है complication. Most characteristic would be your Koplik spot, and this is seen in the lower, opposite to the lower second molar tooth. Rubella, or is also known as German measles. It is infectivity period 1 week before rash, 1 week after rash, and remember Forchheimer spot is seen on the uvula, and blueberry muffin rash is seen. उसके बाद क्या है? Congenital rubella syndrome. The mnemonic is CHD, cataract, heart disease, and deafness. That is your sensorineural hearing loss. Congenital rubella syndrome, it is your cataract, heart disease, and congenital rubella syndrome. Sir, coming to the next thing, that is your rabies virus, 100% exam question. Single standard RNA patient present with the hydrophobia. A rabies virus patient would be presenting with the hydrophobia. It will be presenting with the hydrophobia. And remember your diagnosis. Antemortem diagnosis mean a person is alive. In that case, you will see negri bodies where? In the corneal smear or the nape of neck. Corneal smear or the nape of neck. Heart disease की बात करें, PDA, patent ductal arteriosus. Postmortem diagnosis will be in negri bodies का कहाँ पे होगा? Hippocampus. Postmortem diagnosis will be in the hippocampus. Answer, dose of rabies immunoglobulin in the human rabies would be 20, and if it is equinovirus मतलब घोड़े वाला है तो 40 unit per kg. Sir, post exposure prophylaxis and pre exposure prophylaxis of the rabies. Remember, post exposure it is 0, 3, 7, 14, 28. That means 0, 3, 7, 14, 28. 0, 3, 7, 14, 28. Pre-exposure would be 0, 7, 21, 28. Now, sir, next important thing we are going to study is this. Water lily sign is seen in hydrated cyst, and it is found by Echinococcus granulosus or dog tapeworm. Done. Then something, this is an egg of Echinana. Trematode is tree like. पत्ते टूटते हैं ना, पेड़ से क्या टूटते हैं? पत्ते. This is like a, ठीक है, trematode, ठीक है, leaf like suckers present. Cystosome is very important. Number one cystosome is cystosome hematobium. Remember, cystosome hematobium has having terminal spine, and this terminal spine will injecting in the bladder, and there will be hematuria. There will be cystosome hematobium will lead to hematuria. It will lead to hematuria. Mansonia, man की spine कहाँ पे होती है? Lateral spine is present, and guys remember the egg is having lateral spine. This is Mansonia का अंडा. किसका अंडा है? Mansonia. सर Japonicum, जापान वालों को कैसा है? Cystosome japonicum. Remember, there is a side lower hook is present over here. This is egg of Japonicum. Then nematode is a large intestine nematode. Trichuris trichura is also known as whipworm. So Trichuris trichura is also known as whipworm. You have to remember Trichuris trichura, whipworm. Egg is of barrel shaped or dumbbell shape. Trichuris trichura, coconut cake like rectum is seen. What is seen, sir? Coconut cake like rectum, and also it lead to iron deficiency anemia. Antrobius, you remember from your early childhood, there is an intense itchy pruritus, perianal pruritus after eating the sugar, and that is caused by Antrobius vermicularis. It is also known as pinworm. This is a plano-convex egg of the pinworm, and this is Trichuris trichura. Trichuris trichura. Then coming small intestine nematodes, sir, Ankylostoma duodenale, also known as hookworm. और हुक सर पैरों में चिपकती है, इसीलिए पेनिट्रेशन ऑन द फुट थ्रू द स्किन। और इसमें अंडे कैसे होते हैं? चांदी के अंडे होते हैं। कैसे होते हैं? चांदी के। एनकाइलोस्टोमा ड्यूडिनली, और इट इज आल्सो नोन एज हुकवर्म। चांदी के अंडे प्रेजेंट होते हैं। तो क्या बोलता है? चांदी जैसा रंग है तेरा, सोने जैसे बाल, एक तू ही धनवान है गोरी, बाकी सब कंगाल। और एनकाइलोसोमा ड्यूडिनली के अंदर देखने मिलता है हुक टाइप होता है चैंडलर सिंड्रोम। कौन सा है? चैंडलर सिंड्रोम। दोस्तों यहां एस्केरियासिस, एस्केरियासिस, सोने के अंडे मुर्गी कहां से देती है? एस से देती है। एस्केरियस के अंडे कैसे हैं? सोने के अंडे हैं। तो क्या बोला? ये दुनिया पित्तल दी, ये दुनिया पित्तल दी, मैं बेबी डॉल में सोने दी, ओ बेबी डॉल में सोने दी। Eggs are ingested with the contaminated food and water, sir. It can lead to intussusception, most common cause of bleeding in the children. Now, sir, Mucheria bankruptcy will lead to a filariasis. It will lead to filariasis and your hydrocele. चलो जी, आ रही नीचे की फाइल कहाँ गई? इंपॉर्टेंट वाला खुल जा, सिम सिम, डन 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 डन। नेक्स्ट सर, next thing you have to remember is IgA, IgG antibodies. Just antibodies you need to remember. IgG is having G1, G2, G3, G4. All the antibodies can pass through placenta except G2, sir. G2 cannot pass through placenta and is a marker of chronic infection. Then who is a marker of acute infection, sir? It is IgM. And IgG, only antibody, pathochanting we have studied, only antibody which acts as an opsonine, sir, that is IgG. Now, sir, IgA is a dimer. It provides local immunity. One thing you remember, Ig is present in all the secretion except CSF. Why? Because it cannot cross blood-brain barrier. And most common type of immunoglobulin deficiency, it is of IgA, sir. IgM is having maximum molecular weight. IgM is having, sir, maximum molecular weight, and it is a pentamer molecule. Previous year question. First antibody to be synthesized in the immune response, it is your IgM, and it is a marker of acute infection. Done, sir. उसके बाद IgD क्या है? IgD, it helps in IgD, it is present on B cell. It is present on B cell. It is help in antigen recognition. तो क्या बोलता है? मैं ढूंढने को जमाने में जब वफा निकला, पता चला कि गलत लेके मैं पता निकला। IgD is present on B cell, helps in antigen recognition. Sir, IgE recognize the antibody, and IgG is a marker of type 1 hypersensitivity. Type 1 hypersensitivity. Now, sir, इंपॉर्टेंट टेस्ट से ज्यादा जरूरी है तुम्हारा इंपॉर्टेंट मैक्रोफेज, ब्लड मोनोसाइट, बोन ऑस्टियोक्लास्ट, लीवर कफर सेल, लंग एल्वियोलर सेल, एंड रिमेंबर किडनी मैसेंजियल, ब्रेन माइक्रोग्लिया, स्किन लैंगरहैंस स्प्लीन, लिटोरल प्लेसेंटा, हॉफर एंड टिश्यू हिस्टियोसाइट्स. डन डना डन. सर, हेयर वी कंप्लीट आवर महा चैंटिंग फॉर द 4th of June. अब खत्म कर दी है, इससे ज्यादा अब कुछ मत करो, बाकी तुमको जो आता है वो कर लो. हमारी तरफ से इट इज डन डना डन डना डन. So guys, love you all. Keep on saying I will pass, 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 I will pass. Dun dana done. Also guys, queries about the admission in NLC, please remember, online batch is going to start from 5th of June and offline batch is going to start from 20th of June. In Hyderabad also it is going from the 25th of June, and the 5th of June we are starting in the Calicut. Any inquiry related to the NLC, please contact this number 777003686. And guys, do follow us on Instagram P Jamwal 7 Dr. Ashish next. Please follow us on Instagram for the more update, more interesting sessions coming for all of you. Love you all. मजा आ गया. This is a longest session in the history of any YouTube
Almost
live
8
till
hours.
now. Now, sir, 10 hours. We are starting at 2 p.m.
हाँ तो 8 hours
8 hours. It happened like 8-hour session right now, and from morning 7 a.m. we are taking class. So it is
Yes.
approximately how many hours, sir? 15.
7 to फिर 15 घंटे
15 घंटे. So this is my highest record of my life. I have taught for 15 hours.
Yes.
ठीक है.
बस 1 घंटा रह गया. I taught 16 hours.
तो 15
And
कोई
I
बात
said
नहीं.
कि हाँ, मेरा रिकॉर्ड है अभी
15
बस
hours.
1 घंटा.
ठीक
1
है.
साल में आ गया तो
एक-
अभी अगले 3-4 महीने में वो भी हो जाएगा. ऐसा
So-
करिए ना, रशिया जाएगा फ्लाइट के द्वारा फिर यहाँ क्लास करिएगा ना. अच्छा ये पूछ रहा था बार बार काई स्क्वायर ले भाई ले देख. इफ यू आर गेटिंग अ क्वालिटी, तो रिमेंबर क्वालिटी जब भी वर्ड आता है तो नो डाउट अबाउट चाइनीज क्वालिटी. चाइनीज कैन बी ओरिजिनल, एडिडास कैन बी एडिबास. तो क्वालिटेटिव विल यूज काई स्क्वायर टेस्ट. अब सही है भाई. और काई स्क्वायर में क्या होती है, 2/2 की टेबल होती है ऐसे, पास फेल फिर स्टडी नो स्टडी. तो वेर यू सी दिस टेबल पास फेल परसेंटेज या नंबर, दैट इज योर काई स्क्वायर. बट व्हेन यू गेट अ मीन वैल्यू, मीन एवरेज, दैट इज क्वांटिटी. एंड व्हेन देयर इज अ क्वांटिटी विल यूज स्टूडेंट टी टेस्ट. खत्म. स्टूडेंट टी टेस्ट. एंड इफ देर आर सेम ग्रुप सेम पेयर है, सेम ग्रुप, बस बिफोर एंड आफ्टर, अभी या बाद में, तो पेयर बनेगा. तो याद करना, जोड़े क्या होते हैं, पहले भी साथ है बाद में भी झगड़ा करते हैं, अलग होते हैं, फिर तो पेयर टी टेस्ट क्या लगाएंगे, पेयर. बट इफ देयर इज व्हाट, इफ देयर इज टू डिफरेंट ग्रुप्स, टू डिफरेंट, देन विल यूज अनपेयर्ड टी टेस्ट. खत्म है, अनपेयर्ड. एंड इफ मल्टीपल पीपल दे कैन नॉट कम इन अ bus in a unicycle, they need a bigger vehicle like ANOVA. So ANOVA. So ANOVA is for multiple group. I hope it will solve the question. तो multiple group दिए ANOVA. If there is two different group, unpaired t test. Same group आगे पीछे ऊपर नीचे दाएं, मतलब क्या है, ग्रुप सेम है, बस हालात बदल गए, वक्त बदल गया, जज्बात बदल गया, लेकिन ग्रुप नहीं बदला. ठीक है. So that is called as the paired t test. खत्म. Done. So today's session is already there on the YouTube. You can watch it anytime. There is no problem. And just give your best. We'll take a best of luck session in which we'll give tricks and techniques how to pass. कि क्या लगाना है. And I will give you a cheat code to pass and give you the confidence boost. A secret technique to pass without having to worry much. Okay? वो मैं बताऊंगा कल, आज नहीं. ठीक है. तो कल रेडी रहना. Around 6 PM exec will post. Around 6 PM, ठीक है. And my mother will come, entire team will be here. We'll all wish you best of luck, and then we'll wrap up the session. Take early sleep. आज चाहे तो कम सो लेना, पर कल अच्छे से सोना है. कल 8 hours sleep का टारगेट रखो. कल 10 PM सो जाना, और सुबह 6 AM 5 जो भी है, wake up and go to the exam center. Very thank you to all of you. Just give your blessings after passing. That's very important. Okay. ये कौन पारस की दीवानी है, स्वीटू चौधरी तब से लव यू बोल रही है.
दीवानो मेरे मुंह ना लगो, मेरे दीवानो मेरे मुंह ना लगो.
हाँ तो प्लीज करना.
भाई एक फोटो लूंगा बढ़िया अपने रिकॉर्ड के साथ. ठीक है. 15 hours. It is a great achievement for me. 15 hour क्लास. वाह, क्या बात है. और मतलब सचो जिस गुरु ने सिखाया उसी के साथ ही बैठे हुए हैं. भाई क्या बात है. लव यू ऑल.
बाय.
और कहते रहिए आई विल पास. ये हेल्पिंग हीलिंग हैंड रुकने नहीं चाहिए दोस्तों. हम तुम्हारी मदद कर रहे हैं, आगे प्लीज और लोगों की मदद करो who actually needs you guys. Get pass soon and change this chain जिसमें you have to perform on the front foot. ठीक है. So guys, love you all. We all are waiting for you in Delhi. Soon you will be passing, you will be texting us, you will be coming to Delhi. Your shield and certificates are waiting in NLC. जिंदगी गले लगा लूं तो गले लग के आराम से एकदम इतना अच्छा लगेगा. ये परिवार, हमारा परिवार सबसे बड़ा परिवार है सर. हमारा परिवार पूरे इंडिया में है. हर स्टेट के बच्चे वॉचेस अस, इवन इन द अब्रॉड पीपल आर वॉचिंग अस. तो इतना बड़ा परिवार है ना, मतलब कोई चीज कहते क्या चाहिए ना, कुछ नहीं चाहिए बट इतना बड़ा परिवार चाहिए यार.
ये बहुत बड़ा परिवार है.
परिवार
हमारे क्या है, छोटे बच्चों की तरह है, भाई बहन की तरह है ना. पारस
नहीं,
तो
परिवार में दोस्त भी होते हैं भाई, भाई बहन वाली क्या बात है इसमें यार।
परिवार में वाइफ भी तो होती है ना, बीवी भी होती है, सालियां भी होती है, साले भी होते हैं, पूरा मत माना करो, इसको नेगेटिव ले गया। परिवार बोल रहा है, फिर कह रहा है अच्छा
बाबा दादा
इस रिश्ते को मैं क्या
की-
नाम दूं, इस प्यार को मैं क्या नाम दूं। यार रिप्लाई भाई मैं दिन रात रिप्लाई करता हूँ, थोड़ी देर चैंटिंग में आके बैठ गया, रिप्लाई नहीं किया होगा।
हाँ।
सार्थक आई एम डूइंग माय लेवल बेस्ट भाई। एडमिट कार्ड we did so much calling etc and lots of people got admit card even now 6 o'clock they got
Yeah.
admit card
देखो।
so by morning also lots of people will get जिनका थोड़ा सा अटका हुआ काम था, so I think maximum people will get admit card by tomorrow। okay?
एक लास्ट गाना इनके लिए, फिर स्ट्रीम बंद कर देना भाई। मेरा फेवरेट है वो, मैं लास्ट चैंटिंग में जरूर गाता हूँ। परदेसी परदेसी जाना नहीं हमें छोड़ के, ओ हमें छोड़ के, परदेसी मेरे यारा वादा निभाना, हमें याद रखना कहीं भूल न जाना,
और पे मत चले जाना, किसी और प्लेटफॉर्म पे इंटरव्यू मत दे आना, सीढ़ी चढ़ के या आरबीसी फॉर्मेशन साइड में, या फिर वो कहते हैं ना वो सर्जरी करते हैं एब्सिस सिस्ट ड्रेनेज, वहां मत पहुंच जाना।
दोस्तों परदेसी परदेसी जाना नहीं हमें छोड़ के, हमें छोड़ के, परदेसी मेरे यारा वादा निभाना, हमें याद रखना कहीं भूल न जाना, परदेसी परदेसी जाना नहीं हमें छोड़ के, हमें छोड़ के, परदेसी मेरे यारा वादा निभाना, हमें याद रखना कहीं भूल न जाना, परदेसी परदेसी जाना